begin our meeting today by paying our tribute to our dear colleague in the House of Representatives who joined our creator yesterday, September 8, 2020, Representative Maria Bernardita B. Ramos, or we call her Tita Ditas, as we fondly call her, of the 2nd District of Sorsogon, is an active member of the Committee on Health. She reportedly succumbed to complications triggered by COVID-19. We will surely miss our dear colleague, Representative Ditas Ramos, yet we celebrate her life as a staunch advocate for the people's health and welfare. We honor her with a greater commitment in our quest for a humane society where people's right to health may be fully realized. I invite everyone for a moment of silence and prayer for our dearly beloved Tita Ditas Ramos. May I request Representative Nikki Villago to lead us on prayer.
In the name of the Father, of the Son, of the Holy Spirit. Amen. Eternal rest grant unto her, O Lord, and let perpetual light shine upon our colleague. Lord God above, we, your children, kneel before you today in reverence. We know you're the greatest and you're the King of all kings. So we pray you uplift our heart and soul so that we will cast away our sorrows, O Lord. No one dies without you, knowing thus we commit her to you. In our meeting for today, we ask you to preside over us and our labors and to bless all our endeavors today. We thank you, Lord, for everything that widens our knowledge and equip us more fully for the task ahead. Give us the wisdom, the prudence, which will enable us to live our life well. Increase our patience and understanding to build a community united in harmony of love and service. Watch over us always and guide us. Help us to share a loving concern for each other at all times. Amen. In the name of the Father, of the Son, of the Holy Spirit. Amen.
Amen. This meeting is now called to order. Representative Gato.
Madam Chair, I move that the calling of the roll be dispensed with.
There's a motion to dispense the calling of the roll. Can I hear a second?
Second the motion.
Duly seconded. Is there any objection? Hearing none, the motion is approved. Once again, good morning and welcome to the Committee on Health pre-budget briefing of the Department of Health. We shall devote our time this morning on the proposed 2021 budget of the Department of Health, and the committee would like to thank the Honorable Secretary Francisco Duque III and his party for gracing our meeting today. It is incumbent upon the Committee on Health to look into the budget of the Department of Health in the exercise of its oversight function. For one, the committee needs to ensure that congressional appropriations, the people's taxes, were properly implemented based on the intent and purposes for which such funds were allocated. If there are so-called hitches on the expenditures for health programs, projects, and activities, it is likewise incumbent upon this august body to determine the circumstances surrounding it with the end in view of coming up with a sound budget. Of particular interest to the members of the committee on the 2021 proposed DOH budget would certainly be on the COVID-19 response and public health emergency preparedness. This is both an immediate and strategic concern arising from our current experience with the dreaded disease. As we all know, health security is essential to economic security and development. As the committee looks into the essential programs and services under the Department of Health and its attached agencies, especially on communicable and non-communicable diseases, it is imperative to determine whether the agency has the capacity to carry out its objectives. As such, The development of health facilities and health or human resource for health are critical factors beyond the figures that will be presented. On top of all health programs, projects, and activities, and the corresponding budget proposal for its implementation, the most important matter that this august body must ascertain is the people's access to essential medicines and health services. On this, the committee wished to be apprised on the implementation of the Universal Healthcare Act, especially with respect to primary health care and the health insurance. Lastly, we would also want to find
Yes. Ma'am Rona, Pascal.
We cannot hear you, Madam Chair.
sorry. Lastly, we would also want to find out if the TB law, cancer law, mental health act, and other laws that were passed by this committee have been adequately funded. Without further ado, the chair would like to, before I recognize our honorable secretary, I would like to recognize first the presence of our members. Who's joining us this morning, Representative Henry Owaminal, our Deputy Speaker, our Vice Chair Marilu Arroyo, Representative Adrian Ebcas, our Vice Chair Ruth Mariano Hernandez, Representative Alberto Pacquiao, Representative Nikki Villago, Representative June Gato, Representative Diego T., Representative Dalia Loyola, Representative, our Vice Chair Sean Ako, our Vice Chair also Representative Michael Defensor, Representative Cheryl Deloso Montalia. Let me check in the gallery who else are joining us. We have Representative Stella Kimbo from the minority. Representative Baby Arenas, our Deputy Speaker.
Present, Madam Chair.
Representative Ding Swansing, our Vice Chair.
Present, Madam Chair.
Alex C. Theodore. Yes, guys, I'm checking the gallery view so I can recognize you. From the minority, we have Representative Janet Garin, our Deputy Senior Minority Leader. Representative Maitet Colyantes, our Vice Chair Maricel Nagaño. That's all. Ma'am Sylvia, can you recognize the resource persons present today?
Yes, ma'am. From the DOH, we have Secretary Francisco Duque. We have USEC Lilibet David. We have Director Rose Liquete. You have USEC Eric Domingo, Dr. Celia Carlos, Director Richard Albornoz, RD Valeriano Jesus Lopez, RD Emilia Monique Quimpo, Dr. Maria Soledad Antonio, ASEC Maylin Beltran, USEC Roger Tongan, Dr. Annabel Yumang, RD Cesar Pasion, RD Ruby Constantino, Dr. Beverly Ho, Dr. Nicolas Luterio, Director Yanita Gorgolon, Director Eric Tayag, USEC Carolina Vidal Taino, SVP Nerissa Santiago of PhilHealth, Director Maria Teresa Vera, Dr. Arnel Rivera, Dr. Mario Baquilod, RD Marlene Convocar, RD Rio Magpantay, USEC Mario Villaverde, RD Corazon Flores, and USEC Maria Rosario Vergere. If I have missed somebody, maybe we could recognize them later. Thank you, ma'am.
Thank you, Ma'am Sylvia. I'd like to recognize also the presence of Representative Samantha Vargas Alfonso. So for orderly proceedings, we would like to finish first the presentation of the Department of Health. Then we'll recognize the members who wishes to ask questions. Secretary Duque, are you now ready?
Good morning. Thank you very much, Chairperson Helen Tan of the Committee on Health, as well as the distinguished members of the same. In behalf of the Department of Health, I convey our warmest greetings to all the honorable members of the Committee on Health. And we are uh, we are going to present the DOH 2021 budget proposal. And with the permission of the chair, may I request USEC Mario Villaverde to begin with the presentation of our budget proposal for calendar year 2021. Thank you, Madam Chair.
Yusek Villaverde, you have the floor.
Magandang umaga po sa inyo, Your Honors. Good morning to the Honorable Chair of the Committee on Health, Congresswoman Helen Tan, and the rest of the members of the House of Representatives and my colleagues in the Department of Health and our attached agencies. I will be presenting the DOH budget proposal based on the 2021 National Expenditure Program, beginning with the highlights and major trusts of the proposed budget. And I will follow this up with the physical and financial performance of the DOH from 2018 to 2019, as well as our 2021 targets. Now, the next slide will show you that beginning in 2014, the DOH budget has increased significantly with the syntax law. The 2021 budget, as proposed, is 27% higher than the 2020 budget level. This is mainly due to the increase in the allocation for HRH deployment program from 9.95 billion pesos this year to 16.6 billion pesos in 2021, as well as the increase in the medical assistance to indigent patients from 10.5 billion this year to 17.3 billion proposed for next year. The next slide will show you the particulars of the 2021 National Expenditure Program. 127.29 billion pesos, or about 62% of the entire budget of the Department of Health, is proposed for the Office of the Secretary. 490 million goes to the National Nutrition Council as an attached agency, and 75.4 billion pesos, or 43%, allocated for the attached agencies or corporations. Please take note that here, the PhilHealth gets the next biggest share in the 2021 National Expenditure Program, next to the DOH, Office of the Secretary. In this case, PhilHealth will get 35% of the proposed budget. The next slide will show you the bulk of the budget for the DOH Office of the Secretary, which is actually mostly intended for operations, specifically to ensure access to promotive and preventive healthcare services at 40% of the budget. This is followed by access to curative and rehabilitative healthcare services at 37%. Now, there are other specifics for organizational outcome. Number one, this is actually for access to promotive and preventive care. You can see the figures there. Then for organizational outcomes, number two, this is access to curative and rehabilitative healthcare. And outcome Organizational outcome number 3 is access to safe and quality health commodities, devices, and facilities. This is generally the regulatory function of the DOH. And the organizational outcome number 4 is on social protection. Now, the next slide will show you that approximately 48% of the 2021 National Expenditure Program will be for personal services. This is followed by MOOE at 44% and capital outlay at 8% of the total budget. So you can see from the table the details of these three major expense class. Now, the next slide, I will show you the framework by which we are performing within the health sector. This is the department's vision for Filipinos to be among the healthiest people in Southeast Asia by 2022 and in Asia by 2040, by leading the country in the development of a productive, resilient, equitable, and people-centered health system. Now, the salient feature in the next slide, the salient features of the 2021 DOH budget. The next slide, please. Yeah, thank you. So let's now proceed with the salient features of the 2021 DOH proposed budget. In the National Expenditure Program for 2021, one highlight is the merging of certain budget line items of some programs under the Disease Prevention and Control Bureau to streamline our PAPs, or the programs, projects and activities, for more flexibility. Like for example, here we have merged the line item on national immunization, family health, nutrition, and responsible parenting to one line item, which will now be family health, immunization, nutrition, and responsible parenting. Now, the different communicable disease control programs with several line items like elimination of diseases, TB control, rabies control, and prevention and control of other infectious diseases have been merged to have one single line item, which is prevention and control of communicable diseases. This is basically to gain more efficiency in the expenditure program. And then we have proposed creation of two new budget line items. This is a big proportion of our commodities, the procurement and supply chain management service, as well as the mandated activity or function under the universal healthcare, which is health technology assessment. This has both been given budget for next year. Now, the priority categories in the 2021 National Expenditure Program can be divided into three main priorities. The first priority is on Universal Healthcare Act implementation, as well as the activities related to COVID initiatives. The second priority will be all the other health-related laws that were passed by Congress in the last 2 to 3 years, so that they are eventually funded and implemented by next year. Priority 3 are all the other activities with urgent and compelling needs. Now, I will discuss in more detail the different priority in the next slides. Yeah. For priority 1, this is the implementation of the Universal Healthcare Act. You can see here the budget for the HRH deployment program, increasing from 9.95 billion to 16.58 billion. This is generally to be used for the deployment of additional human resources for health at the local government units. This will include doctors, nurses, midwives, dentists, pharmacists, nutritionists, dietitians, medical technologists, and physical therapies across the country. This will also provide some scholarship grants to deserving students that intend to go into the health professions, particularly in fields that we have some major gaps. No? So the next slide will show you one other big item, which is the Health Facility Enhancement Program. This is budgeted at 4.78 billion pesos, mostly for equipment to equip the facilities that we have constructed, improved, or renovated in the last few years. Now, the next slide will show you other initiatives to implement the Universal Healthcare Act, like, for example, the Local Health Systems Development and Assistance at 350 million, the Pharmaceutical Management at 280 million pesos, the Health Technology Assessment, which is a new line item, and we provided some startup fund for next year. And then the health sector research development, this will be related to mostly research on universal healthcare and the COVID initiatives. The next slide will show you that we also gave priorities to the health information technology, the HRH, institutional capacity management, and the regulation of health facilities and services. We also provided three major population-based healthcare packages, which are included in the universal healthcare, mandated to be assisted and capacitated by the Department of Health. First is the epidemiology and surveillance, the health emergency preparedness and response, and health promotion. Also, the next slide will show you public health management, environmental and occupational health, and collectively, family health, immunization, nutrition, and responsible parenting, which will amount to 12.2 billion pesos. But we have shown you here the existing line item, which will be merged to just one line item. The next slide will show you the different line items currently under prevention and control of communicable diseases, which eventually will be merged into one line item as we have proposed in the NEP 2021. This will collectively amount to 6 billion pesos for the prevention and control of communicable diseases. Now, I will go to the next sets of priorities. This is on the COVID initiatives and resilience. Operation of the National Reference Laboratory, the National Immunization Program, the prevention and control of other infectious diseases, including emerging infectious diseases, and foreign assisted projects that have been aligned to the COVID-19 response. So most of the capital investment for COVID-19, including the improvement of our national reference laboratories, our prevention of and control of emerging diseases have been incorporated into these foreign assisted projects from the World Bank and the ADB. The next slide will also show you the Quick Response Fund, the operation of our blood centers and national blood voluntary services, and another new line item, which is on the procurement and supply chain management, amounting to 490 million. Now, there are other health-related laws that we need to provide budget, and we are providing you here with the list, no? Prevention and control of non-communicable diseases, assistance to indigent patients, and then we have provided some increase in the operations of the DOH hospitals in Metro Manila, as well as the operations of our regional hospitals and medical centers. For priority 3, this is based on urgent and compelling need. This is on the operation of our dangerous drug abuse and treatment and rehabilitation centers, amounting to 1.28 billion. In the next slide, I will show you the second part of our presentation. This is on the 2018 to 2019 performance and our proposed targets for 2021. Now, the next slide will show you the physical performance of the Department of Health. The National Health Insurance Program was able to increase the population coverage from 98% in 2018 to 100% in 2019. And we expect to continue the 100% population coverage in succeeding years, since the Universal Healthcare Act has mandated that all Filipinos are now members of PhilHealth. Now, for the medical assistance for indigent patients, there was an increase in patients provided medical expense assistance through our MAIP program, from 1.36 million patients assisted in 2018 to 1.54 million in 2019. Next year, we aim to reach 1.5 million beneficiaries of the medical assistance for our indigent patients. Now, the next slide will also show you our target, our performance and target for women's health. The modern contraceptive prevalence rate among married women is 57% in 2018. However, in 2019, there is a revision in the computation of our modern contraceptive prevalence rate to include all women of reproductive health, rather than basing our performance only among married women, as we have revised. So based on this new definition of the indicator for women using modern contraceptive prevalence rate, we would want to increase from the current 28%, we aim to reach 29% in the succeeding year. Now, in terms of women, percent of women giving birth in health facilities, we are able to increase this by 1% from 90% in 2018 to 91% in 2019. And for 2021, our target is for this facility-based delivery not to go down below 90%. And in fact, we would like to encourage that we are able to reach more women delivering in facilities. Now, for communicable disease prevention and control, one of the key indicators is on the percent of people living with HIV who are given antiretroviral therapy. We are increasing the coverage from 42% in 2018 to 61% in 2019. And we aim to go higher to 90% in the succeeding year. In terms of elimination of endemic diseases, including rabies control, we would like to target more provinces and areas to be declared disease-free from the following: malaria-free provinces from 50 to 60, and eventually increasing this. No? Filaria-free provinces from 40 to 43, and eventually increasing this in 2021. And the rabies-free zones or provinces also increasing. Now, for 2021, we aim to reach 72 malaria-free provinces, 46 filaria-free provinces, and 10 rabies-free zones. For our human resource deployment, we intend to, we were able to deploy the following in 2019: 511 doctors, 18,000 plus nurses, and 4,600 midwives. Also, we have improved the HRH to population ratio, no, in 2019 at 17.5 HRH per 10,000, and a target of not higher than 17 per 10,000. The target is 17 HRH per 10,000. In terms of percentage of priority areas supplemented with HRH, our accomplishment here is 100% of the LGUs have been provided with deployed health personnel. Now, for the health facilities enhancement program, the percent of HPEP projects that started implementation within the year increased from 92% to 92% to 94% in 2019. With the decrease in the budget for 2021 for HPEP, the total number of target projects will decrease to 1,643. Now, for the expenditure performance in 2019, this includes the 2019 GAA and the 2018 continuing appropriations or CONAP, including special purpose funds and automatic appropriations. Now, out of the 110 billion pesos total allotment, we were able to obligate 97 billion pesos or 88%. And out of the total obligations, we were able to disburse 72 billion pesos or 74%. So the disbursement rate and the obligation rate is shown to you here in the slides. I think, Madam Chair, this is the last slide that we have. So thank you po.
Thank you so much, Yusek Villaverde. Is there anyone from the team who would want to present? PhilHealth, sir. Meron po bang presentation ng PhilHealth? Secretary?
Yes, Your Honor, the Senior Vice President is Neri Santiago, who heads also the actuary. I understand that she's on board. Will you please manifest, SVP Neri, if there is a presentation on the part of PhilHealth?
Ma'am Neri?
The chair, good morning. Okay, good morning to honorable members of the Congress. For now, we don't have any presentation for this.
Okay, anyone? Okay, thank you, Ma'am Neri. But stay with us kasi baka meron mga queries our members, no? So thank you again, Secretary Duque. Before I call on the first interpolator, I would like to thank for the Secretary and the team for helping Tita Ditas in facilitating lifting from Sorsogon. Although weren't able to lift her from Sorsogon to Lang Center, the family decided to keep her doon na lang sa Sorsogon. But thank you doon sa lahat ng effort na ginawa po ninyo at naramdaman po ng pamilya ni Tita Ditas yung pagtulong, especially kay Director Balboa of Health Emergency Bureau. Maraming salamat po sa inyong assistance, no? Secretary, last Friday we had a hearing with economic managers, and isa po doon sa naitanong ko ay yung Health Facilities Enhancement Program. So I asked bakit equipment lamang ang bibigyan, and he mentioned the saan program fund ang for the infrastructure. And I asked kung enough ba yon, considering yung ating naging problem with COVID. Syempre hindi enough. So ang isang na reason nila kung bakit mababa, again, is the utilization rate or performance po ng Department of Health. Ano po ang magiging action ngayon ninyo kung papaano natin mai-improve, at nang sa ganon ay bibigyan din po ng mas mataas na pondo ang Department of Health pagdating po sa Health Facilities Enhancement Program? Secretary, you're on mute po.
Yan po. Maraming salamat po, Chair. One of the interventions that we have put in place is the project management team for HFEP, yung projects po, which is being overseen or supervised by our Health Facility Enhancement Program, precisely because we want to accelerate the completion of the pending construction projects of the DOH. But unfortunately, because of the COVID-19 pandemic that started in March, medyo na delay na naman yung mga pagkumpleto ng ating pong mga proyekto dahil po nagkaroon po tayo ng mga quarantine, nagkaroon po ng isolation ang mga construction workers. So isa po ito sa mga kadahilanan, pero ganun pa man ay patuloy po ang pag-monitor ng ating project management team para masiguro na tumatakbo at patuloy po ang pagkumpleto ng ating mga projects.
Secretary, yes, we recognize po yung COVID-19, but as I mentioned po during the budget hearing, since 2014, the first time I joined the budget hearing, yan po palagi ang sinasabi ng Department of Budget and Management when it comes to Department of Health, budget utilization, yung performance. So hindi po siya ngayon lang dahil sa COVID, kundi matagal na siyang problema. Ang isang hinihingi po sana namin, strategiya, papaano natin mapapabilis ang implementation ng maraming programa at proyekto. At isa doon sa naisuggest ko at nag-agree naman si Secretary Abisado ay i-empower natin and strengthen natin ang region. May mga procurement po na po pwede namang i-delegate na sa ating regions na sana ma-consider po ninyo. Ang bulk procurement po still nasa central office, no? So sana po ay mag-improve, no, yung mga strategies na ginagawa. And then yun pong 5 billion na unprogrammed fund, I don't know with my colleagues in Congress, no. So palagi na lang pong unprogrammed, so it's parang they're giving you the flexibility on how to prioritize and where to give the infrastructure. In the previous years, yan po ay naka-line item na, merong nakalist na item. So ako personally as a chair of the Committee on Health, I would like to request na sana hindi yan naka-unprogram, even the equipment, meron na pong mga listahan ang galing sa mga regional offices, baka po pwede na ma-list po yan pagdating po ng GAB, no? General Appropriation Bill. So yun lang Secretary ang request ko na sana tingnan mabuti.
Yes, Madam Chair, maraming salamat po. Doon po sa katanungan ninyo kung ano po ang mga ginagawa ng DOH para mapabilis ang completion rate ng ating po mga projects and mga programs. For the projects sa HFEP po ay bago ko po anyayahan si Director Gorgolon para banggitin ang mga sistema na nakatalaga para po nga mas mapabilis ang utilization ng budget for HFEP. Pero yung po sinasabi niyong pondo, we support it ma'am na sana gawin na lang program, naka-line item imbis na naka-unprogram. We support that position of yours, Madam Chair. It's just that we were told by the DBM that the unprogrammed funds, wala pong kasiguraduhan kasi ito po ay naka-angkla doon po sa collection ng sin taxes at depende po sa kanilang collection performance at mapupuno ang unprogrammed fund, mapupondohan po ang mga proyekto imbis na malinaw po yung panggagalingan ng pondo. So si Director Gorgolon po sa HFEP, pwede bang sabihan mo lang ang ating pong committee ano pa yung mga karagdagan na hakbang na inyo pong isinusulong para po tumaas ang inyong budget performance utilization rate?
Go ahead, Director Gorgolon.
Good morning, Your Honor. Good morning, honorable members of this August body. Good morning, DOS family. Health Facility Enhancement Program Management Office has addressed this low utilization for the last 3 years. So one of the very cognizant strategy is really to strengthen our project management, both at the regional office, as mentioned by our Honorable Secretary, and even for the different DOS hospitals. So we have this regular project monitoring through our real-time submission report. So pinapaigting po talaga ng HFEP. So we are trying to emphasize that real-time reporting is very important because we're tracking the obligation. Second is we emphasize on establishing a very good evaluation of contractors' performance po because there were contractors with a very poor performance na talang that delay and hinder the infrastructure implementation. At the same time, to make sure that regular progress billing is submitted to the procuring entity so that obligation and improvement on disbursement will be achieved. So these are 3 things that we are trying to establish in HFIP Management Office, at the same time coming up with our guidelines. So napapabilis po natin itong ating infrastructure implementation because we have now the guidelines to guide the implementing unit on how we can fast track, especially if it's infrastructure, ano po yung kailangan mga preconditions that should be submitted, because there are times po that if the allocation is available, we cannot implement the project because of the non-readiness of sites. So these are things that we're trying to emphasize, and at the same time for the equipment, we cannot procure the equipment even if it's already funded because of the non-readiness of the area and the manpower who will be using the equipment. So these are things that we're trying to emphasize to the procuring entity, both the regional offices and the DS hospital. Thank you very much and good morning.
Thank you, Director Gorgolon. Secretary, have you considered a convergence program when it comes to infrastructure with DPWH? Because other agencies like DOT, DTI, Department of Education are partnering with DPWH when it comes to validation and identification of the infrastructure, especially the health facilities in different parts of the country. Siguro po, maiiwasan yung problema na may budget allocation and then wala naman palang buildable space. So that's one recommendation I would like to give sana sa Department of Health, that we need to innovate when it comes to program or project implementation. That's all, Secretary Duque.
I agree with you and fully support your position, Madam Chair, and we will look into this and to what extent the DOH can coordinate with the DPWH to better formulate the plans and the implementation of our infrastructure projects. And we certainly support it, Madam Chair. Thank you.
Thank you, Secretary. Okay, our first interpellator is Representative Mike Defensor, our Vice Chair. I just want to remind everyone that you are given 5 minutes to ask question. You have the floor, our Vice Chair, Rep. Mike Defensor.
Yes, Madam Chair, thank you so much. Magandang umaga po sa lahat ng kasama natin, lalo na sa DOH. Secretary, magandang umaga po sa inyo.
Morning, sir.
Good morning, ho. Just to follow up, Madam Chair, on the line of questions that you have doon sa HFEP. Kasi po, Madam Chair, ito pong Universal Healthcare, Secretary Duque, if I'm not mistaken, di ba, based on the PhilHealth budgeting, ay pinapalakas natin yung sektor ng pangkalusugan. In particular, we hope that we could strengthen the public hospitals para maging leverage siya sa mga private hospitals in relation to cost, in relation to health services. Ngayon, tinitingnan ko yung 2018 budget kasi ito yung pinag-usapan natin, and I would like to call your attention, Mr. Secretary. Pag tinignan nyo po yung budget ninyo, for example, Benguet, binigyan nyo yung mga barangay, 150,000, 150,000, 150,000, Sikabayan, Kapangan, Bakun, Kibungan. Pupunta tayo sa Ifugao, in the same manner, si Bongayang, Lokbang, Magulong, Regimental, 150,000. I've already discussed this with a group of the HFEP. Sabi ko, bakit ganun yung inyong direksyon sa Health Facilities Enhancement Program? And again, I look at your budgeting now for this year. I have the list here. And I'll go to, for example, Pangasinan, medical equipment to regional health units, 1 million, 1 million, 1 million. Parang naging tingi-tingi po. Nung tinanong ko po kung anong ibig sabihin nito, ang pagkakapaliwanag sa akin, Mr. Secretary, mga stethoscope daw. At saka kung ano yung mga kailangan. So sabi ko, paano makakatulong to sa ating mga kababayan? I'll go NCR or Quezon City in my area. Medical equipment, 200,000, 200,000, 200,000 to Bagong Silangan, Batasan Lying In, Betico Belmonte Clinic, Escopa Health Center. So, Mr. Secretary, di ba ho dapat the ratio in PhilHealth is 60-40. 60 private, 40 public. Marami pong mga probinsya at saka yung mga district hospitals, wala silang sapat na equipment. Kaya sa akin ho, parang hindi ko from last year and to this year, hindi ako natatamaan dun sa overall policy to strengthen the or to push the universal healthcare program. Pag ganito po yung klase ng budgeting na ginagawa under the Health Facilities Enhancement Program, ito po sana yung chance na malaki pondo natin, mapalakas yung mga unahin natin, provincial hospitals, dahil yung regional naman, no, you have 70 hospitals under your care, then you have the provincial hospitals, then the district hospitals. Wala po tayong ganitong programa sa nakikita ko. I'm sorry to say this, pero dito sa ginawa ninyo, sabi ninyo, let's increase the primary healthcare facility. And if I look at the administrative order that you have, ang parang kine-create nyo lang mga infirmary from the barangay health stations, even dun sa mga regional health stations, if I'm not mistaken, Mr. Secretary.
Salamat po, Madam Chair, Kong Mike. Yung pong universal healthcare, one of the fundamental provisions is really to strengthen the primary care facilities, no? Yung kanila pong kakayahan magbigay ng pangunahin na serbisyong pangkalusugan at tinutulungan po natin ito doon po sa tinatawag natin na pagtatag ng network of primary care providers. So although this is still the mandate of the local government units, so tayo po ay umaayuda lamang sa mga ganitong mga klaseng suporta, yung mga equipment, yung pong mga nabanggit ninyo, at meron pong costing formula na ginamit po ang HFEP at pwede ko pong tawagin si Director Gorgolon para ipaliwanag kung bakit lumalabas pare-pareho lang yung mga support na without due consideration for population ratio, the capacity of the LGU, yung mga mahihirap, kailangan mas malaki ang tulong, dapat mas equitable. Yun po yung sinasabi ninyo, yung pong mga may kakayahan naman, hindi naman dapat pareho ang mga level of support ng ayuda. So yung pong costing formula issue, si Director Gorgolon po, kung mamarapatin ni Chair, tawagin ko lang po muli, Director Gorgolon.
Madam Chair, Secretary.
Go ahead, Kong Mike.
Yes. Ma'am, nakita ko si Rep. Cheryl Deloso. Pupuntahan ko yung last year nila sa Zambales. Hindi po,
Madam Chair, yes.
Mr. Secretary, hindi po dun sa distribution. Dito po sa buong Zambales, sa bawat munisipyo, nagbigay kayo ng 160,000, 150,000. Ang akin ho, bakit hindi natin palakasin yung provincial hospital ng Zambales and or create a district hospital, yung po mga munisipyo na pwedeng magsama-sama, at bigyan sila ng sapat na equipment para maging silang level 1, level 2, o level 3 hospital. Imbis so itong ginawa na meron kayo dito, no, kung Cheryl, tingnan mo to, Narciso, sa San Jose, puro barangay, sa bawat barangay, Dalipawin, Antonio Angeles, San Marcelino, Nagbunga, San Marcelino, Consuelo, siguro mga 100 to. Binigyan ng tiga 150,000.
Yeah. Actually, follow-up question dyan later on, Kong Mike.
Oh, I'm just using it as an example. Dito si Kong Cheryl, bakit hindi yung mga provincial hospitals ng Zambales ang pinalakas maging doon sa kanilang district hospitals? So that kung magkasakit ng tao, pag pumunta siya dito sa barangay na to, walang matutulog.
Kong Mike, just
yes.
want to inform you, you've consumed your 5 minutes. Kindly wrap up.
Ay, okay. Sorry, ma'am. So, yun po, Secretary Duque, and siguro Director Gorgolon can answer that. Why is this the policy of the department instead of making sure that you have hospitals with capability?
Sir, good morning again. Thank you very much. I just would like to emphasize that in terms of the identification of recipient, all the requests from the different stakeholders are being forwarded back to the regional office to have it vetted and review. And the only thing that the Health Facility Enhancement Program is to make sure that these facilities will receive such a very meager amount because of the limited resources. Kaya po, kung halimbawa, hindi po nasali yung mga district hospital, this is because it was not a part of the listing that was submitted to us by the regional office. Dito lang po tayo nagkakatalo because of the limited funding. Like for example, sir, I just would like to emphasize that for 2021, we received a total of 72 billion requests from the different local government units and our hospitals. And then we pegged it at 45 billion because we wanted to prioritize. And then we again asked the regional office to again reprioritize based on the priority that we are trying to set, like equipping, completion, and urgent compelling needs. But we were just given a 4.7 billion medical equipment. So wala po kaming inaalis na site, but we are just trying to make sure na yung mga nirecommend ng region mabibigyan ng kahit konti. So I think that is what we are doing now po. From 45 billion that we requested, only 4.7 billion and medical equipment was provided or recommended by DBM. Kaya doon po kami nagkakaanuhan ng amount. And we had also our historical data that for the several years, at least 150 is already enough or minimum requirement of a barangay health station po. Thank you po.
Director Colon, you started with a 20 billion budget. Last year, naging 8 billion kayo. Ngayon, bumagsak kayo sa 4 billion. Hindi naman po pinupunto yung pagbaba ng pondo nyo kasi I think it is a question of utilization as pointed out by our chair. Ang nangyayari lang po, even in terms of policy, even if you just had 4 billion, I think the focus should have been creating or strengthening first the hospitals sa provincial level and then the district hospitals kaysa kayo bumaba sa barangay at saka sa mga regional health unit stations. For example, balikan ko yung Zambales. Ang ospital ninyo sa Zambales is President Ramon Magsaysay Memorial Hospital, government. Meron po kayo dyan well, ito sa Bataan na naman to, yung Skyline Hospital and Medical Center. Private po yan. Meron po kayong isa pang private, yung Medical Center UniHealth. Private po yun. Meron po Medical Center Inc. Private din po yun.
Kindly wrap up.
Yes. Thank you, Madam Chair. Madam Chair.
Director Gorgolon.
Yes, sir.
I agree with the observation of our Vice Chair, Representative Michael Defensor. No? If you remember, kinol ko yung attention and I mentioned this to Secretary Duque. Hindi ko na siya inabala that time. Pero I think Yusek Tong-an is with us this morning. I saw him earlier no, in the gallery. Sa kanya ko na ibuhos lahat ng galit ko. The way you prioritize your strategy on allocating funds. Kasi you mentioned 150,000. If the congressman, the mayors, or the governors, or the hospital requested something like mga ganito, hindi mo siya bibigyan dahil para lang pagbigyan mo siya. Kung hindi, at the end of the day, ikaw pa rin ang magdidesisyon ano ang mas magiging epektibo o efficient na ibibigay doon sa facility. Should we prioritize the BHS? Should we prioritize the hospital? But again, in compliance sa Universal Healthcare Act, we strengthen the primary healthcare, no? So gusto natin palakasin yung primary healthcare. So yung 150,000 na dinistribute sa mga barangay health centers or RHUs ay hindi siya yung complete na package na kinakailangan ng isang primary healthcare facility. Ang inaas siguro ni Kong Defensor is pag-isipang mabuti, paano mo gagastusin ang kakaunting budget na ibinibigay sa inyo na malaki ang impact sa ating mga mamamayan. So, siguro yun, ito uulitin ko ulit na nasabi ko na ito kay Yusek Tong-an before. Ayaw nating makita na paglabas ng GAA ay uulitin-uli ninyo yung nangyari dito sa pagbibigay ng 150,000 na hindi naman na kumpleto at hindi siya ma-fully utilized. So I think yun yung gustong sabihin ni Kong Mike Defensor, Director Gorgolon.
Ma'am, yes, noted for that. We will review that.
Okay, ayaw namin ng complete ha. Ang gusto namin ay sana ay gagawin ninyo. Hindi pwedeng rason na kakaunti. Yes, reason ng kakaunti ang budget, pero maging sound naman yung budget, no? Maiintindihan ako, as for me, as a representative of my district, kung hindi maibigay lahat, I would understand kasi alam ko kakaunti ang budget, no? Pero nakikita nyo yung sino yung higit na nangangailangan.
Yes, ma'am. Thank you for that.
Chair?
Noted, ma'am.
Chair, yes, thank you very much for reiterating the one of the major thrusts of the universal health care is really to ramp up the capacity of our primary care system, which is the lower level delivery system, which has been really weak for many decades. And but of course, I fully support your position that the prioritization should be more crisp. The prioritization must be very clear. Yung basis, sino ba yung mga, yung equity issue yan eh. Sino yung mga pinakamahihirap na kinakailangan talagang palakasin yung primary care capacity. Dahil ang mangyayari po kung karamihan sa pondo naman, given the limitation, dadalhin po natin sa mga ospital, yung access problem, we're trying to address that through the primary care promotion and development. And that is why gusto natin mga kababayan po natin, meron sila mapupuntahan na mga facilities, yung mga barangay health station, yung po mga rural health units and mga city health centers na kung saan malapit po sa kanilang mga lugar na pwedeng magpakonsulta sa kanila pong mga simpleng mga karamdaman. Hindi na po kinakailangan punta sa ospital at nagiging problema po, nagiging overwhelmed ang ating pong mga ospital, samantalang pwede naman pong kumalinga at mangalaga sa lower level facilities up to the midstream facilities. No? Mahirap po kasi sa problema natin, overly specialized ang ating pong kultura, mga doktor na mga espesyalista, parang yung punang yun ang ating ginagawa at puros po hospital ang kadalasan na ang ating pong pagpapaunlad. Wala naman pong masama doon dahil lumalaki po ang ating population. Pero I think it is a wise and smart principle to adapt, which is embedded in the universal healthcare law, to really strengthen the primary care. So yung local health systems integration, no, yung province-wide, city-wide health integration, I believe is the first step in the right direction. Thank you, ma'am. Thank you, Kong Defensor.
Thank you, Sec Duque. Baka kailangan po ng guidance ninyo. Kasi ang ginagawa nila, let's say the whole package for primary healthcare facility is worth 350,000 to 500,000. What they're doing is just to accommodate the request or to give that specific equipments, hahatiin nila. So gagawin niya 150, 150. So nung in-explain ko kay Yusek Tong-an, pwede naman niyang gawin, hindi kailangan bigyan ang 10 facilities all at the same time. Pwede namang tanungin na ano po ang priorities ng region dito. Dahil dito talaga napakahirap ng access, wala talagang nagpupunta, kailangan ng gamit ng ating mga barangay health workers and mga midwives or nurses. Pwede namang ibigay ng kumpleto yung the whole package, one at a time. Alam na, iintindihan po na hindi kayang ibigay lahat ng pangangailangan. But again, yun, i-reiterate ko, Sec, prioritization, no, at strategies siguro ang kailangan. Anyway, basahin ko lang po yung order of members to ask question. The second one is Kong Ging Swansing, then Kong Cheryl Deloso Montalia. Fourth is Kong Lourdes Arroyo. Fifth is Kong Stella. Then Kong Diego, Kong Hector, Kong Juliet, Kong Joet. Then Kong Janet, Kong June, Kong Ace, Kong Mickey, Kong Uwaminal, Kong Ebkas, and DS Loren Legarda. So I'd like to call on Kong Ging Swansing.
Thank you, Madam Chair. Thank you very much for coming up with this meeting. No, thank you very much. And good morning, Secretary Duque, and good morning to all my colleagues and also to the DOH family.
Good morning, ma'am.
I have two questions lang, Madam Chair, pero medyo mahaba-haba ito. Number one, Madam Chair, is the DOH has earmarked 2.5 billion for the purchase of COVID-19 vaccines. Tiningnan ko po ito dun sa budget ng DOH. If this will be available next year, my question is, ang nakalagay yata dito is unahin yung frontliners. So ang tanong sa DOH, what is your plan for the less privileged countrymen? Will there be a mass immunization? So before you answer, Secretary Duque, I'll move to my second question para hindi po ako maubusan ng oras, kasi 5 minutes lang po ito. When you decided po dun sa unutilized funds na gagamitin for pandemic, natamaan po doon yung mga nakaschedule na construction ng barangay health stations. Alam naman po ninyo na ang barangay health stations is the primary health care unit. No? Ito yung tinatakbuhan ng ating mga kababayan sa barangay. Sana po, bago po kayo nag-decide na tanggalin po yung budget sa BHS because it's unutilized pa, sana po ay review muna ninyo at hindi sana tinamaan yung construction ng BHS. At kasama po doon, hindi po, yun pong pinag-uusapan na 150,000 na equipments para po sa BHS. Marami po naka-schedule for 2020 pero wala pong dumating. Masaya na po sana kami doon sa 150,000 kahit po papano ay matulungan ninyo yung mga barangay health stations na walang laman kahit upuan, kahit bed, wala pong laman. So hinihintay na po namin sana yung 150,000. Ngayon po, so nakuha po ninyo yung pangalawang question, bakit po natamaan yung barangay health stations at saka distribution of equipments and medicines. Gusto ko lang po magbigay ng input dun sa mababang utilization ng HFEP. Masyado pong stricto yung requirements, ang cost po ng unutilized budget for HFEP, lalong-lalo na po yung construction ng BHS, is yung inyo pong requirements na kailangan may titulo ang lupa na ang pagmimiyari ay barangay. In fact po, tumutulong na kami sa DAR para lang ma-comply yung inyong requirements. Sana po ay ma-reconsider po ninyo ito dahil ito po yung cost kung bakit mababa po ang utilization ng HFEP. Sana po ay masagot ninyo itong mga concerns na ito.
Salamat, Chair and Kong Swansing. Tama po kayo, yung una pong budget for the possible procurement of vaccines once it becomes available is 2.5 billion. Pero humingi po kami ng karagdagan para nga po mas maraming mabakunahan. Humingi po kami ng halagang 12.9 billion. At ito po yung sanang pagkakagastusan ng mga cohorts, no? Yung pong medical frontliners, healthcare workers, public health, and hospital healthcare workers. Tapos yung pong mga frontliners, not necessarily directly giving care to COVID patients like yung mga taga BJMP and Bureau of Corrections, yung medical frontliners ng DepEd and DSWD, yung pong ating mga senior citizens at ang ating pong mga mahihirap na mga kababayan, indigent population from 20 to 29 years old at ang iba pa pong mga grupo katulad ng Philippine National Police and Armed Forces of the Philippines na yan po ay inatasan kami ni Pangulong Duterte na i-prioritize po ito. Ang total na bibigyan ng bakuna aabot po ng more or less 20 million. At ang Dalawa pong doses ito ang report po sa akin, at ibig sabihin yan, we will require about 40 million doses. At ang halaga po na kakailanganin, mga 12.9 billion. So patuloy pa po ang amin pakikipag-ugnayan sa DBM kung paano po natin mas mapapalaki o mapapalawig ang mababakunahan. Yung pong tanong nyo sa ang pangalawang tanong nyo po, ibig ko lang pong tawagin si Yusek Lilibeth David or si Director Gorgolon para bigyan po ng mas detalyeng kasagutan. With the permission of Chair Helen. Thank you.
Go ahead, Yusek David or Director Gorgolon.
Director Gorgolon po.
Go ahead, Director Gorgolon.
Yeah. Ma'am, I just would like to emphasize that the procurement of the different medical equipment for the different barangay station was sub-allotted to the regional office. And for 2019, for later release po kasi yung budget, so the SARO was only received by the regional office starting July po. So it will take 2 months to prepare for the procurement. Tapos, yun nga, naabutan tayo ng COVID. So all the money that was intended for the different medical equipment for barangay station is not centrally procured, but it's being sub-allotted to the regional office. So nasa region na po yung pera ng ating medical equipment. And they're trying to fast track the procurement for the BHS po. Thank you.
So Director, hindi yan nagamit sa COVID. Yung
Hindi
mga
po.
okay, sige. Thank you so much. Go ahead,
Madam Chair.
Yes.
I have time pa naman Ang tanong ko lang is yun ang concern ko is sana dun po sa barangay health stations na construction, sana nung nag-decide po kayo na tanggalin yung unutilized budget, sana po hindi natamaan yung BHS na naka-schedule for construction. Ano pong plano ninyo doon?
Director Gorgolon.
Because all the recommendation by the regional office, because we have this so-called project modification. So in case of barangay health station for construction na hindi po ready to implement because of the problem of the title, it's the regional office who will now decide if this will be modified to have it changed to procurement of equipment. So may mga justification po yan. So maybe we can also ask the Regional Director of Region 3, Honorable Swansing. Thank you.
Just want to inform everyone that the regional directors of the DOH is with us on this meeting.
Madam Chair,
Director Casyon. Kongging.
Madam Chair, ang simple lang naman ang tanong is itutuloy pa ba yung hindi natuloy na BHS na ready na siya, kaso natamaan lang siya unutilized budget?
Director Gorgolon.
Yes, ma'am, kung ready na po yan, hindi naman po at pwede pa yung pera, pwede na pong ituloy po. Pwedeng ituloy po. We will just coordinate with the regional office po. As long as ready na yung
Ibig ba sabihin hindi nawala yung budget for that?
If it's for 2019, kaya pa po yan kasi yung lapse ng pera is December 2020 for obligation.
Okay, Madam Chair, last na lang. Yun sa very low utilization rate is sana ma-consider ninyo, Secretary Duque, yung sobrang higpit ng inyong requirements dun sa pagpapatayo ng BHS. Yan yung reason ng very low utilization. Dr. Gorgolon, I know you will agree with this dahil ito talagang pinag-aawayan namin ng regional director namin.
Yes, ma'am, kasi po yung requirement on the title and deed of donation is requirement po ng COA. So we will discuss on how we can really help kung ano ba yung acceptable document because these are the documents. They cannot bid the project without this title or use of RAC. So these are things that the first thing the BAC will look into is this document. So titingnan po namin kung paano namin ma-improve and ma-review po yung requirement. Thank you very much.
Last na lang, Madam Chair, I suggest that DOH and DPWH will meet and discuss about this because DPWH is not like that.
Thank you, Kongging. Before I call on the next interpolator, I'd like to...
Thank you, Madam Chair. Thank you, Secretary Duque. Thank you, Director.
Representative XJ Romualdo, our Deputy Majority Leader, Representative Princess Rihan Sakaluran, Representative Cyril Obueg Saldivar, Representative Presley De Jesus, and Representative Hector Sanchez. Secretary Duque, na-ask kanina ni Kongging yung sa immunization. Can you give us an update on the 4 billion plus budget for pneumococcal vaccine? The status of that budget. That's for 2020.
Yes, thank you. May I please, with your permission, invite in Yusek Mirna Kabutahe to give us an update on the budget as mentioned.
Yusek Mirna.
Yes, Madam Chair, thank you for the question. In terms of the PCB 13, the budget is still intact. We did, the HTAC did a review and they have already recommended that both PCB 10 and PCB 13 represent good have minimum requirements for the different serotypes. So now we have already did our procurement. We went through the process and it is now ready for clearance by our pharmaceutical division before the bidding will proceed. We are targeting middle of September for the bidding conference and we hope we will facilitate, we will talk with our COVAX so that within the least number of days, within 90 days, we will have the results. Currently, we have an additional, we have a stock level at the national of 1.7 million doses of PCB13, and we have at the regional stores 905,000 million doses of PCB13.
So, Yusek, this will be an open competitive bidding for PCB?
Yes, ma'am.
Okay, thank you so much. The only thing I want to know. I would like to recognize Representative Cheryl De Loso Montalia. You have the floor.
Thank you, Madam Chair. Good morning. Good morning also to all the members of the Committee on Health. Ganon din po sa ating DOH family headed by Secretary Duque.
Good morning, ma'am.
Morning po. I was listening earlier, a follow-through lang po dun sa sinabi ni Kong Mike kanina. Nabanggit niya po yung aming hospital kasi we are discussing about the budget for HFEP. Napapansin nga po namin for the past how many years, parang intermittent itong paggamit natin ng HFEP. Kuminsan po mayroon, kuminsan wala. Best example po yan sa amin because yung po aming district hospital, alam po yan ni Director Gorgolod because she was then the director of Region 3 in the 16th Congress po yata. So we started with 11 million and the plan is to create a 2-story additional building for that district hospital. So meron po munang 11 million tapos the following year, walang pondo. The next year, wala pa rin pong pondo. The third year, saka lang po ulit nagkapondo. Ito po, 6 years na po tayo dito sa bilang kinatawan ng Zambales. Hanggang ngayon po, hindi pa rin tapos. So nagtataka po ako kung paano natin ginagamit itong HFEP and how are we utilizing this. Kaya po I agree with our chair, Kong Helen, that there should probably be a convergence with DOH and DPWH. So kung medyo malaki po ang gagawin na building to a certain hospital, ay gawin na lang po nating multi-year and make it sure that there is funding every year until it's finished. Kasi po para nasisira na yung mga structures doon, hindi pa rin natin napupondohan. Yun po, first. Second, medyo parochial concern din po, nabanggit din po yan ni Kong Mike kanina. Actually, I've been requesting even before the UHC, even before the COVID pandemic, an isolation building there in the provincial hospital. Mga 5 years ago na po yun eh. Hanggang ngayon po hindi pa rin napondohan. I was thinking kung napondohan po yun at meron isolation building doon sa provincial hospital ng Zambales, eh baka po na-separate na namin kaagad yung mga COVID patients. So medyo magulo po ang utilization natin ng HFEP and I hope magkaroon po ng correct programming kung paano natin gamitin yung pondo. One po yan. Second, pagsamasamahin ko na po kasi 5 minuto lang ang binigay sa atin ng ating butihing napakagandang chairperson. Second po, yung doon po sa ating mga personnel, I've heard from our president that he encourages that we should hire more medical professionals, lalo na po, alam natin itong problema natin. So, gusto ko lang pong malaman kung ilan po yung naidagdag natin na pondo, nadagdagan ba ito, at kung tayo po ay mag-hire, sino po yung mga i-hire natin and how are we going to distribute these medical professionals in the 16 regions and 81 provinces in the whole Philippines. Yun po yung sa health professionals natin. Kasi parang naisama lamang po yata yung budget doon sa human resources for human deployment. Wala pong specific kung paano yung hiring natin ng medical professionals na ipapadala po natin doon sa unserved and underserved areas. And then pangatlo po, Madam Chair, pasensya na po kayo, Secretary, pagsamasamahin ko na po. Third, yung pong PPEs natin, we have a PPEs. Ilan po ba yung budget na inallocate natin dito for the purchase ng PPEs? Kasi po, before, during the Bayanihan 1 Act, isa po sa mga pinropose natin dyan ay lowering of taxes para po dun sa importation. Pero parang wala pong, hindi natin naramdaman kasi mahal pa rin po yung PPEs even if we lowered the taxes during the Bayanihan 2 Hilas 1 Act. Ngayon dito po sa budget na i-allocate natin for the purchase of the PPEs, gaano po karami ang intended natin na bibilhin at paano po ang distribution nito sa government hospital? Ito po ba per request or mayroong specific allocation per hospital? Kasama po ba dito ang mga provincial and district hospitals? And then the last question, Madam Chair. Ito po, question lang po ito about the PhilHealth. Medyo nako-confuse lang po ako kasi may situation po kami sa probinsya, pag na-swab test, pag na rapid test, positive sa rapid test, dadalhin na po sa provincial hospital. Pero wala pa pong result yung swab test. Eventually, ang result ng swab test negative. Okay, meron pong isang case din na talagang COVID patient dinala sa isang private hospital. Ngayon, ang question ko po dito, doon sa nag-positive sa rapid test pero negative sa swab test, ang charge sa PhilHealth ay 43,000, eh wala naman pong ginawa doon sa pasyente dahil technically negative po siya. Doon naman sa COVID positive patient na nasa private hospital, talaga pong na-intubate na yata, muntik pa nga pong namatay, in-announce pa nga nilang namatay na, hindi naman namatay pero talaga pong critical. Pero bakit ang charges sa PhilHealth ay 43,000 din? Medyo confusing, nako-confuse lang po ako, Secretary. Those are my questions, Madam Chair. And Sec
Give
Duque.
you your 5 minutes, Kong She.
Thank you.
Kindly respond, Secretary Duque.
Yes, ma'am, yung HFAP issue, I would like to request again Director Gorgolon to please respond to the questions 1 and 2 on the district hospital request for construction of a building and then
Unfinished building sec for the district
unfinished
hospital,
buildings.
and request for isolation building which hasn't been funded yet in the
Yes,
province.
yung isolation building, Director Gorgolon, kindly respond to the query.
Director Gorgolon.
Yeah, thank you. Thank you, sir. Thank you, Kong. We will check on the request po. Then we will coordinate with the regional office po for this. Itingnan na lang namin, sir, kung na-request ba yung isolation room and when was that. Then we can get back to you po. We will submit report. Thank you.
Yung pong katanungan ninyo patungkol sa paano ba dinidistribute ang human resource for health. Ito po ay ang kaakibat nito yung pong health facility development plan, yung PHFDP. Kinakailangan po magkasama ito kasi kung maglalagay po tayo ng mga facilities pero hindi natin masiguro yung health worker density, magiging white elephant itong mga gusali. Kaya sinisiguro po natin na nakapaloob po ito doon sa atin na Human Resource for Health Master Plan for all regions, 16 regions in all, in fact 17, including NCR, and also yung ating Philippine Health Facility Development Plan. So bibigyan po namin kayo ng kopya nitong mga dokumentong ito at for your consideration and your invaluable inputs, Chair. Salamat po.
Could you please include there kung ano po yung how many doctors that we intend to hire, nurses, parang ganun po.
We will provide
allocated.
Yes, ma'am, we will provide up to the municipal, district and municipal level, Your Honor.
Thank you, Madam Chair. Thank you, Sec.
Thank you, Kong She. Next to ask question is...
Madam Chair, I apologize. Dalawa pa po yung question na sasagutin po, yung PPE at saka po yung sa PhilHealth charges. Sorry po.
Yung sa PPE, the PPE, can I ask Yusek Kabutahe to please give her rejoinder to the query?
Thank you, Madam Chair. With your permission, actually we have requested for 10.9 billion for PPEs, but what was only granted was 2.7 billion. So our priority po ay our healthcare workers, our frontliners, and our dentists, our contact tracers. Hindi po ito based request, although napaprioritize based on request kung ano yung mas urgent. We already have at the outset an allocation list kung saan pupunta ang mga ito. Sometimes we shift it based on the occurrence of hotspots. Kung in certain areas they need more, that's when there is some shifting in the allocation. But at the outset, we already provide a allocation all over the country. Paano ho yung mga health workers na mabibigyan? But priority po yung ating mga healthcare workers with the limited amount that we have. Although we are proposing also a 1 billion amount from ADB for PPEs, Madam Chair. Thank you.
Thank you.
Yung pong huling katanungan, Madam Chair, yung sa PhilHealth, yung bakit ganun ang singel, questionable, batay po sa sinabi, ulat po ni Kong Deloso, si SVP Neri to please answer this particular question.
SVP Neri.
Yes, Madam Chair. Thank you, Secretary. Regarding po sa dalawang cases na na-cite ni Congresswoman, first case is negative, positive on rapid test, negative on swab test, but was admitted with mild symptoms po ba yun? Yung first case.
Wala pong symptoms yun, asymptomatic.
Okay.
Wala lang po.
Pagka po kasi asymptomatic na so suspect lang siya, dapat po lang sa isolation unit po lang po siya, hindi po siya dapat admit. So, yun po yung first case. Yung second case po, 43,000 po yung binayaran pero naging critical. It could be po na meron po siyang ibang sakit na ang binilagay pong diagnosis is not is just mild pneumonia. Ang naging critical po would be a different illness po. So
it will depend on the doctors to
yes ma'am.
Diagnosis.
on their specific diagnosis. Apo. Okay, Madam Chair, I think I utilized already my 5 minutes. Marami pa po sana, but yun na po muna. Thank you.
Thank you,
Tech.
Coach. So far, tama yung sagot ko sa iyo, no? Na it will depend on the diagnosis of the attending physician.
Yes.
So, yes. Would like to call on Representative Marilu Arroyo. Kong Marilu.
Good morning, Madam Chair.
Go
Good
ahead,
morning.
Tita.
Good morning to our Health Secretary.
Good morning, ma'am.
Good morning to all of you there and to all my colleagues who are here. You can see how important health has become to us now, Madam Chair and Dr. Duque. You know, I have 2 district hospitals in my area. I lack doctors. I don't have doctors. I don't have nurses. As a matter of fact, I don't have supplies. I need beds. I need sueros. I need an upgrade of facilities. And I don't know what to do. We have been downgraded from 2 hospitals. Now we have infirmaries. We've been downgraded. Please help me. I don't know how to do it, to the point where I have asked, I'm under the impression if it's a district hospital, it's your province that will take care of you. Am I right or am I wrong?
Right, Madam Congresswoman, because of the devolution of health services to the local government units, and the district hospital falls within the purview of the LGU's mandate to operate and to provide the equipment, the manpower or human resource for health for said district hospital. But of course, without prejudice to the DOH Region 6, under which your district belongs, to provide technical assistance and also material supplies and other forms of assistance, Kong Marilu.
Thank you very much, Madam Chair. And that's the reason why I have asked for my 2 hospitals, my 2 district hospitals, to be transferred to national. I've already written to the Secretary Duque and to our governor to request this, because I need so much help and I'm not getting any. And my governor says he has no money. So I guess I have many other questions, because I now chair the persons with disabilities also. Since I still have time, may I ask you, people with disabilities who are vulnerable already, and physically and socially and economically vulnerable, for these reasons, they often rely on public services for their needs. I would like to know how much is being disbursed every year for our persons with disabilities. I'm almost sure you have put us with the indigents. May I know what the share of the persons with disabilities is? And if you don't have it for this year, can we start with 2018, which you have data on?
Yes, ma'am. We have USEC Mirna Kabutahe of Public Health Services team to respond to your query with the permission of the chair.
Yusek Mirna Kabutahe, please respond.
Thank you, Madam Chair. For our persons with disability, as far as the program is concerned, we provide technical assistance and assistive devices. But in terms of their confinement in hospitals, they follow whatever the PhilHealth allows and whatever the uh, provisions of the law provide. So our budget for persons with disability, as far as the program, is very limited, only to technical assistance and some assistive devices that we provide all over the region, all over the nation through our regional health offices. I can submit the budget. I cannot look for it now, Madam Chair, but it's part of a whole non-communicable disease program.
Madam Chair, may I ask that that I get data on this as soon as possible, please, because I need to get a budget for this. I need to help the people with disabilities.
Okay, Secretary Duque and Yusek Mirna Kabutahe, kindly provide the committee the data that the Honorable Congresswoman is asking on the PWDs.
Yeah, we will do that, Madam Chair and Kong Marilu, and also provide you with the list of human resource for health professionals deployed to your district. We also have a list of how many nurses and doctors we actually deployed to your district hospitals and other health facilities. Thank you, Madam Chair.
Thank you.
Thank you, Madam Chair.
Are you done?
Am I up with my 5 minutes?
Yes
Am
po.
I...
You've consumed it.
Second round.
Second round. Okay,
Second round,
Tina.
fifth.
Thank you. Would like to call on Representative Stella Kimbo.
Thank you, Madam Chair. Good morning po, Sec. My first question po is
Good
about
morning.
the 71 billion budget that's allotted for PhilHealth. May I know po about the process for determining this amount? Like for example, sino po ang nag-compute po ng 71 billion na yan?
Can we ask SVP Neri Santiago for her response to the query?
So, Secretary, it's the computation is done by PhilHealth. Tama po?
You're right, Kong Stella.
And what is the role po of the DOH?
Actually, diretso na po sa kanila ang kanilang computation. But this is not in accordance with the prescribed budget under the Universal Healthcare Law. We've asked far more, twice this amount. This is really not enough, Kong Stella. I think we were asking about 138 billion to be able to implement fully the provisions of Universal Healthcare Law, where all Filipinos are now automatically members of PhilHealth.
So, Sec, itong 138 billion, kinompute ng PhilHealth, binigay lang sa DOH, sinamin ng DOH sa budget nyo. So, my question is, so these are all just premium subsidies? Tama po?
Ma'am, yung pong kasing budget na kanilang inihanda, diretso pong ibinibigay na ito sa DBM, Kong Stella.
Okay,
Yes,
so
ma'am.
wala kayong ano dyan, say. And number two po, these are all just premium subsidies. Tama po, SVP Neris?
Madam Chair, Kong Kimbo. Yes po, these are all premium subsidies.
Okay, so ilan pong tao po ang gusto niyo pong i-cover with the 138 billion na pinapropose niyo po sana?
For the 138 billion po, ang corresponding principal members po is 31 million.
31 million. Yung 31 million na yan, yan po ba ay base sa listahan o base lang po yan sa assumed number of individuals and assumed number of dependents or assumed family size?
These are from the database. Yun pong numbers na to.
So, listado po lahat ng 31 million na yan.
Yes.
So, and anong basis po, sino-sino po ang 31 million na yan? Kasi ang pagkakaalam ko po sa NHTS ay hindi naman po 31 million ang nakalista po dyan.
Opo.
Can you tell us ang broad groups na kasama po ng listahan na yan?
Doon po sa NHTS, nasa 13 million po. Yun po senior citizens, nasa 8 million. Yun po sa UHC expansion, kasama po yung POS, nasa 7 million.
Sorry po, sino po yung 7 million?
Ito po yung sa point of service.
Point of service.
Hindi nakakover ngayon.
So, ito pong point of service, ito po ay dahil ng Section 9 ng Universal Healthcare Law, tama po?
Ay, ito po yung immediate eligibility, tama po.
So, ano ang strategy po niyan? Kasi sa aking palagay, yung Section 9 po is mahirap po siya na provision kasi ang ibig sabihin niyan, kahit na hindi nakapaghulog ang isang tao sa PhilHealth, pagdating po sa ospital at kailangan niyang gumamit ng service, ay hindi siya pwede i-turn away. So, ang mangyayari po niyan is hahabulin na lang ng PhilHealth ang premium ng tao pong na-enroll at point of service. Tama po ba yun?
Tama po yun.
At ano ang naging experience ninyo sa paghahabol po after the fact? And is this the reason for why you're needing to cover itong 7 million? Kasi according to the law, dapat yung 7 million na yan ay direct contributor kasi kasama po dyan ang self-employed at informal. Pero sa pag-compute ninyo, tila ina-assume ninyo na kailangan ng isubsidize ng gobyerno. Is that a correct appreciation of the numbers that you've provided me?
Sa ngayon po, ang nasa direct contributors po namin na informal at saka yung self-earning, yun po yung currently na-covered ng PhilHealth. So, andun po yung nasa direct contributors. Ito po nasa sinama namin sa UHC expansion. Ito po yung hindi pa nagbabayad. Wala pa pong bayad sa ngayon.
Hindi, correct nga. Pero according to the law kasi, dapat sila mismo magbayad para sa sarili nila. Kasi sila ay kasama sa direct contributor na definition. Pero ngayon po na sinasama niyo po siya dito po sa subsidies, ang ibig sabihin po, you practically gave up on collecting from them and therefore ikinakarga niyo na po sa gobyerno. Is that a correct appreciation po?
Hindi naman po lahat kinakarga na.
Okay, so ilan porsyento po itong 7 million ng lahat po ng informal sector po? Siguro po, if you don't have the data with you, you can email it to me po. No? So let me just provide to me the detailed computation po nitong 71 billion. So I can move on to my next question kasi I'm running out of time po. Ang tanong ko po is in relation to COVID, Mr. Secretary, would you know more or less kung magkano ba talaga ang binudget ng gobyerno natin for yung COVID response on the aspect of health lang po. Kasi of course, karamihan po niyan is naka-lodge sa DOH pero hindi naman po lahat because meron din naman po halimbawa na budget na naka-lodge sa DILG pagdating sa contact tracing, etc. Kumbaga nakakalat po ang spending na yan sa iba't ibang ahensya. Would you know po, Mr. Secretary, kung ano yung more or less kabuo ang binudget ng gobyerno po natin pagdating lang sa pagsugpo po ng COVID-19?
Maraming salamat po. Ang atin pong DOH proposal was 53.23 billion pero ang total po na ang enrolled bill appropriation was 21 billion with a difference of 32.23 billion. This is Bayanihan Act 2. But for the Bayanihan 1, it is 67 billion po yung hiningi namin, pero 45.7 billion lang po ang naibigay.
Okay, so Mr. Secretary, huli na lang po. Ano po ba talagang ibig sabihin ng flattening of the COVID curve? Kasi nga po, lagi po nababanggit po yan, no? Nababanggit po ng iba't iba pong officials sa ating government. Sa akin pong palagay po, parang nagkakaiba-iba po ang pagkakaintindi ng bawat ahensyang nagsasabi ng flattening of the curve. So, would you have some kind of, kumbaga, metric that officially, di ba, kung paano bang pag-define natin yan? Does it have to do with total cases? Does it have to do with new cases? Does it have to do with the R0? Does it have to do with the case doubling time? O di kaya new cases in relation to available beds? Ano kaya ang magandang statistic? Para po kami pong mga ordinary citizens, pwede po namin bantayan para kami rin po maramdaman po namin ang flattening of the curve po.
Maraming salamat po, Madam Kong Stella. Marami po kasi mga metrics na ginagamit, minsan ng mga iba't ibang mga grupo, tama po kayo na depende kung sino yung nagsasabing nagpa-flatten yung curve, meron po silang mga datos na ginagamit, katulad po ng UP Octa. Ang sinasabi po, ang kanila pong metric na nagamit is the R0 or the rate of transmission. Ang 0.9 ang sinasabi nila, so ito'y bumaba pa less than 1, which means for every infected person, ang kanya pong mahawaan ay less than 1. This is one of the metrics. No? The second metric I understand is the absolute number of cases reported on a daily basis. Ito po yung makikita natin doon sa inireport ng DOH, yung epidemic curve of cases. Pero ang DOH po, maliban dito sa mga metrics na ginamit ng UP Octa, gumagamit po kami based on the recommendation of the FASTER group. Ang atin pong definition ng flattening of the curve ay dalawa po. Number one, yung pong bumababa ang bilang ng kaso on a daily basis and spreading over a longer period of time. And while that is happening, it provides the window of opportunity for the health sector and DOH leading the health sector to ramp up its health system's capacity from testing capacity to isolation, quarantine facilities and beds to hospital ward beds, ICU beds, isolation beds, and mechanical ventilators as sub-metrics of showing that indeed there is a flattening of the curve. But let me just give you my a bit of a caution that our data has not really been complete. Kulang pa no? Kulang pa. Hindi kasi, what do I mean by saying that our data is not that complete? Sa amin pong data management system using the COVID Kaya, which receives reports from the disease reporting units from the hospitals, labs, and the LGUs, yung mga laboratory in particular, hindi po 100% nakakasubmit. Lately, parang 93 labs lang out of 112 labs ang nakapag-submit. And we continue to remind them under pain of penalty in the Republic Act 11332, the Disease Notifiable Act of 2019. So, marami rin po tayong mga ibang metrics na ginagamit, kagaya ng case doubling time. The longer the doubling time, the better the COVID situation is. Right now, our case doubling time has increased from 1.87 sometime in March to about 10.4 to 10.5 days doubling time. And so is our mortality doubling time, although this is a lag measure, it is now at 14 to 15 days from 2 to 3 days mortality doubling time. So, yun din po ngayon ginagamit natin based on the recommendation of the FASTER modeler ay yung pong attack rate at saka yung pong tinatawag natin na 2-week average growth rate. So ito po ay ang mga panukatan para magbigay po ng mas kumpletong litrato ang COVID-19 situation in the Philippines. No? So itong ating tinutugunan na challenge ngayon, yung ating po mga delayed data submission. At we are really pushing. And in fact, we have written letters, show cause letters to laboratories that continue to provide incomplete data from their case investigation forms. No? So ito lang po masasabi natin sa ngayon.
So, Madam Chair, just to wrap up na lang po.
Ma'am, nakalimutan ko pong sabihin, gumanda na po yung atin case utilization, atin critical care utilization rate. It is now at 66%. Last August, when we had reports of several patients going to the hospitals, we hit the danger zone of 82% utilization rate. Now, we've been able to ramp up our facilities, the isolation, quarantine, TTMFs, in NCR in particular, dito po tumaas po talaga yung ating utilization rate ng 82%, but now it's down to 66%. Nationally, our critical care utilization rate is about 46 to 50%.
So, Madam Chair, just to wrap up na lang po, Mr. Secretary, do we have sufficient budget cover po para po gumanda pa ang ating data collection? And finally po, sa tingin niyo po ba, based on the metrics that you just described to us, and thank you very much for that comprehensive description, have we flattened the curve na po ba? And sorry, isa na lang po, yung case doubling time, pa-double check na lang po. Kasi if you do a manual count po, nasa 20 plus po ang case doubling time, hindi po 10 days. So yun na lang po ang aking final set of questions po.
Yes ma'am, maraming salamat po. Yung po sa case doubling time, ang basis po natin ng mga 10.4 days is an average from the first reported case in March to 2 weeks ago. So, but if you look at, like what you said, a manual, titingnan mo, susukatin mo, as a 20 to 24 days, tama po kayo. Kung pipili kayo, say, kung naging 24,000 20 days ago, now it's 48,000 after 20 days. So, tama po kayo. May dalawa pong punto ang pagsukat ng case doubling time. Pero ngayon po, sinasabi kasi ng faster modular group, hindi na siya sensitive as a metric to describe the real COVID situation in the country. So that's why they have strongly recommended to move to the attack rate per 100,000. This is the incidence and also the difference between the 2-week number of cases compared to the 2 weeks prior to the current 2 weeks, which is the 2-week average growth rate. But kung meron mang talagang flattening of the curve, Madam Congresswoman, this is no excuse for us to be complacent. We have to continue with the same fervor, with the same vigor to really crush the clusters of COVID-19 cases. And so we're not letting our guard down. We are as aggressive as we can be, as we are starting to open up the economy. Otherwise, there will be higher community quarantines equal to a possible irreparable damage to the economy. But at the same time, not losing sight of the health of our people. It's a very delicate balancing act, Your Honor. But we are committed to make sure that both the health of our people and the health of the economy are really monitored.
Secretary, I think Comstella was asking, do we have enough or adequate fund for IT infrastructure, data management system? I think nakita ko sa budget po ninyo, actually tatanong ko nga po ito, napakaliit ng budget na ibinibigay po dito.
Thank you. Can I just invite in Yusek David, with your permission, Chair, Yusek David, to please answer the question.
Yes, Yusek David.
Thank you, Mr. Madam. So we proposed some budget for isolation beds in the 2021 budget, but we don't have a budget for infrastructure. So we have, but we do.
Yusek, Kong Stella was asking the information technology for data management system. Do we have enough budget for that? For 2021 budget, kasi na-realize nga natin itong sa COVID, the reason why nahihirapan tayo until now, although nag-improve na, is yung atin pong data collection, no, and yung IT yung sanang pagtutuunan ng pansin. Magkano po ang budget?
Yes, Madam Chair. So our budget.
Director Eric.
May I be recognized, Susek David, Secretary Duque III? And,
Yes.
Okay, Chair.
Director Eric.
Okay, thank you. The budget for 2021 for ICT is 91 million compared to last year, which was 1.2 billion pesos. And out of the 91 million for 2021, we have only allocated 30 million for COVID-19 related activities that will need support ng ICT, Madam Chair.
Actually, I was supposed to ask that question during the budget hearing last Friday kay Secretary Abisado and Secretary Dominguez. Kasi I don't know, sino po ba ang naglagay nito na budget na dapat ilalagay for IT infrastructure? Is it DOH ang nag-propose o ang DBM ang nag-decide na ganito lang kalaki ang ibibigay?
We have proposed in the NEP over 500 million in the Tier 2, but DBM just assigned us a 91 million peso budget.
Kong Stella?
Anong gagawin natin dyan, Mr. Chair? Siguro ang maganda po talaga dito is para naman makapaglabi kami ng maayos para dagdagan yan because that's a big problem. Pwede niyo po kaming bigyan ng breakdown nung sinasabi ninyong ideal budget para masigurado na maganda ang datos natin, particularly for COVID monitoring. So isama niyo po dyan ang encoding at lahat ng yung encoders po na kailangan i-hire, pati po ang IT infrastructure na kailangan, whether it's hardware, whether it's computers, etc. Or
Yes, ma'am. Yes, ma'am. We will send you the details of the budget as originally proposed for the IT support, including the support for UHC, COVID-19, and our regular operations to support the ICT needs of the DOH and the health sector. Maraming salamat, ma'am.
Maraming salamat.
Thank you, Kong
Maraming
Stella.
salamat,
Thank you, Director Eric Tayag. Kindly provide the committee on the details of your budget proposal for that. No. Before I call on the next interpolator, I'd like to recognize the presence of Rep. Alan Reyes, Rep. Ace Barbers, and Rep. Paul Daza. Secretary, you mentioned earlier, ang budget na naibigay po sa Bayanihan 1 is how much? How many billions?
45.7 billion, Your Honor.
45.7 billions. And how much po ang in-spend ninyo for PPE?
Let me just get the data, Your Honor.
Okay. Sec, kindly provide us na lang po yung breakdown. I just want to ask yung thermal scanners that are missing. Is it
missing?
Or
Yusek Mir Nakabutahe can answer.
Yes, Yusek Mirna, can you brief us on the supposed to be budget that's around like how many millions of pesos for thermal scanners?
Missing? May Yusek Mir Nakabutahe can answer. Yes, Yusek Mir Nakabutahe can answer. 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 Y
Okay, while waiting, we'll just call on Yusek Mirna. Please prepare your response later. I'd like to call on Representative Diego T, the next interpolator.
Thank you, Madam Chair. Salamat po for giving us the opportunity to express our concerns and possibly sentiments, Madam Chair, in this pre-budget briefing. Tulad din kanina nabanggit mo, Madam Chair, sa HPEP din ang concern ko. Every time we ask our DBM, they kept on telling us na very low absorptive capacity ang HPEP, kaya mababa rin ang budget na binibigay nila dahil yan din ang kaya. So I hope, Madam Chair, sa mga explanation kanina, I just hope na isaayos na to kasi marami pong naapektuhan ito. Tulad po ng sinabi ni Representative Mike Defensor kanina, marami pong barangay patingi-tingi po. Buti sila patingi-tingi sa district ko po. Meron po kaming 266 barangay. Noong 2020 budget po, 0 po ang binigay sa district ko. Ngayon na naman po, pangalawang taon ko po as bagong congressman, nakakahiya naman po sa distrito ko, 0 na naman po uli sa lahat ng barangays ko. Tapos lahat po ng apat po na LG hospitals, wala po, 0 po. Meron lang isa pong municipality, RHU na 500,000. Chair, sabi po ni Speaker na equitable distribution of government funds, giving more to those who have less. Saka member po ako ng committee ito, para pong insulto sa akin na 2 beses na pong 0. Parang unfair po sa constituents ko. Ang tanong ko po, Madam Chair, kay Director Gorgolon, baka naman po hindi niya alam na meron pong First District of Misamis Occidental. Kung pwede po, bakit naman po wala naman pong budget for the past 2 years po? Pakisagot naman po, Madam Chair. Member po ako ng Committee on Health and Appropriation, nakakahiya naman po. 0. Kailangan nung sa barangay.
Director Gorgolon. And if we have the regional director also, can respond. Director Gorgolon.
Yeah. Good morning again. So just to emphasize, we will look into the emphasize that it's only for medical equipment that was approved. But based on the request, most of the requests are infrastructure. So hindi po siya nasali. But we will review on the list po. Thank you. And coordinate with the regional office po. Thank you po.
Kahit na sa medical equipments din, Madam Chair, wala rin. Kahit na sa mga local government hospitals, 4 po ang LG hospitals namin. Most of them are in the verge of bankruptcy. Kailangan ho namin ng tulong ng national government. Baka naman po may pagkukulang ang aming regional director. I would like to request our secretary to please review the performance of our OIC regional director. Baka napapabayaan, hindi pa ho siya nakakabisita sa district ko. Mr. Secretary, please.
Yes, sir. Yes, Your Honor. Certainly, I'm going to call him up right now after this conversation and tell him to go and request for a meeting with you so as to discuss the needs of your district, especially pertaining to health. So, kakausapin ko po siya, Your Honor.
Thank you po, Secretary. Dito kasi sa rural areas, ang mga health centers, barangay health stations, nagamit ho namin minsan as quarantine facility kasi kulang ho kami sa facilities. May nabanggit po na meron po kayong 5.5 billion pesos na unprogrammed funds. Baka naman po meron kayong first, second, third priority dito. Kung may pera na po to, baka naman po may sali naman po kahit na yung mga request po ng district. Madam Chair, parokyal ho ang concern ko. Ako lang po ay naghihingi ng tulong sa iyo kasi member ho ako ng committee ito. Wala po akong ibang mapuntahan kundi kayo lang po bago po akong congressman. Pakitulong na lang po, Madam Chair and Mr. Secretary, please lang po.
Yes,
Thank you,
yes, sir. Yes,
Kong
sir.
Diego. Yes, Secretary, kindly task your regional director to please coordinate with Representative Diego T.
Yes, yes, ma'am. As we are talking, I'm having Director Subaan contacted right now.
Okay, thank you so much. Do you have other concern,
Salamat
Representative?
po, salamat po. Thank you
Thank you
po.
so much po. Andito pa po si SVP Neri. Ma'am Neri, i-add ko lang po, since natanong kanina ni Kong Stella yung allocation ninyo for subsidy, ang naibigay lang po sa inyo 71 billion. Pero ang proposal po ninyo 138 billion. So, paano po natin kasi aligned with Universal Healthcare Act, so paano po ninyo gagamitin yung 71 billion na hindi mako-compromise yung other sectors?
Madam Chair, yung pong hindi naman po matitigil yung aming pagbibigay ng serbisyo ng benefits sa ating mga miyembro. Yung ano man po magiging deficit between collections at saka yung benefit payouts will be taken from the reserve fund po.
Yeah, but Ma'am Derry, di ba supposedly ay immediate eligibility tayo, no?
Yes, Madam Chair.
Tama po. So na-mention ni Kong Stella kanina kung supposed to be ikaw ay direct payer ngayon, and ngayon with pandemic, maraming displaced workers. Ibig sabihin they missed the contributions.
Yes, Madam Chair.
And then, kung ma-hospitalize siya, supposedly, hindi siya ma-deprive of the care that should be given to the patient, right?
Tama po yan, Madam Chair.
So, for your information and for the information of Secretary Duque then, that's not what's happening in the ground. So I think there's again, ito na naman pong risk communication plan natin or yung it's as simple as communication po. Ang iba-iba pong LEO, yung inyong mga satellite offices, may iba-ibang pagkaunawa ng interpretasyon o baka hindi po nyo na i-communicate na po pwede. We've encountered a lot of patients na nasa hospital, they missed the contribution or the company missed the contribution kasi nawala ng trabaho because of this pandemic, and then ino-oblige nila to pay immediately or to complete the missed contributions. Ang punto po natin ngayon pa sa panahon po na ito ng pandemya, hindi natin kayang pilitin o hindi, kahit anong gawin po nating piga siguro doon sa isang contributor or miyembro, ay baka mahirapan tayo. So, anong ginagawa po ng PhilHealth on that? May regional offices po kayo, may mga satellite offices pa, pero hindi po yan nai-implement.
Tama po kayo, Madam Chair, na maaari pong magkakaiba ng intindi ng ating mga LUS. Maaari po bang maibigay sa amin yung mga reports na gano'n para tingnan po namin kung ano po ang nangyayari dun sa mga providers na nasasakupan po nito mga videos na to. Also, meron naman po tayong 24/7 na corporate call center na pwede nilang i-report kung meron po ayaw po silang bigyan ng beneficial ng PhilHealth.
Okay, can you provide us the committee at least so we can post alin yung linya na pwede nilang tawagan should magkaroon ng problema ang ating mga members or ang ating mga mamamayan, no? Ma'am Neri, now that you have the president has appointed a new president, baka pwede na makapag-memo kayo down to the ground or to the health facilities on the immediate eligibility.
Sige po, we will reiterate po yan using an advisory coming from the PCO po.
Okay, thank you so much. I would like to call on Representative Hector Sanchez. the next interpolator.
Yes, Madam Chair, good morning and to all resource speaker. Madam Chair, hindi ko na pahahabain ang aking tanong, direct to the point po. First, I am fully supporting the budget of the Department of Health and even asking for additional budget. And second, 30 years ago po, ang mga barangay health station ng probinsya ko, Catanduanes, na laging binabagyo, yun po ang napapabayaan. Repairs and improvement. Sana po si Secretary aware of this. And also, alam niyo po, pag ang isang island province, talagang problema naming malaki doon. Even ambulances and also the repair and maintenance of our hospitals na nakakaawa ang mga pasyente. Baka po sana mabigyan ng atensyon ng ating mahal na Secretary. May I know the feedback from the Secretary, Madam Chair?
Maraming salamat po, Madam Chair and Kong Hector Sanchez. Opo, ay pinatawagan ko na rin po ang aming Director, Region 5, si Director Ernie Vera, para makipag-ugnayan po sa inyo ng direktamente para po matukoy kung ano po yung mga sinasabi ninyong mga facilities na sira-sira at kinakailangan po ng renovation at patuloy na ayuda pagdating po sa mga ibang pangangailangan, mga equipment, supplies, at technical assistance. Yan lang po ang aking masasabi sa ngayon.
Yeah, Secretary, asahan po namin ang inyong pangako. Thank you so much. And Madam Chair, back to you. Thank you.
Thank you, Kong Hector.
Salamat po.
Yes po. Yung RD po natin ng Region 5 kindly coordinate with Representative Hector Sanchez. Would like to call on Representative Juliet Uy. Do we have Representative Juliet? If none, I'd like to call on Representative Joette Garcia, our Vice Chair.
Thank you, Madam Chair. Good morning.
Right now is...
Madam Chair, my question is regarding yung budget ng DOH when it comes to new hospitals. Particularly, parochial concern din po to, Madam Chair. Last Congress, we were able to pass yung RA 453. It's an amendment to our Freeport area of Bataan. And it includes the for DOH to construct a tertiary hospital in the Freeport area of Bataan. Given na ito po yung napakarami hong workers dito, malaki rin yung population. And yung distance niya from Bataan General Hospital in Balanga City is over mga 45-50 kilometers. So, Madam Chair, I wanted to ask kung ano na po yung plano ng DOH with regards to this mandate to set up a tertiary hospital in the Freeport area of Bataan, and kung paano nga ito mapupondohan given this our 2021 budget.
Secretary Duque.
Ang latest information ko, Congressman Joet, nakipag-ugnayan na yung sa HFDB, si Director Tess Vera at yung kinatawan ng ang regional director po dito si Cesar Casion for site inspection. Yun po ang latest na feedback sa akin. Magsa-site inspection na daw po sila.
I think, Madam Chair, tapos na po yung site inspection, SEC. So, moving forward lang kasi lalo na po ngayon sa Mariveles, medyo ang dami ho natin active cases, umabot na ho na more than 200.
Si Director
COVID.
Gorgolo na lang po ang aking pong tatawagin just to give us the latest update. Kong
Sige po.
Joet, with the permission of Chair.
Director Gorgolon.
Sir, thank you po. Good morning, sir. For Mariveles Wellness and Mental Hospital, we have included an isolation facility under ADB po to be constructed in the area as part of our COVID response, especially that we have this report po. So in the amount of 50 million charged to Asian Development Bank po. Thank you po.
So that's, Madam Chair, that's for the 2021 budget.
Director.
Yes, yes, sir. It's proposed for 2021, but we are now readying the site and the design for this. So it's proposed for 2021. Thank you.
Then, Madam Chair, lastly, may I ask lang yung update na given na nag-site inspection na po tayo for the tertiary hospital dun sa RA 11453. May I ask also, Madam Chair, si Director Gorgolon kung ano yung next steps natin. I think during our meeting also previously with Director Gorgolon, she knows about the intention of the province to help also para mapabilis po itong tertiary hospital natin sa FAB.
Director Gorgolon, I think last Congress, we've enacted more than 20 local bills. Some of these were renationalization and some are were increase in bed capacity. Now, for this Congress, actually, we've passed already few, no? It's more than 10 na renationalization of provincial or district hospitals. Siguro in general, aside from kay Kongjo at concern, are we assured that all this enacted or legislated establishment or renationalization of hospitals will be funded? Go ahead, Director Gorgolon. Director.
Yeah, to answer the query of Kong Joet. So after the site visit done by the HFDB team, we will now be coordinating, sir, with the regional office number 3 on how to do the next step, and we will check on what HFEB can help in this, because this is a separate act that we are talking about aside from the Mariveles Mental and General Hospital. So we will coordinate, sir, as a follow-up action with the regional office after the site visit. With regards to the question of Kong Helen po, in terms of funding for the new approved Enabling Act, we are still dependent on, with the DBM, if there will be funding for infrastructure, and this is still to be prioritized po given the limited allocation. Thank you po. Thank you.
Thank you, Madam Chair. We'll just coordinate continuously with Director Gorgolon and Director Casion para sana ho maging mabilis din po yung response ng DOH with the need of this hospital in the Freeport area of Bataan. Thank you, Madam Chair.
Thank you, Kong Joet, our Vice Chair. Next to ask question is from the minority, Representative Janet Garin, our Senior Deputy Minority Leader. Kong Janet.
Thank you very much, Madam Chair. Good morning, Secretary Duque, and to the DOH family.
Good morning, Kong Janet. Good morning.
Yeah, maraming salamat po. I would have other concerns that I will relay directly to DOH, but for this hearing, Madam Chair, Secretary, I hope you, with your indulgence, I would like to go parochial. No. Kasi Secretary, may I ask if, are you familiar with ANKE? A-N-K-E?
My first time to have heard of it, Your Honor.
can we ask the DOH family, is anybody familiar with the brand or the word Anke, A-N-K-E?
May we ask the procurement supply chain management? Thank you. Yusek Carol.
No, sir, we haven't heard that word. The
From,
Anke.
from the regional offices, anyone?
Director Convocar of Region 6, please.
Ang camera. Good morning to all. Good morning, Secretary. Good morning. We were able to procure a CT scan with a brand name of Anke here in Western Visayas, Region 6.
Thank you for that answer, ma'am. Maraming salamat, Secretary Duque. I brought this to your attention because I'm already frustrated with the way the regional office in Region 6 is working in terms of providing for the mandate of DOH. Secretary, I know that how you feel is actually how I hear you, and I empathize with the way the DOH is being projected in public, especially that I was also part of the DOH family. That's why I'm bringing up this parochial issue. Kasi po, the district was given an amount for the procurement of a CT scan, specifically for San Joaquin Hospital, being the only hospital in the whole of Southern Iloilo. At ang nangyari po, when it was bidded, hindi kami nangialam, but then to our surprise, nung i-install na, of course, everybody was looking forward to the project. And here comes DOH promoting the brand Anke. Kaya tumawag ako, ilang usapan po yun. Kasi syempre nagulat ako because it's a brand that I've never heard. Sabi ko kung okay naman yan, go. Upon investigation, it turned out that nobody has ever heard about this brand. So I asked the regional office, is there any government hospital using this? And they said yes, pero walang naibigay. After that, we learned that, and it was Director Convocar herself who admitted na falsified yung kanilang certificate of being 5 years or 10 years in the market. I forgot how you call it, but it is a safeguard placed by the central office para yung mga equipments na binibili ng departamento at ng gobyerno, sigurado tayo sa quality. So when I said, if nobody knew about that brand, paano siya pumasa doon sa quality standards ng DOH? And then after that, I was informed that if I have questions, we just file a case. So Mr. Secretary, what is your comment regarding this? And will you be initiating an investigation na maski alam na ng BAC na falsified yung document, pinipilit pa rin? I hope you won't mind, Secretary, but the reason is, being in my district at alam ng lahat ng constituents ko that we funded that, I don't want to be misconstrued as the one promoting that brand. Kasi pag nandiyan na yan, pagkatapos nasira after 1 year or nasira after 2 years, ang sasabihin yan ay ang pinondohan ng Kongreso na CT scan hindi tumagal kasi ang brand hindi kilala.
Thank you, Your Honor. Certainly, I will initiate an investigation on the matter, and I would request, Your Honor, if you could give us some documents independent of the documents that I will require the region to submit, because we would also like to know, you might have some other sources of information that will help us speed up the investigation, Your Honor.
Yeah, Mr. Chair, with indulgence, so that it will be impartial, the investigation can just be handled by the central office. Very basic lang yun eh. You have requirements for procurement. You can check if they have complied, and it's very easy to check with the Department of Trade and Industry and with the Bureau of Customs if indeed a CT scan by the brand name of Anke, which we haven't heard, has ever been supplied to the country for 10 years ago or 5 years ago. Moreover, is there any government hospital, because nobody in the central office and not even the other regional offices are aware of this brand. Para po, kung kunyari lumabas at palaging sira, malalaman po ng sambayan ng Pilipino that it is not the decision of Congress nor of Secretary Duque and the central office, but it is the sole discretion of DOH Region 6. So if I may, Mr. Honorable Secretary, Madam Chair, we will still be having the budget deliberations until the end of this month. Hindi naman po yun mahirap if initial studies can be produced and subsequent admin cases, or if it will result to criminal cases, be filed if indeed there are lapses in the procurement. If indeed your office will find lapses in the procurement, because it's highly irregular for them to be insisting that despite the fact that there is proof that the equipment has not been here for long, ini-insist pa rin nila na tama yung certification because it was the supplier daw who submits. So it's actually solely relying on the words of the supplier and not on due diligence. Moving forward, Your Honor, Ms. Madam Chair, Honorable Secretary, what are the functions of regional director? Hindi po ba ang regional director is the general on the ground? Is it not that the regional director is the one that liaises and represents the Honorable Secretary in terms of programs and projects in the field?
Yes, absolutely right, Your Honor. She represents the Secretary of Health in terms of operations. She supervises, manages the affairs of the region, and represents the Secretary in meetings, conferences with local government units, and also to represent the Secretary in linking up with the representatives, the district representatives, and to find out what the needs of the districts are.
Yeah, thank you very much, Honorable Secretary. Madam Chair, the reason why I'm asking this, first, I really didn't comment, pero later on kasi, nakakabingi po at nakakasakit ng damdamin na pagka may mga problema sa lokal, the constant response of the regional director will always be, nako, ano po, central office yan. The central office and the Honorable Secretary becomes a regular excuse for either wrongdoings or inactions at the level of the regions. And this is not good kasi pagdating sa baba, galit na galit ang tao sa DOH Central Office, galit na galit ang tao sa Secretary and the officers of the Department of Health simply because your generals on the ground will always point to the higher office without even coming out with solutions. And this secretary is very frustrating. Kasi hindi po pwede na yung mga general nyo sa baba, ang palaging sagot, ay wala pong instruction si Sec Duque. Ang tanong ko nga, nakakarating ba doon yung mga problema? Ay, hindi pa po kami sinulatan, ay wala pa pong memo. But that's not the point eh. The point is, as generals on the grounds, any problem on the field will either be relayed and solutions will be arrived at. So I hope you can look into this, and that office infighting should not affect the delivery of work of the department and should in no way affect the reputation of DOH. Because in this pandemic, kung ang palagi nating ituturo ay central office, kaya sangkatutak na napanlalait ang nakukuha ng DOH. But there are some, Honorable Secretary, and to the DOH family, in your family, that kung kayo ay wala, ang palaging tinutulak ay central office. I've also experienced this during my time, and we had that corrected. And this should stop. Moving forward, Madam Chair, on the butika ng barangay. And may we have a comprehensive report on this, because I really look at the first implementation of the butika ng barangay as a failure dahil marami po dun sa mga barangay ang kinuha lang yung pera at hindi naman either na hindi na nakakabili ng tamang gamot because the procurement process was already not handled well, at karamihan naman po yung pera na proceeds nila ay pinapautang. Lastly, Honorable Chair, we have actually a lot of swabbers, as I was reading your report on the human resource augmentation. And most of the swabbers are in mega swabbing centers. That is not a problem. But Secretary, if you will notice, many hospitals na napupuntahan po at tinatawagan ng ating mga LGUs, offices, and even workplaces are drained because they have to source out their swabbers from their own employees. Specifically, I'm referring to GOCCs, like you have NKTI, you have Lung Center, you have Heart Center, you have PCMC. Will it be possible that the DOH preposition swabbers in these offices so that they can respond timely to contact tracing in offices and in workplaces where many cases are actually being discovered?
Your Honor, we do provide and augment healthcare workers such as swabbers in the said corporate medical centers upon the request. So I will look into the request, the latest, and see if there has been action on the said request. We'll do it right now, Your Honor.
Yeah, thank you very much, Honorable.
Kindly wrap up.
Yes. Madam Chair, the last, I would have other questions that I will put forward in the subsequent meetings. These are merely recommendations. But then there is confusion between swabbing or testing the asymptomatics versus the symptomatics. So can the Honorable Secretary enlighten us on this, because it's creating a lot of confusion on the grounds. And my last point is, much discussion was tackled earlier. I agree with Congressman Defensor. Naunahin na muna yung mga hospitals, while the barangay health centers are really first line for primary care. Honorable Secretary, they were provided with equipments before. But I believe the problem there is, once there's a shift in the barangay officials, may tendency po kasi na either nadodonate or nadadala sa ibang lugar yung mga gamit na linalagay sa barangay health stations. At minsan nga, kunyari meron silang kakilalang pasyente, inadadala doon yung mga stethoscope na sinasabi nyo o yung mga BP apparatus. Because all of these centers were provided for the complementary equipments, I believe, for 3 or 4 years ago. And that was the reason why we shifted that on top of the barangay-based health centers, we acknowledge 2 approaches. That is the school-based health centers. Kasi dun sa school, mas merong ownership yung mga gamit, nalilista eh. Meron silang complementary people and 24/7 may tao. Kasi meron silang ibang equipments na hinahawakan. Can you revisit this? Moreover, there were questions earlier of Congresswoman Swansing, which were really good on the barangay health stations. And the response was, walang mga titulo, walang mga deed of the nation. Our experience is that many of the funding for barangay health centers are being coupled with the construction of barangay hall. And we have experiences na pagka andyan na yung barangay health center at walang donation yung lupa, kinukuha ng may-ari ng lupa. So your comments on this, sir. Thank you very much, Madam Chair, for your indulgence.
Thank you. Secretary Duque.
Yes, thank you, Your Honor, Kong Janet and Madam Chair. With respect to the butika ng barangay, butika ng bayan rather, there are already about 76 butika ng bayan and 55 butika ng bayani established outlets which are already operational and licensed by the Philippine FDA. Additionally, there are 29 B&B outlets that have already secured their license to operate from the FDA and very soon to be launched. And several other LGUs have likewise expressed their intent to establish the B&B outlets in their areas and are just complying with the regulatory requirements of the FDA for their LTO. And so we can give you a list of all of this and how the procurement of the drugs and medicines that find their way into this butika ng bayan and butika ng bayani. Doon po sa katanungan ninyo, yung suporta, yung mga equipment na binibigay naman sa mga barangay health stations, kaakibat po ito nung atin mandato sa ilalim ng Universal Healthcare. We give the support, but you're right, I will also revisit how the prioritization is done and how this influences the planning of the support that is being given to these primary care facilities. So we take note of your suggestions, much of which I believe are going to be beneficial to the pursuit of primary care and their operationalization so that their services are indeed felt by our disadvantaged people.
Secretary Duque, kindly take a look on the concern of Kong Janet on the procurement process of Region 6 and then provide the list of Butika ng Bayan and Bayani as she requested and all other matters that she raised. Kindly provide all the reports.
Yes, ma'am. We will prioritize the investigation of the said. We will create a fact-finding committee to look thoroughly into this procurement of a rather unknown brand. Ano ba yan? Angke daw. Yeah. So papatingnan po natin ito sa lalong madaling panahon. You have my word, Your Honor, Madam Chair.
Okay, thank you, Secretary. And siguro ano din yan, lesson sa all regional offices natin, no? That yung procurement po of certain equipment ay pinag-aaralang mabuti at tinitingnang mabuti, no? Para hindi po nasasayang ang pera ng ating taxpayers, no? I would like to call on Representative June Gato. You have the floor, sir.
Thank you very much, Madam Chair. Magandang tanghali po, Secretary Duque.
Good afternoon, ma'am. Good afternoon, sir. Magandang tanghali.
Una sa lahat, nais ko pong magpasalamat sa DOH family na napapanatili namin at napapanatili, malaking tulong ng Department of Health na napapanatili na COVID-free ang aming probinsya. Maraming salamat po. My first question is, may I know the status of the air ambulance services of the department, Madam Chair?
Secretary.
Madam Chair, can I invite in once again Director Gorgolon for her rejoinder to the question?
Sir, good morning again. As far as the 2019 ambulances, all of this
air ambulance, ma'am.
Ma'am, wala, sir, wala po tayong air ambulance. Under HF.
I remember last year, we were requesting for an air ambulance kasi alam niyo po, Madam Chair, ang probinsya ng Batanes ay tanging air transport lamang ang paraan para makatawid kami sa Luzon. We do not have land, we do not have sea transport. And the only referral center is Tuguegarao, which is about 1 hour by travel by air. And as you know, we only have one functioning hospital in the entire province of Batanes, level 1 at that. And of course, as a level 1, we expect the need to transfer patients that require secondary or tertiary care. At alam po ninyo, pagka kailangan namin maglipat ng pasyente, wala kaming ibang choice kundi eroplano. And we really appeal to the department na sana magkakaroon ng air ambulance services para naman ma-address yung matagal na problema ng aming probinsya, Madam Chair.
I agree with Representative June Gato. I think it's about time, Secretary, baka pwede pong ma-raise nyo with the President himself the need for air ambulance kasi yung experience natin with Representative Titas Ramos, no? And nung naitanong ko kay Yusek
Maintenance yan eh.
Sir Harry kung meron tayong air ambulance, na-mention nga niya sa akin na wala, no? Although aware ako na wala po talaga tayong air ambulance. But ang dami natin po kasing islands, no? At lahat yan walang access sa Apex Hospital o referral hospital. So baka pwede naman for this budget 2021, baka po pwede po talaga na mabigyan talaga ng priority yung air ambulance. Secretary Duque, may chance pa. And I'm sure the whole Congress and Senate will support that proposal.
Oh yes, we will communicate this to the Office of the President for prioritization. I understand that the Health Emergency Management Bureau, represented by Director Glo Balboa, might be able to share with us what her plans are in response to the manifold request of our good Congressman Gato to respond to the acute need for air ambulance for immediate transport of patients needing higher level or apex hospital services. So, Director Balboa, please.
Yes, Director Balboa, you have the floor. Director Glo Balboa, is she here?
Can we have Director Ronald Lau, Division Chief Dr. Ronald Lau, who might have the information requested.
Dr. Lau.
Good afternoon po, Congresswoman Tan. So we have taken note of that important request, especially in the context of our GDAS. So the need for air ambulance has been identified even before naman po. So we have taken note of that, and pending yung ano naman po, yung process of yung po, getting the approval to President, we're willing to do the necessary staff work po to be able to look into that very important request po, Your Honor. Thank you.
Thank you.
Thank you. Sana po matulungan niyo po kami, lalo na sa aming probinsya. And I'm sure as Chairman, Madam Chair has said, I'm sure yung mga ibang mga probinsya or island municipalities na kailangan ng mga immediate transport ng mga pasyente ay kailangan. Now, my last manifestation, Madam Chair, regarding the percentage coverage ng PhilHealth. I think I heard from the presentation kanina na 100% na yung coverage ng PhilHealth as of 2020. I have been practicing ENT doctor for the past 30 years, and until now I still do my practice. Marami pa rin akong pasyente na hindi pa rin sila miyembro ng PhilHealth. So I am a little bit concerned with the statement na 100% na ang coverage ng PhilHealth. I don't know how we can validate that report, or maybe we can, I don't know how we can solve the problem of PhilHealth membership, Madam Chair, Secretary Duque.
Yes, I think we can ask SVP Nerissa Santiago to respond on your query.
Yes, Madam Chair, thank you. Congressman, regarding po this coverage po ng PhilHealth na for eligible to avail of the benefits, because of the provision in the law na meron po tayong immediate eligibility ng bawat Pilipino, they can avail of the benefits po. So, 100% na pong covered din lahat ng mga Pilipino. Kaya po natin sabi 100% po coverage natin.
Ma'am Neri, again, i-reiterate ko lang po yung na-mention ko kanina, I guess, kasi kulang po tayo sa information dissemination, no? Maraming hindi nakakaalam, and even your regional offices or the LEO are not aware that you're implementing that immediate eligibility. Although kailangan properly explained sa kanila na should kung yung isang individual na or displaced worker ay bumalik doon sa trabaho again or nagkatrabaho, mawawala siya doon sa subsidy, no, program ng gobyerno. So kulang po kayo sa paliwanag. Paulit-ulit po namin yan sinasabi sa PhilHealth. Ang daming pagkukulang po ng PhilHealth pagdating sa information dissemination. So tama po yung sinabi ni Kong Jun Gato, hindi po yan yung nangyayari sa baba. Pagka po sasabihin nyo, saan po kayang facility yan, i-report sa inyo, parang additional trabaho para sa mga facilities or individuals. Siguro po, ayusin yung communication po ninyo or information dissemination.
Po, Madam Chair, is well noted po. Actually, we have issued already advisory regarding the immediate eligibility. Ito po yung advisory number 37 issued in last year, 2019. But we will reiterate po, mag-issue po rin ng bago advisory. And I think there are kamustahan naman po with the providers as well as Alaga Ka and Reach Out programs ng PhilHealth na ongoing din po during this pandemic.
Madam Chair.
Make sure that the operational guidelines of that circular is fully understood by your partners in the ground. I think yun yung problema how to operationalize that circular. Hindi masyadong naiintindihan. Hindi po pwedeng nakasulat sa papel pero hindi naman nai-implement properly in the ground. Yun lang, yun yung pinaka-importante siguro. Yes, Kong Jun.
In the immediate eligibility, does that apply to both medical and surgical case?
Madam Chair, yes po. Applicable po for both medical and
there is no more, wala na yung sinasabi nila na kailangan nakabayad ka ng 6 months or 9 months pag surgery?
Wala na po yun.
Okay. Thank you very much, Madam Chair. Marami pong salamat, Secretary Duque. Thank you.
Salamat din po, Congressman June Gapo.
Thank you, Kong Jun. Can I get the answer na on my query earlier regarding the budget for PPEs and how much was given for the procurement of thermal scanner?
Yes, Your Honor, Chair, Yusek Mirna Kabutahe is requested to answer, please.
Okay, Yusek Mirna, please. Yusek Mirna.
Yes, thank you, Madam Chair. For the PPEs for 2020, Madam Chair, we had from PAGCOR 1.8 billion, and for the Bayanihan to Heal as One Act, 20 billion. Initially, it was 30 billion allocated in the law, but we gave the 9 billion for supplies for testing. And then we had our savings in the PITC. These are savings from previous procurements of various items, 216,730,500. And then we repurposed some of our funds of 2019 and 2020 to buy PPEs. 544,828,289.12. We also had other fund sources like our NDREAM funds and our Health Emergency Management Bureau funds in the amount of 222,015,100. We had the World Bank loan for PPEs at 503 million, and we have an ADB loan for 2020, mostly for Region 3, that's the BGI and that's the lab, 457 million for a total of 24,460,897 for PPEs for 2020, Your Honor. The remaining of the 20 billion from PSDBM has not yet been all delivered.
The Chair,
Breakdown, Madam Chair.
yeah, Chair, the thermal scanner can be answered by the Bureau of Quarantine Director Ferdy Salcedo para makumpleto lang po yung kasagutan, Chair.
Yes, Secretary. But Secretary, Yusek Myrna, out of 24 billion, na-spent na po ito lahat?
Not yet, ma'am. Ang hindi pa na-spend ay we have about less than 9 billion with PSDBM. That's the second tranche because we had 10 billion, it was all delivered, and we had a 9 billion ongoing pa ho ang delivery. Almost 90 billion.
90%? Ilang percent po?
Mga kwan, 9 billion, 10, 24, and then minus 9. About 1/3, 70%, Madam Chair. But ongoing pa ho ang procurement doon sa PSDBM for the second 10 billion
Okay.
of the PPEs.
Kindly provide us the details of the report on these funds.
Yes, Madam Chair.
Prior to the scheduled budget hearing on the Committee on Appropriation, Yusek Mirna. With regards to my query on the thermal scanner, Director Salcedo.
Yes po, good afternoon po. Bureau of Quarantine was able to procure about 50 units of thermal scanner from the QRF fund. Yes, ma'am?
How much was given to you for the thermal scanner? Were you able to get...
from QRF po, ma'am. 90 million.
Okay.
Opo. So we were able to procure about 50 units.
Out of 90 million, 50 units, what kind of thermal scanners?
Dapat si Kwan ang nag-check ng mga ito, hindi ako.
Anong
Director Salcedo?
The FLIR, ma'am. Ang brand name is FLIR.
Can you provide us the details of the report on the 90 million thermal scanners and saan po ito naibigay?
Yes, ma'am. We will provide you with the allocation list.
Okay. Thank you so much, Director Salcedo.
Thank you po.
Thank you so much. Next to ask question is Representative Ace Barbers. I was informed he's going to give his time to our Vice Chair, Representative Mike Defensor. Is he still here? Okay. Kung wala po, I would like to call on Representative Nikki Violago.
Thank you, Madam Chair, and good afternoon to everyone. Good afternoon po, good afternoon po, Secretary Duque.
Yes, good afternoon, Call Mickey.
Apo. Hindi, meron lang po ako na isang concern regarding po sa ating mga cancer patients. Kasi po dati, nagbibigay tayo ng subsidy sa ating mga cancer patients po na nag-undergo ng mga treatment. Sa ngayon po kasi, marami na po na hindi bumabalik na cancer patients na uli po na undergo ng kanilang therapy, gawa po ng lumiit daw po ata ang ating subsidy.
parang 5,000 po ata ang ating subsidy dati. Pero sa ngayon po kasi kinukulang na. Kasi po tumaas lahat ang kanilang billing statement. Kasi po nagbabayad na sila ng mga PPE, yung mga ganun po ba, para dun sa mga ospital. Yung mga HEPA filters, yung mga ganun po, nagdadagdag sila ng binabayaran. Ang ano ko lang po, Secretary Duque, sana po mabigyan pansin pa rin po natin tong mga cancer patients natin. Sana po madagdagan din natin ang kanilang subsidy muli. Kasi nga po, sa kanila na po pinapatong yung mga additional safety measures ng ating mga health workers, Secretary Duque.
Sec.
With your permission, Madam Chair, can I ask the Chair to please recognize DPCB, this is Prevention Control Bureau Director Nap Arevalo, to answer the question of Kong Miki.
Good afternoon, everyone. Thank you, Secretary Duque, Madam Chair. As of now, we have already enrolled 3,786 as of July for the Breast Cancer Medicine Access Program. And for the Childhood Cancer Medicine Access Program, as of July, we have already enrolled 2,651 patients. Likewise, we have expanded our breast cancer and childhood cancer as targeted for 2020. For breast cancer, we have from 10 to 17. For childhood cancer, there are 5 from 10 breast childhood cancer medicine access program, 10 facilities. Now we have expanded it to 17. And then for breast cancer medicine access program, from 14 facilities, we have expanded it to 20 access sites. And also we have proposed for an increase in budget for our medicines for cancer. And for those who have access the DPCB and the offices of the department for assistance, we have referred them to our public assistance unit for enrollment, as well as to our hospitals. Like recently, we have enrolled a patient in Baguio General Hospital seeking assistance for a cancer patient. So now we are in the process of procuring our cancer drugs at the PPPI. Back to you, Secretary, Madam Chair. Thank you po.
Madam Chair.
Go ahead, Kong Miki.
Kasi po may report sa akin, galing po ang mga pasyente ng PGH. Ngayon po, hindi na sila tinatanggap ng PGH for the elective procedures po. Kaya ngayon, ang patient ng PGH po, yung iba, nire-recommend nila pumunta sa private hospital. Ang problema po, pag nagpunta sa private hospital, mas malaki po ang binabayaran ng pasyente. Kasi nga po, nagbabayad sila na additional para po dun sa safety gears ng ating mga medical practitioners. Kasi po, ang ibinibigay lamang daw po kasi sa kanila na subsidy ng ating ng DOH is only 5,000 pesos para po sa kanilang tulong. Ngayon po, ang request po sana nila, sana nga raw po ay madagdagan ang kanilang subsidy kahit po sila mapunta sa private hospital, hindi po malaki masyado ang kanilang nilalabas. Kasi po ngayon, ilan na po ang pasyente natin na cancer patient, hindi na po bumabalik dahil nga po natataasan dun sa binabayad. And pagbalik nila sa ospital, it's too late for them kasi marami na silang na-miss na treatment. Yun po, Madam Chair. Sana po, hindi lang sa facilities tayo magdagdag. Kasi po may mga pasyente tayo na nagpupunta po talaga sa private. Sana po pati sana dun sa mga patient na nagpupunta sa private hospital, matulungan natin, Madam Chair.
Thank you, Kong Miki, for bringing that up. Secretary Duque, isa sa provision natin in Malasakit Center, kasi currently ang Malasakit Center is I think established only sa DOH and specialty hospitals. I think may provision tayo doon nakalagay na pwedeng humingi ang nasa private facilities doon sa kung saan yung pinakamalapit na malasakit center. So it's just ang kailangan lang mag-usap yung facility, let's say it's a DOH hospital, makipag-usap doon sa kalapit na private hospital at ang fund na ay manggagaling doon sa government, sila yung magbabayad sa private hospital. Are we implementing that?
Thank you, Chair. Can I please ask SVP Neri Santiago or anyone from the Benefits Development and Research Office to answer that question?
Sir, for Malasakit.
Dito naman sa Malasakit lang, as of August 2020, we have a total of 80 Malasakit centers established in the country and 3 established in the DOH hospitals, 31 established in the DOH hospitals, while 48 in LGU hospitals and 1 state university, which is PGH. And through the Malasakit program, it is our target to establish Malasakit centers in all DOH hospitals within the year. Now, whether they're not working with the private facilities that provide infusion, chemotherapy, and other treatment modalities, I guess PhilHealth should be in a better position to address this. Thank you, Chair.
Thank you, Secretary. Ma'am Neri Santiago.
Currently po, ang packages natin covers 4 na cancer packages. This includes acute lymphocytic leukemia for the children, breast cancer, prostate cancer, and cervical cancer.
Ma'am Neri, bad yung audio mo. Can you repeat your reply?
Regarding po, dun sa 3 packages natin, ang covered na cancer packages are yung acute lymphocytic leukemia for the children, breast cancer, prostate cancer, at saka po cervical cancer. Malinaw na po.
Yeah, but ang question ni Kong Miki is how can we expand the coverage, I think. Tama, Kong Miki?
Opo.
Yeah. Ang tinatanong niya, kasi ang laki ng out-of-pocket ng ating mga chemo patients, no? Is there a possibility? Ang alam ko kasi pwede nilang lapitan ay Malasakit Center or kung government hospital, yung MAIP program ng DOH. But since ang kwento niya, hindi na tinatanggap sa government hospital na pupunta sila sa private hospital, ang pwedeng program that you have and the DOH has, I think, is the Malasakit Center. So baka kailangang i-operationalize na natin yung partnership between the government and private facilities when it comes to accessing assistance of our indigent patients or kahit hindi indigent, alam naman natin na kung ang patient ay nagkikimo, kahit well-off ka, there will come a time na ma-exhaust ang financials mo. So, do you have a plan of doing that?
Meron naman po plano, kaya lang po, ang nasa priority po natin is the expansion of primary care benefits as well as yung
Chair, can I just partially, Chair? Can I answer?
Yes, Secretary Duque.
Yeah, as a universal healthcare po, dun sa ating tinatawag na province-wide and city-wide health systems, yung networking concept ay ang private sector capacity ay pwedeng i-mine nung LGU, yung kapasidad ng mga private clinics or facilities na may kakayahan po magbigay ng chemotherapy and other treatment, cancer treatment. So, pwede po natin tingnan ito at po ito mga integration sites. Kasama na po ito natutugunan. Salamat po.
Thank you, Secretary Duque. Sana po matingnan kaagad yan kasi hindi lang chemo patients or dialysis patients ang nangangailangan at this time. We do have a lot of non-COVID related patients needing assistance. Kong Miki, are you done with your questions?
Yes, Madam Chair, ito lang po yung concern ko kasi po marami akong mga constituent na nagtitext sa akin na cancer patients na yun na nga po kasi dati ang recommendation natin always is PGH. No po. Ngayon po dahil tinatanggihan na sila kaya napipilitan po silang pumunta ng private, Madam Chair.
Okay,
thank you, Madam Chair, and good afternoon po.
Thank you, Kong Miki. Would like to call on our Deputy Speaker, Henry Owaminal.
Thank you very much, Madam Chair. Good afternoon. Good afternoon to the DOH family headed by my idol, Secretary Duque.
Good afternoon, sir.
Yes, sir. Alam ko naman that you are very supportive to the concerns of the different congressional districts, and we do support you also in your national programs. Except that at present, because of your very hectic schedule, so hindi na kami nangingistorbo sa iyo, kundi dito namin pinalo up na sa mga generals mo on the ground. Sir, I would just like to reiterate again my concerns, and this refers to the full implementation of Republic Act 10865, which upgraded the beds capacity of Mars Medical Center and authorized it also to cater with specialized cases. Ang concerns natin since 2018 after the law was passed was the infrastructure and the medical equipment. So far, since 2018, we requested for that MRI equipment and that of the dialysis machine. At least ang dialysis machine at 10 units ay na-deliver na. Yun lang yung MRI which nahihirapan tayo in the next 2 years, 2019-2020, na hindi na isama sa budget. And the other thing is yung in order to complete the 500 beds capacity, which as of this time, we have now another pending bill, and it's now with the Senate to upgrade it to 1,000 beds capacity because the actual capacity now of the hospital is now more than 500. It's now 600 a day. Ang ano lang is, as per information from Director Gorgolon, na itong 2020, yung infra natin ay nasa unprogram, wala namang nangyari sa unprogram. Tapos ngayon naman daw, itong 2021, wala din daw tayong infra, nasa unprogram naman yung infra. I'd just like to share na ngayon, yung hospital natin, mayroon tayong na-allocate sa 2019 for 4-story in order to complete the 500 beds capacity. Pero yung pondo kasi kulang hanggang 3rd floor lang instead of 4th floor. And then, hindi rin magagamit. No? So, kailangan talaga tapusin. So that I am making representation na itong sa 2021, sana ma-prioritize natin na yung infra doon na natin ilagay sa program funds, no longer in the unprogram funds. And I understand Director Gergelin is listening now, and she can make some sort of a good comment to this or a good recommendation. After all, it is we Congress. Pag ilagay natin dyan na yun yung priority needs of that particular hospital or that particular district, So tayo naman ang mag-a-approve, di sana sundin na lang sana ng HPIP coordinator natin, isama na lang sana yun sa listing. So that is my first concern, my idol, Secretary.
Secretary or Director Gorgolon?
Yes,
Director Gorgolan, please,
Madam,
with your permission.
yes, Madam Chair, Secretary and Kong Uwaminal. So, given the no appropriation of infrastructure for 2021, we requested an appeal, or we submitted an appeal in the amount of 10 billion, just to make sure that we have an allocation for infra in a total of 7 billion and additional 3 billion for equipment. So I hope, and I think this will answer all the concern of the raised issue from the different congressmen. So I hope you can help us on this, because we firmly believe that we have to complete the infrastructure that has been incomplete for the last 2 years, because for 2020 and for the next year, which is 2021, wala po tayong infra. So I hope you can help expect on this. Thank you very much.
Kaya nga, Mr. Secretary, Madam Chair, kanino tayo mag-request? If it is Congress that approves, why not submit that proposal? Itong pundo na ito, specific naman yung source of fund, it's fit. So why not make that proposal, submit it to us, so that once we approve it, so that becomes now the priority. I cannot understand why we have to make representation to the DBM for another 10 billion na kung ano yung allocation binigay ngayon, bakit hindi natin isama yan as priority? Sino ba mag-determine na ang priority equipment or infra?
Director Gorgolon, Director, di ba
Yes.
merong dinevelop yung Philippine Health Facility Development Plan co-developed with ADB, and it was given to your division. Are you going to use that recommendation for 2021 budget?
Ma'am, we will collaborate with HFDB. What we had proposed for our appeal is based on the existing request. So we will check on that, because as earlier stated, a total of 37 billion was requested from the different stakeholders. But given that DBM only allocate 4.7 billion for equipment, we submitted an appeal for this. And this was based on the request or submitted priority by the different regional offices and hospitals po. But we will collaborate with HFDB so that they can help us push for this appeal. Additional 10 billion po. Thank you.
Okay, Madam Chair, abangan na lang natin doon sa APRO hearing, no, na nandyan yung DBM. Bakit equipment lang yung inaaprubahan nila? Anong gagawin ng equipment kung walang building mapaglagyan? No. So, okay. We will take note on that, no? And we will try to bring that matter to the DBM during the budget hearing of your department. Now, I have another concern, no? Of course, I presume that yung equipment ko, Director, yung MRI na 2018 pa natin naka-line up, sana kasama yan sa equipment na pinapasok mo ngayon, yung sa 4.7 billion. Now, my second concern is that, Secretary, just last month, nag-distribute kayo ng ambulances to the different congressional districts. Doon din sa district ko, mayroon kayong binigay na 6. Unfortunately, yung 6 na pala yun was determined by my good colleague, party list Congressman Bin Kanama. So, nagtaka ko nasaan yung determination ng regular representative sa Sikan District.
And as a matter of fact, when it was distributed, medyo parang salimposa na lang ako na nalaman ko it's going to be on that and it was already convened kanama who informed me of such distribution. So anyway, hindi pala para sa ano yun, I mean, it was not through my representation. So ang ano ko ngayon is hindi kasi lahat na bayan ko ang nabigyan noon. So kumusta naman po? Can I be afforded as representative of the district the privilege and the right to determine also the beneficiaries of an ambulance from the Department of Health? This is 2020 release, no? Just last month lang ni-release ninyo.
And that's 2019 budget, sir, no? 2019-18 budget.
I don't know if it's 2019, but they just released it. But be that as it may, even if it was based on 2019 budget, I was already the congressman at the time. No? So may we ask clarification from Director Gorgolon, why is this happening?
Director Gorgolon? Sir, you are from Region
10, Misamis Occidental, 2nd District.
Director Gorgolon, kindly respond.
The listing of the ambulances that were distributed for 2019 comes from the congressional offices po. So it was not HPEP who submitted the list po.
I am already the congressman of the 2nd District. I am now in my 3rd term. So if it was 2019, why has the list not been politely been coursed through me, or I was asked to submit? But I remember I was asking for ambulance way back in as early as on the first year of Secretary Doke.
Do we have the director of Region 10?
Director Adrian Subaan, please.
Yes, Director Subaan.
Good afternoon. This is Dr. Gomolo, the ARD of Region 10. Dr. Subaan is on official travel. With regard to the ambulance, our office, the regional office, just facilitated the procurement of the ambulances based on the listing provided to us from the central office. When we procure the ambulances, we already know who will be the recipient LGUs based on the list downloaded to us.
So you were saying ARD na ang list of recipients ay nanggaling sa central office?
Yes po.
Ma'am, bakit yan, Director Gorgolon, maisagot niyo yan. At saka Assistant RD, bakit yung distribution ay hindi naman nga nabigyan ng courtesy itong representative ng 2nd District, no? Although pag nalaman ko na lang, wala namang coordination, nakita ko na lang, hinabol, nilagay ako sa program, which I don't have even an invitation. But anyway, we will hit first my concern. Why is this happening when the congressman of the concerned congressional district, no, who is supposed to determine the beneficiaries of the ambulances, was not consulted or was bypassed in this particular undertaking?
Sir, if I may, sir.
Director Gorgolon.
Yeah, actually, I just would like to clarify that all the listing of the 2019 ambulance were mostly congressional insertions. So even HFEP or the Department of Health was not consulted. Kasama na po siya doon sa GAA. So hindi po kami. So there was no consultation really. Ang po, lumabas na lang siya doon sa GAA po. Thank you.
So Madam Chair, parang naibalik sa atin yung bola. Tayo ang may kasalanan.
That was during the BICAM?
Yes, ma'am. Yes, ma'am. During the BICAM.
Well, okay, we can take that. I'll take that honest to goodness response of the DOH to Director Gorgolon, and it is something that we should. Yeah, I remember that was 2019. My regular budget also in the DPWH was reduced with 2.5 billion. Anyway, so, okay, I now understand the situation. I hope Director Gorgolon say that we would be given also in this 2021 budget, no, may allocation ako na ambulance kung mayroon tayo sa regular budgeting ninyo, because mayroon akong municipalities doon na kailangan talaga ng ambulance. As a matter of fact, dahil wala tayong maibibigay, ako ang nagbigay ng personal ambulance ngayon na ginagamit nila in order to serve, no? At isa lang yun, kulang pa rin yun. Now, let me proceed to my next concern, which I believe this will be applicable nationwide. Sig, ang sabi ni Director Gorgolon, hirap tayo ng pira ngayon for the infrastructure. Now, Congressman Garin was raising about the school-based barangay health stations. Ano nga pala nangyari sa pundo ng barangay school-based BHS natin? Because what I can recall is that when the current administration assumed office, that was an issue of an investigation with the good government. So yung sa implementation, kasi kung hindi natuloy yung implementation, I understand 15% lang yung nabayad natin dahil hindi nagawa sa contractor. Why not we realign these funds now? Because I believe that's more or less 7 billion pesos para kung natingga doon, di at least yung pira magamit natin sa pressing infrastructure needs of the country through the different congressional districts.
Thank you, Madam Chair. Thank you, Kong Deputy Speaker Henry. May I request the USEC Lilibeth David or Director Gorgolon to give your rejoinder to the question.
Go ahead.
Third, Director Gorgolon here. As far as the status of the BHS Phase 1, there was already a decision of the Court of Appeal sided with the Department of Health in paying only the completed 270 units of the barangay station on July 29, 2020. And for Phase 2, and the Regional Trial Court hearing started December 9, 2020, there's still a pending decision from the Regional Trial Court of Manila. But as to funding status, ibalik na po yung pera sa coffer po. Thank you po. Hindi na po natin magamit.
Yeah, yes, Madam Chair, that's a good information, Mr. Secretary. So kung naibalik na yung pera, bakit hindi natin yan gamitin, no? Kasi as what we heard earlier that the department is making representation, is submitting proposal to the DBM for a 10 billion, 7 to 10 billion infra in order to address the pressing needs of infrastructures in the different hospitals throughout the country. And as what I can recall, the Phase 1 and Phase 2, that's more or less 7 billion. So kung certain units lang ang mababayaran, so yung balance, ibig sabihin nakatingga lang yan, and that was 2016. So why not we use that funds to address the current needs pending the action of the DBM? Kasi kung sabihin ng DBM 2021 iyon na yung pundo, wala nang maidagdag. So we can just as well use that money, Mr. Secretary, para at least ma-address na yung pressing infrastructure needs of the department.
I support that position, Chair and Kong Henry. But this has to be, we have to meet with the DBM as to how this remaining fund can be administered precisely to increase or ramp up our service capacities.
Okay, thank you very much, sir. Probably, sir, yung Secretary, sa budget hearing natin by Monday, the DBA will be there. We would appreciate na mayroon ng initial discussions in open ninyo para at least hindi na sila magsiproblema kung saan kukuha ng pira yung 7 to 10 billion request nyo for the infrastructure projects for 2021. Thank you very much for this support, Mr. Secretary. And then one last concern is
Last question, yes.
Yeah, thank you very much, Madam Chair. This will be my last question. This is again another parochial concern. Yung Mars Medical Center natin is a referral facility. It's a DOH retained hospital, referral facility that address the needs of not only Misamis Occidental but also adjacent provinces of Zamboanga del Sur, Zamboanga del Norte, and portion of Lanao del Norte. Our chief of hospital has been asking for RT-PCR laboratory machines, no? And this is being supported by the local government units there. And as a matter of fact, the local government of Osami City, through the mayor, is preparing for the space where this laboratory machine can be installed. So may I request, Mr. Secretary, if this can be accommodated na allokitan ang Mars Medical Center ng isang RT-PCR, because as of today, doon pa rin sa Cagayan de Oro namin dinadala yung mga specimens. And then, considering that Cagayan de Oro is handling many provinces, minsan may quota pa, may allocation pa kami na limited only to that number of tests para kasi overwhelmed na yung yung laboratory machines natin sa Cagayan de Oro. So can I have this request, Mr. Secretary, be considered in your priority for the laboratory machine?
Yes, Kong Henry, in principle, I support the request, but I have no idea right now what is the level of inventory of our RT-PCR machines. But let me just refer the question to Yusek Rosette Vergere. Rosette, please, with the permission of the chair.
Yusek Vergere.
Yes, good afternoon, Madam Chair, and good afternoon to all the honorable members of Congress. We take note of the request, Deputy Speaker. Currently, we have this World Bank allocation of RT-PCR machines. We'll try to check po kung ano na po yung estado ng allocation so that we can also see yun pong CDO, yung sa region po, kung ano po yung ating mapping of our RT-PCR labs there. But definitely, we're taking note of your request, sir.
Okay. Thank you very much, Mr. Secretary. Thank you very much, Madam Chair. I will appreciate that next week I will be giving a feedback as to the status of this request. Again, thank you very much, Madam Chair.
Thank you, DSO Waminal. Director Gorgolon, can you give us the update on the status of the procurement of the dental van? Naalala ko, meron kayong malaking budget for dental van in 2019.
Yes, Kong. For Dental One 2019, Yusek David has just signed the notice of award yesterday. So about 22. So anytime po magkaroon na ng delivery. Well, for the 2018, it's with the PATC. On process na rin po yung procurement. Thank you very much.
Okay, thank you so much, Director. I'd like to call on Representative Adrian Ebcas.
Good afternoon, Madam Chair, Secretary Doki, and to everyone. Matanong ko lang si Secretary, reflective na ba sa DOH budget yung government's plan to procure COVID-19 vaccines once they are available in the market by mid or to late 2021?
Meron po tayong right now nakapaloob sa budget for 2021 2.5 billion pesos worth of COVID-19 vaccines. But we're asking for more because we want to have wider coverage and to include about 20 million Filipinos, subject to prioritization, of course, to be provided these vaccines once they become available. So we're still asking for about an additional 12 billion to be able to cover about 20 million vaccinees. Because right now the 2.5 billion will only give us about 3 million vaccinees. Will only allow us to vaccinate about 3 to 3.5 million vaccinees.
Masyado lang maliit pala, Mr. Secretary. Kung sakali yung sinasabi mo na yung mga recipient 3 million, may order ba o priority kung sino ang bibigyan ito or at your own pleasure na sa Department of Health?
Yes, meron po tayong prioritization allocation plan. Yung po mga frontliners, healthcare workers, mga senior citizens, and those with comorbidities. Sorry. Ito pong 6 na mga iba't ibang mga grupo. Nabanggit ko na po yung frontliners ng Bureau of Jail Management, Penology, and Bureau of Correction. Yung medical frontliners, yung mga doktor, nurses, lahat po ng mga direktamenteng kumakalinga at gumagamot sa mga COVID-19 patients. Yung pong mga vulnerable persons, yung pong mga diabetes, mga iba pa po kaakibat na sakit, at mga indigent population. Ito po mga 4 million na mga katao at mga PNP at saka AFP, uniform personnel. So ang total, ang pangkalahatan pong pinaplano natin mabakunahan ay mga 20 milyon katao, Your Honor. At ang kinakailangan pong budget nito at 305 pesos per dose of vaccine will be about 12.8 billion pesos.
Thank you, Secretary. Follow-up question ko lang. Yung funding for doctors, nurses, and other healthcare workers deployed to unserved and underserved areas under the Human Resources for Health Deployment line item is slashed by about 2/3 relative to this year. Does this mean paraplang rural areas will be served by fewer healthcare workers here? What areas shall receive prioritization under this program?
Your Honor, the prioritization would clearly indicate that the GIDA areas are one of the main beneficiaries of this deployment program. And then the other criteria or parameters would include the population of the catchment area of the health facility, then the GIDA areas, or areas where we have the indigenous peoples, and also those identified as having gaps in current human resource for health vis-a-vis recommended HRH to population ratio. And then next would be the national government priority areas, like the identified doctor-less areas, the 5th and 6th class poor municipalities. and focused geographical areas, accelerated sustainable anti-poverty program, and the whole of nation initiative and bottom-up budgeting, the need for specialized care or services as mandated by law. So these are the parameters that underpin the selection of priority areas for the deployment of our various human resource for health professionals, Your Honor, Madam Chair.
Lastly, Madam Chair, Secretary, hindi ito tanong pero this is in a form of manifestation that for the last 3 months, habang nasa Mindanao ako, nag-iikot ako ng mga electric cooperatives. No, there are number of hospitals in the province of Misamis Oriental, but only Northern Mindanao Medical Center or in MMC under the supervision of Dr. Jose Chan caters the majority, if not all, COVID cases in the province. So in this connection, I humbly request the good secretary to please take a closer look at the needs of these hospitals, specifically their priority, MOOE, no, maintenance and other operating expenses, to effectively and efficiently deliver the needed medical services for our brothers and sisters in the Misamis Oriental Province. Kasi kawawa talaga doon, nakita ko yung mga frontliners natin. Kasi sa budget nila, hindi naman ito yung mga COVID cases na, of course, nakasama. Pero since andito na ito, yung mga frontliners or yung mga workers, yan pa rin. No? So I think, Mr. Secretary, baka naman mabigyan mo consideration yung MOA nila kasi apektado ang services eh.
Sige po, Kong, I will direct the Regional Director Adrian Subaan of Northern Mindanao to look into this immediately to make an assessment of the gaps or the deficiencies in the delivery of basic health care in your district in Miss Ok. Thank you, Your Honor.
Mr. Secretary, pwede ba kasama ako doon sa discussion nila? If ever lang, no?
Opo, sasabihan ko po yung ating Regional Director, kayo muna ang puntahan to give his courtesy call upon the good congressman and take that opportunity to articulate or to discuss the priorities that you have set forth in that particular area.
Maraming salamat, Secretary Doki, sa kabaitan mo. Madam Chair, yun lang lahat ang iyong mga katanungan ko.
Thank you so much, Rep. Adrian. Would like to call again Representative Stella Kimbo.
Madam Chair, I just have a pahabol question to Secretary Duque. Sec, ano pong gagawin po natin sa case rates ng PhilHealth? So alam niyo naman po that in the last 9 hearings po on PhilHealth, lumabas po na napakarami pong problema with case rates. So I'd like to know po anong plano po natin pagdating po sa pag-review ng case rates and whether we were able to include a sufficient budget po for purposes of reviewing the case rates po.
Thank you, Your Honor and Chair. Ang alam ko po, ginagawa ng PhilHealth sa ngayon, and I think VP Neri can provide the correct information here. Meron pong costing formula na ginagawa for the case rates. I believe the case rates costings are probably a bit old, if not responsive. So, SVP Nari, can you please give us the latest with regard to the plans for the case rates?
Thank you, Madam Chair, Secretary. Yes, continue. Our direction for the case rates is we will be we are already studying the transition to the diagnosis related groupings. The costing framework that was approved by the board includes the DRGs, and we plan to have it in place by 2022, considering the surveys and the costing methodologies that have been approved. The DRG will be the basis of the global budget for the hospitals.
So SVP, magkano po ang binudget ninyo for this year for purposes of that? Yung alam naman natin that we need to do some surveys, and I suppose you'll have to hire consultants also to help you. So magkano po ang kabuuang budget po for this purpose?
Currently, Madam Chair, we have asked the technical assistance from some agencies like the ThinkWell. We asked for their assistance in terms of coming up with the DRGs. Tama po yan we will inquire po. Pwede po namin i-provide sa inyo yung specific budget for the DRG costing po for this year and the next year.
Nakikiusap lang po ako na sana po sapat po ang budget na ilagay po natin dyan. This is a very important undertaking. Napakarami po ng case rates natin. There are over 8,000 of those. So if what we need to do is make 8,000 estimates of case rates, napakalaking undertaking po niyan. I think in the past po, sa tingin ko po, we had underestimated that effort. And kitang-kita naman po natin in the last 9 hearings po sa Congress pagdating po sa PhilHealth fraud, nakikita po natin na ang laking role na play po nitong all case rate system. So sana po sa pag-compute nyo po ng budget requirements at pag-draw up ninyo ng plano sa pag-review, sana you take all of these into consideration po, Madam Chair.
Madam Chair, we will take note of it, and I completely agree po na malaki po ang role ng costing ng DRG for our hospitals.
Madam Chair, that would be all. Thank you.
Thank you so much. Next to ask question is our Deputy Speaker, Lauren Legarda. Yes, Lauren. Do we have Deputy Speaker Lauren Legarda? If none, I would like to call on our Vice Chair, Representative Alexi Tutor.
Yes, thank you, Chairman. Good afternoon, Sec Doke, and to everyone else. My question goes to PhilHealth.
Good afternoon, ma'am.
To PhilHealth po. So what will happen to our contributions sa PhilHealth contribution natin during the start of the ECQ? Will it accumulate or pwede namang hindi muna babayaran yun? This is on the side of the employers. PhilHealth.
Madam Chair, thank you, ma'am. During the ECQ, during the Bayanihan Act, meron pong time na we deferred, we moved the deadline of payment, and the deadline that was set was June 30 for the March, April, May, starting February to June po, pwede po mabayaran hanggang June 30.
So meaning po PhilHealth, yung mga contributions, nag-accumulate lang, nag-defer lang, meron lang siyang deferment. Babayaran pa rin din ng employer.
Yes, Madam Chair. Wala lang po interest and surcharges.
O kasi naman sa SSS, sa Pag-ibig, they're just going to file a certification. Pag walang trabaho, no work, no pay sa mga panahon na yon, then the SSS and the Pag-ibig will also consider that one. Kasi ano namang ibabayad ng mga employer pag walang trabaho eh. Are you not going also to do the same like SSS and Pag-ibig?
Yes, Madam Chair. Tama po, hindi rin po namin papabayarin yung low earnings and they will be tagged as no earnings kaya po hindi po sila kailangan magbayad. Kung wala po sila.
So what document will have the employers have to present to the PhilHealth during the payment of the contributions? Kaysa naman ano yung mga laborer, yung mga nagtatrabaho, kaysa going to terminate them. There will just be months na ongoing yung ECQ at meron din namang mga months na wala pang full opening of business establishment, skeletal pa rin. So marami ding wala pang trabaho. So maybe you should consider also those things para naman you are going to have the business establishment. Mr. Chairman, Madam Chairman, for PhilHealth po.
Yes, Madam Chair. Kailangan lang daw pong i-file ng employers the ER3 which specifies na wala po silang earnings. So, they don't have to pay the fee.
Oh, okay po, salamat po. Asahin po namin yan kasi sa tourism sector ang daming nagrereklamo in regards with the contributions of PhilHealth. Hindi daw namin ma-reach yung mga taga PhilHealth in regards to the contribution, accumulated contribution. Thank you, Madam Chairman. And my second question is for Secretary Doke. Sec.
Yes, ma'am, I'm here, Your Honor.
Kong Tutor, nakamute ka, Kong Alexi. Kindly unmute.
Yes, hello.
Go ahead.
Secretary, I'm just curious, how much is one PCR containerized molecular laboratory? Curious lang ako sa amount. Can you, is it okay if you are going to give the amount?
No problem. It's just that I don't have the amount right now. It is with ASEC Nestor Santiago. Might be able to give us the accurate figure. ASEC Nestor.
ASEC Nestor, can you respond?
I'm sorry po, yung tanong po ang isang PCR lab?
Yung containerized molecular lab.
Yeah.
Pop-up lab po.
Yeah,
We
pop-up
call it
lab.
pop-up lab. Ma'am is about 18 million po.
18
Turnkey na
million.
yun. Complete na. Opo, yes ma'am.
Complete na yung 18 million with the medical
ma'am.
equipments inside. So, kompleto na yon. So,
Kompleto po. Ang wala lang yung human resource.
Yung human resource. So, posible naman, yes. Yes po.
If I may interject lang, 18 million?
1.8 po ma'am, yes ma'am.
Kasi may nag-propose sa akin, around 8 million lang eh. Lahat-lahat na.
Yun
It's
yung...
a pop-up lab also.
Yes ma'am. But yun yung alam ko pre-propose noon ma'am.
Okay, kindly check kasi they're going around the suppliers offering the LGUs and maybe the congressmen's. Kindly check lang then if ang DOH would consider investing on the pop-up lab.
Yes ma'am. Ma'am, i-clarify ko lang kasi yung 18 million is turnkey na. Ang ibig sabihin kasama na equipment and lahat. Meron kasing proposal na yung ano lang, yung physical plant lang, wala equipment.
Okay.
Yes, Madam Chair, pag physical plant lang, magkano yan?
Ma'am, yun po ang wala akong idea. Ang meron akong idea yung buo, yung package.
So yung 18 million natin, that goes for the DOH na amount, yung rate ng DOH. That is outside of all the other offers,
Ma'am, hindi po DOH yan, ma'am. That is, during the discussion before, merong nagpo-propose kasi na isang private na company na pinopost nila yung pop-up lab. It's their figure na 18 million siya.
Hindi ba masyadong mahal yan, Madam Chair? Yung 18 million? Because if we are going to open our tourism, we have to put the yung pop-up lab natin sa mga port of entries, like yung sa international airport natin, yung sa mga seaports. So maybe, Madam Chair, we can check on the amount that are circulating, the different offers for the pop-up laboratory. Madam Chair.
Yes, Kong Alexi. Should the DOH consider the investing for a pop-up lab? Siguro dapat scrutinize natin mabuti yung fund nila.
Yes, ma'am, will do po.
Yeah, is there any plan na mag-invest kayo dito?
Yes, ma'am. Our capacity building includes more testing laboratories, but it also depends, Madam Chair, kasi like for example, the antigen testing is much more affordable, quicker turnaround time for results, and we are going to mong this antigen testing kasi maganda daw specificity, except the sensitivity is somewhat low, but they might continue to improve the quality of these antigen tests. So
Sec Duque, nawawala po yung audio nyo.
in the end, this might be the more cost.
Sec Duque, can you repeat
Yes,
your...
ma'am.
Yeah, pakiulit lang po, nawalan po kayo ng audio. Yung last 3 sentences nyo po nawala.
Can you hear me? Can you hear me now? Can you hear me now, Chair?
Yes po, yes po.
Yeah. In response, yes, we will consider as part of our
Sec,
ramping our like the antigen test, where so far the results as reported, seeing time for the results to come out. No? So we will look at the options. Moving forward.
okay. Thank you, Sec Duque. Kong Alexi.
Yes, thank you for that information, Secretary. One last lang po, yung mga binibigay natin sa mga probinsya, how much would that amount to? Yung mga PCR na binigay sa mga probinsya? Secretary. Madam Chair.
Secretary Duque.
Nawala.
Can we ask
video, sir? Nawawala po kayo. Mag-audio na lang po kayo so that medyo okay yung...
Close na raw yung video ni sir para makasipin. Yes.
Okay, is it better now?
Yes po.
Is it better
Yes.
now, Chair? So can we have ASEC Nestor Santiago to please give his rejoinder to the question, Chair?
ASEC Nestor.
Yes, ma'am. Thank you po. Ma'am, actually yung binibigay natin na PCR and NATS, yun yung pong libre na binigay ng Sansure when the PSDBM purchased the Sansure kits. Kasama po yung sa libreng binigay nila. 20 PCR and 10 or 8 NATS binigay nila. Libre po yun. Hindi natin binili.
Kong Alexi.
Yes po. I'm just curious with the amount kasi if that yung mga libre na yan, if they are offering like less costly amount, so we can also consider nga buying from that source, from that supplier. Anyway po, Madam Chair, magpapasalamat muna ako kay Regional Director namin, si Jaime Bernadas. Sana po yung commitment na tinatawag ko kanina will be delivered po. Yan lang po. Alam na niya po yan. Thank you, Madam Chair.
Thank you so much, Representative Alexi. I have a question in relation doon sa mga equipments natin, no? RT-PCR or yung mga antigen testing like CLIA and ELISA. Etong mga machines po ba na to, kailangan validated ng RITM bago magamit ng isang facility? Anyone can answer. Sec Duque or Yusek Berheri?
Yes, Madam Chair, Secretary Duque, if I may answer the Honorable Chairperson, please. Yes, ma'am. All of these testing methodologies, ma'am, based on our regulatory process, has to undergo registration, of course, with the Food and Drug Administration, and after that should be locally validated by our national research national reference laboratory, which is our ITM po, ma'am.
So Yusek, paano nyo na-monitor yung mga LGUs na nag-implement ng mga machines, gumagamit ng mga machines, like yung mga antigen, which I think hindi validated ng RITM?
Yes, ma'am. We have this process, the post-marketing surveillance, that is being implemented and enforced by the Food and Drug Administration. So every time that there is a kit that is being registered by FDA, there is this regular monitoring of these kits. So for example, na-validate po ng RITM na ang isang kit has low sensitivity and specificity, FDA has to provide action when that the results are out. So pwedeng i-pull out sa market for improvement, yung mga ganun hong pag-uusap. Ngayon po, ito pong mga nakalabas kasi ang nauuna yung produkto or technology sa areas natin before we can really validate, before we can issue guidelines. Kaya nga po ngayon, hinahabol natin na lumabas po itong omnibus guidelines natin because this would include the guidelines for use para po sa mga implementers natin for these different testing methodologies. And hopefully, by the end of the week or early next week, we can issue the guidelines already, Madam Chair.
Sige, Yusek, siguro baka pwedeng i-expedite ninyo kasi ang dami ng LGUs na gumagamit na hindi validated ng RITM, and then yung results na yan ay baka na isasama doon sa reporting ng natin ng testing, no? So isa 'yun sa dapat pagtuunan din ng pansin kasi ang dami ngang suppliers na nakakuha ng FDA but hindi pa rin na-validate ng RITM, no? So 'yun lang ang concern ko diyan. Thank you, Sec. Next to ask question is Representative Marilu Arroyo, our Vice Chair.
Thank you.
Representative Lourdes Arroyo. If she's not here, I'd like to call on Representative Hector Sanchez. Kong Sanchez. Kong Marilu, you have the floor. Go ahead, Tita. Tita, wala po kayong audio? Still no audio, Tita. Yes po. Baka po naka-silent or the volume of the audio, if you can check. Still no audio, Tita. Okay, while she's fixing her monitor, I would like to call on Representative Hector Sanchez.
It's no audio.
Oh, there. Tita, we can hear you now.
Now?
Yeah,
Okay,
yeah.
sorry.
Please proceed. Okay.
Okay. How did you evaluate the programs and policies related to persons with disabilities in planning your allocation for them in this 2021 budget? I have been trying to come up with I've been asking from the start because this is a new committee, and I've been asking from the start that we have a registry, but we don't have a registry. So I cannot give you the exact number I need to ask now that we have our what do you call this, our budget hearings in Congress. I want to know, may I please know the actual number of registered PWDs at the DOH? I believe it's their mandate.
Okay, Secretary Duque, who can respond to Kong Marilu Arroyo's concern.
Yeah, thank you, Chair. Can I please request the Chair to recognize DPCB Director Nap Arevalo to answer?
Okay, Director Arevalo.
Thank you, Secretary, Madam Chair. From our records, there are about 201,475 persons with disabilities issued IDs by region and type of disabilities from 2010 to 2020. And there is a disaggregated data on this, like the psychosocial disability, 23,563. Disability due to chronic illnesses, 3,054. Those with learning disability, 10,264. Mental and intellectual disability, 26,979. We also have those with visual disability at 26,784. Those with orthopedic or musculoskeletal disability at 73,769. The hearing disability at 14,264, and those with speech impairment at 22,798. So we can access this registry by way of our knowledge management information service of the Department of Health and via the records by the NCDA. Back to you, Chair. Thank you po.
Thank you, Director Arevalo. Please proceed, Kong Marilu.
Thank you very much. Madam Chair, may I request for the total? The total, I believe he said, is 201,425 disabled. Am I correct?
75, Madam. 201,475.
Okay, and this is accurate up to 2020?
Yes, this is as of June 2020. This registry has been a cumulative registry from 2010 to June 2020. Madam.
All right. Why did I hear in one of the hearings that I had that it was 1.4 million people that were disabled? That's a big difference between 201,000 and 1.44. That's a big difference. What happened?
Madam Chair, the registry.
Census.
Yeah, Madam Chair, these are the estimated PWG and D in the country, and the registry of this PWGD is ongoing at the local governments. The repository of these of these names or registry is at our knowledge management information system, and it's being updated as our local government inputs to the application as per registration of our PWDs.
All right. How can you address this concern of mine? Because it's a big concern of mine, because budget hearings coming up and I don't know, if I don't have the exact number, I cannot ask. I will not know what to ask. I might ask for too much or too little. And they keep on asking. There are so many needs. What can I do? Please help me.
Yes, Madam, the regional offices, we have our program managers on handling PWD is collaborating with the social welfare and development offices of the local government so that these registries be updated. And we have a system that those PWDs who cannot go to the centers for registration are being visited by the local DSWD of the local governments. And there's a constant a dialogue with the NCDA as well as with the local governments for us to be able to make means that these PWDs are identified and properly registered.
Okay. Are they categorized?
Thank you, Madam.
Madam Chair, do you categorize, are they categorized? Because I've asked for that also. Different categories.
Director Knapp? Director Knapp, she's asking if your list is
Madam
categorized.
Chair, we cannot hear. We cannot hear.
Okay. Director Knapp?
Categorized, Madam Chair.
Anyway.
Madam Chair, can I be recognized? This is Director Tayag again.
Okay, Director Eric Tayag.
Yeah, because it's my office. Good afternoon po, Congresswoman Maria Lourdes Arroyo. Thank you, Madam Chair. And also I'd like to acknowledge Secretary Duque III again. My office, the Knowledge Management Information Technology Service, as mentioned by Director Arevalo, is responsible for the online registration of persons with disability. And there are categories, I confirm, Congresswoman, and we would gladly provide you with the information because this is a required field when they registered. And this is based on the diagnosis and recommendations of the physicians who give them certification. Thank you po, Madam Congresswoman.
Madam Chair, Yusek Villaverde po, may idadagdag lang ako.
Okay, Yusek Villaverde, go ahead.
Yeah, to our Representative Arroyo, kasama po ang question ng mga PWD sa census na ginagawa ngayon ng Philippine Statistics Office. Several questions on particular types of disabilities. And since this is a census, lahat po ng tao sa Pilipinas ay sasagot kung ano yung disability na meron sila. And since this is conducted this year, baka po next year pa makikita yung result. So this will be a more accurate one because this is a census. Unlike po yung kinukuha ngayon ng DOH, syempre registry ito, so baka may mga tao na hindi nagre-register, so hindi po kumpleto yon. Pero maganda na po kung mapapagbasihan natin ay yung ginagawa ngayon na census ng Philippine Statistics Authority. Yun lang po, ma'am. Salamat po.
Very much, sir. May I count on the PSA to get this for me, to get this information for me? May I count on
Tita, kindly, you can actually write a letter to PSA to get the results of that recent survey or ongoing survey.
Thank you very much, Madam Chair. I still have a question. Since the law provides for free provisions for FSL interpreters, If you remember correctly, I asked this in one of our committee hearings. I asked you, I asked the good secretary through you, um, do you have them now in public hospitals, the FSL interpreters, when it comes to sign language? Because if they are deaf and they are mute, they cannot speak and they cannot hear.
Secretary Duque.
Ma'am, can I just refer this to DPCB, Director Nap Arevalo?
Yes.
Director Nap.
Again po, maraming salamat. Actually, we have started the sign language training piloted in some areas in NCR and Calabarzon. Due to the pandemic, it has been postponed, but we are having the 10 hospitals, 10 regional hospitals with already signed interpreters. So we will provide you with a list of the hospitals who have piloted sign language interpreters in the hospital for easy understanding of our persons with disabilities accessing our hospitals. We will be providing you, Madam, with the list of these hospitals. Thank you, Madam. Back to you.
Thank you very much, Madam Chair. May I please remind them that because we are already disabled, it is much harder for us to come to you. First of all, we have no accessibility. People in my area, in the 5th District of Negros, cannot get down to get their PWD cards. They don't have the accessibility. They don't have the money, sir. They don't have cars. It's not available. That's one of the reasons why I wanted to get a good idea of how much I need to ask for budget hearings during this budget hearing. Because this is a very new committee. But I can see that there are so many problems. It's never going to end, I guess. Like me, I'm a 3-year-old disabled person. It's just been 3 years that I cannot walk. So every year I feel that more and more people get disabled because as you grow older, you can't help it. You can't hear, your eyesight is worse. Many things happen to us. So it would really be very, very helpful for me, and I'll be very grateful if you can really work on this and help me out on this. And then one of my questions also is, since you have this in 10 regional hospitals, these FSL interpreters, may I ask you who pays for them?
Director Nap.
Director Nap? Madam Chair?
These are actually subsumed by the hospitals implementing the sign language interpreter. So they are being paid by they are being paid by our hospitals on a part-time basis per hour, Madam.
Director Nap.
Yes, ma'am.
Yes,
Madam.
Yes, nag-create na ba sila ng plantilla position for this?
Ma'am, sa ngayon yan ang direction for the hospital to create plantilla positions, and now they are utilizing their medical social worker as part of the team, so that if the part-timers are not available, the medical social workers can assist our PWDs accessing our hospitals, having difficulty with communicating with our frontline health workers.
Okay, thank you, Director.
Yes. Thank you, ma'am.
Kong Marilu, one last question, please.
Yes. Is this part of your 2021 budget? Did you include this in your 2021 budget?
Madam Chair, what we included are in the 2020 budget and the 2021 is the soft component wherein we are to roll out the sign language interpreters in our hospitals, and the training will be on on e-learning so that there will be no face-to-face, so there will be no budget required for the e-learning strategy that we have planned for 2021. Back to you, Madam.
Last question, please. Madam Chair, last question, please.
Okay, Tita, go ahead. One last question.
Thank you so much. Do we have psychiatric medical services in all regional hospitals? You know, this is also very important, especially with this COVID. I think I'm becoming one of them. I cannot go out. Do we have psychiatric medical services in all regional hospitals? That's my question, Madam Chair.
Secretary Duque.
Madam Chair.
Yes, Yusek Rosette.
Yes, ma'am. It's part of the licensing requirement and standards for all regional hospitals, which are tertiary hospitals, to have the psychiatric services in these level 3 hospitals, Madam Chair.
Tita, is that all?
Madam Chair, thank you very much, Madam
Thank
Chair.
you.
Thank you very much to the DOH family. Don't forget, I'm going to call on you again. I need more info.
Thank you, Tita. Thank you. Yusek
Thank you
Rosette,
very much.
how do you monitor kasi one of the provisions...
Thank you, Kong Marilu. Thank you for the opportunity. Thank you, Chair.
Okay. One of the provisions in the Mental Health Act is that every institutions should have a mental health program. So, paano minomonitor ngayon ng ating ng DOH, no? If all the offices, institutions ay compliant, whether private or public, compliant to this. Are we rolling this up na or do you roll out the program?
Madam Chair, if I may refer again the question to Director Nap Arevalo.
Okay, Director Nap.
Thank you, Madam Chair. As of now, we already have employed or hired health program officers at the regional level to monitor the rolling out of this mental health program to our health facilities. It's not only limited to our hospitals, but it's also monitoring the rural health units who have been trained on MHGAP. This is a program that is catering for those patients with mental, neurological, and substance abuse problems or concerns so that they are attended well. We also have access sites for mental health drugs in the country. We already have a number of 150 access sites so that there will be easy access for mental health patients to this free medication. So as of now, the health program officers we hired at the CHD level, at the regional health office level, are monitoring the implementation of the Mental Health Act in the hospitals as well as in the public health side, Madam Chair.
Thank you very much, Madam Chair. I have to say that I have a terrific chair. I'm so
Thank you,
sorry.
Tita.
I have to make that manifestation. Thank you so much.
Thank you so much.
Thank you so much, DOH family. I really appreciate your answers. I'll be calling on you again. Thank you.
Thank you so much, Tita. I'd like to call on
Thank you, Kong Marilu.
Cyril Abueg Saldivar. Kong Cyril, you have the floor.
Thank you, Madam Chair. Good afternoon, and good afternoon to Secretary Duque and all our guests from the DOH and related agencies. Madam Chair, I have here a law that was passed way back in 1994. It's Republic Act 9 number 7855, which establishes a 10-bed municipal hospital in one of our most far-flung municipalities in the 2nd District of Palawan, which is Balabac. For reference or for context, Madam Chair, this municipality is the southernmost municipality in our district and is very, very close already to Malaysia, and is even closer to Malaysia than our own capital of Puerto Princesa City in the province. So you can imagine how difficult it is for our constituents to get the needed healthcare services. So with the establishment of this 10-bed capacity municipal hospital, it was hoped that it would somehow answer the needs of our constituents. However, until now, this law has not been implemented. Way back in 1994 and 1995, appropriations were made for the construction of 2 buildings for that municipal hospital, but it was never used. These buildings were never used. And in fact, they now say na binabahayan na lang ng kambing these buildings. And if you would allow me to share some photos of these buildings now. These are the buildings, Madam Chair. And so this is really a waste, I think. A waste of, yes, Madam Chair.
Is that a hospital or barangay health station?
It's a 10-bed capacity municipal hospital, Madam Chair. It was established by virtue of law, legislation passed by our own Congress, and it has never been implemented.
Okay.
Now, way back in 2013, during the 16th Congress, my brother, Frederick Abueg, wrote to the then Secretary of Health asking for the implementation of the law. And we never got a reply on this matter. We have been in talks many times with the regional office of the Department of Health so that we can somehow find something to do. We can find a solution to this. But there was an informal commitment to maybe convert this into a lying-in clinic, but that has not yet materialized, Madam Chair. And until now, the municipality of Balabac is just being serviced by a rural health unit, which has 1 doctor and if I believe 1 midwife. So, and this is really difficult for our constituents because they have to travel if they have serious medical concerns. They have to travel all the way to the mainland of Palawan, which is 4 to 8 hours away by boat, depending on what kind of boat you are using. So we would like to ask, Madam Chair, if the department is aware that there is such a law that exists for the establishment of a municipal hospital in Balabac, and if anything has been done to implement the said law, Madam Chair. And on a related matter, there is also another law, this time for a different municipality, Madam Chair, but also for the upgrading of another municipal hospital in the municipality of Nara, also in our district, upgrading it from 10-bed capacity to 100-bed capacity. There is a municipal hospital that is currently operating, and we are thankful to the provincial government of Palawan because they put up a building with a 50-bed capacity for the municipal hospital. But we have to remember, Madam Chair, that this is a 100-bed capacity hospital. And up to now, as far as we know, there have been no moves to also implement the said law, which was passed in 2018, to make it into a 100-bed capacity hospital, Madam Chair. So these 2 concerns of mine, Madam Chair, we would like to refer these to the Department of Health. The same question as my question with the Balabac Hospital. Is the department aware of these laws, and are there any moves to implement the same? Have these been included in their budget proposal for 2021? May we hear on these matters, Madam Chair, from the Department of Health?
Yes, thank you, Madam Congresswoman. Madam Chair, can I just please request Director Tess Vera of the HFDB to answer the question?
Yes, Director Vera, can you respond?
Good afternoon, Your Honors. Actually, ma'am, there is indeed a law that was passed for Balabac in 1994. And as provided in the law, the maintenance and operations shall be provided with based on the provision of the local government code. So right now, there is since 1994, because this has not been cleared, DOH has not been proposing for the MOE of Balabac Hospital. So what we can do is we'll study this further and consult legal as well on how we can move forward on this. Relative to Nara Hospital, yes, it was recently passed, but in the law, the operation is under the province. So we'll also look into this on how we can assist both hospitals.
Thank you, ma'am. For the Nara Municipal Hospital, the law also provides that the DOH will provide subsidiary support for capital outlay. So may we ask if is this part of your program for 2021? Does the subsidiary support for capital outlay?
I think Dr. Gorgolon will be in a better position to respond on the request for capital outlay.
Madam Chair.
Go ahead.
We will coordinate with the regional office to check on the readiness and the status of this hospital before we can have that included in our list for 2021. Thank you.
Thank you, Madam Chair, and thank you, Director Gorgoron. I think the problem, Madam Chair, if I may manifest the same, is that we have a lot of laws, and it appears that sometimes they fall through the cracks, so to speak, and nothing is done to implement the same. I'm not sure if we are uniquely situated, or if our other colleagues have, the same dilemma. Maybe they have unimplemented laws as well in their own districts. May we ask the Department of Health if they have any system of monitoring new laws that are passed, upgrading hospitals, creating or establishing new hospitals, and how do they make sure that these these laws are implemented and do not go to waste?
Secretary. Secretary.
Yes, thank you. I'm sorry that I was on mute. I think the laws once passed, the budget consideration with the DBM must form part of very good planning. Kasi marami hong batas, pero kung walang budget, hindi rin naman maisulong. But anyway, this is considered under the local investment plan for health. And yan po ay ini-evaluate ng DOH kung ano po yung mga kinakailangan to meet the overall objective of the development of the health system of a certain locality. So importante po rito yung planning. So yung batas dapat may planning, and the regional DOH must sit with the local chief executive to come together and plan for a long-term development of the health system. So mahalaga po yung plano. We can provide through HFEP for the capital outlay, but the LGU has to propose the budget to DBM. Kasi kung kami magpropose, baka hindi naman pansinin. So I think it's incumbent upon the local chief executive to make the necessary representation to get the equivalent budget for that hospital.
Kong Cyril?
Thank you, Secretary Duque.
Yes.
Just to clarify or just to confirm with the good secretary, does this mean that if there's a new law passed, it has to come from the local government unit or the local chief executive to initiate proposing the budget and the planning for implementation of the law concerning them? Does the DOH not have any actions regarding the implementation of these new laws? Because of course the DOH is informed once a new law is passed concerning the agency or the department rather. What if the local government unit does not do anything? Does that mean that the law sits unnoticed for many years, like what happened with the Balabac Municipal Hospital law? Secretary Duque?
Yeah, well, thank you, ma'am. The extent to which the DOH can provide support is capital outlay. But for PS and MOOE, it is the LGU that has to make that proposal to the Department of Budget and Management, armed with the mandate of the law creating such a hospital. So, pwede pagtulungan po natin. We don't want to just let that law not be implemented. Certainly, we're here to support it, but the initiative must come from the local chief executive, lest the DBM might not even bother to consider our proposals. And then we also provide the technical assistance for the formulation of the hospital development plan as part of the local investment plan for health.
Okay, thank you. Kong Cyril, do you have any other?
Madam Chair, last na talaga.
Tita, is it related to the question of Kong Cyril?
No.
Let us finish muna Kong Cyril. Then I will call you po.
Thank you so much. Thank you so much.
Just one last question, Madam Chair, Tita Marilu. Last year, Mr. Secretary, Madam Chair, Secretary Duque, a sea ambulance was provided under the HFEP of the DOH to the same municipality of Balabac. But when the turnover was done and there were representatives of the regional office present also, the local chief executive already manifested that the engine was not suitable for the waters of Balabac, which are actually very, very, the waves can get very high. It's very difficult to travel by sea, especially during amihan habagat. So this was already manifested to the DOH, and they said that they will look into changing the engine, which is, I think, a 115 horsepower engine. And up to now, there has been no movement on that issue, Mr. Secretary, and they have not been able to use the sea ambulance, unfortunately. And I received a text message from the governor that saying the same thing, that he thinks at least at 200 or 150 horsepower capacity engine will be sufficient for to be able to use this sea ambulance. So my question, Madam Chair, Mr. Secretary, is what standards are used when we procure equipment such as these, sea ambulance, land ambulance? Because it's really a waste of money if it just sits there and it will rust. Thank you, Madam Chair. Thank you, Mr. Secretary.
Thank you, Kong Cyril, for bringing that up. Secretary, I think very important yung query ni Kong Cyril since nandito lahat ng regional offices natin. I think it's about time that the central office sets standard in procuring like that. Hindi lang po si ambulance, yung land ambulance, magkakaiba po ang standard na pinoprocure. Sa amin, sa Region 4A, magaganda yung ambulance. I don't know in other region kung kasing ganda ng ambulance namin, no? So, maganda po yung standard doon sa amin sa Region 4A. Secretary Duque.
Yes, ma'am, thank you. The standards being mentioned is within the ambit of the Health Emergency Management Bureau. Dr. Balboa or Dr. Lau may want to answer, but let me just also comment that for better planning and therefore better execution, I think the technical specifications that the DOH adopts must already ensure that the inputs of the local government or the local health system who is familiar with the conditions pertaining to what type of boat or engine or ambulance ought to be procured, that will be appropriate for the conditions that might be unique. There is no one size fits all solution here, and that is why it's very important that whatever idiosyncrasies might there be in a particular area, at the planning stage, antimano, dapat yung mga ganun, nakukuha na yung information na yan para hindi po nasasayang yung mga pinuprocure natin na mga gamit o mga ambulansya. But nevertheless, let me just call on the Region 4B, Director Bakilod, who might be able to give us an update as to that particular request. Thank you, Madam Chair. Dr. Bakilod, Director Bakilod, yes, please.
Yes, sir. Magandang hapon po, Madam Chair, at saka yung members ng Health Committee. My DOH family, magandang hapon. Actually, 2 points lang. Yung concern ni Congresswoman Cerelia, we have already discussed this with the Mayor ng Balabac. Yun nga po, isang engine lang, so hindi nagagamit. So we have just recently able to secure funding for another engine. So ibibigay ho natin ito para magamit na yung ambulance ng Balabac. So yan ang aming agreement with the Mayor. With regards, sir, sa ating mga guidelines, actually, ang Region Mimaropa is on coming up with guidelines as far as sea ambulance is concerned. We had made consultation with the Coast Guard para yung ating succeeding procurements will now meet the standards ng ating mga dagat po sa mga island provinces. So hopefully by next week we'll be having these guidelines na po, Madam Chair. Thank you po.
Thank you, Director Bakilod. Okay, Kong Cyril.
Thank you, Madam Chair.
So
yeah, we just want to manifest we are glad that there's already a move to replace the said engine, Madam Chair. But we'd also request that we be updated about the status of the change. And considering this was requested by my brother during his term, and I believe RD Bakilod also knows that there are several other units, ambulance units that are set to be distributed to our district. So if we could be updated on the status of these these ambulances, Madam Chair. Thank you.
Director Baquilod, kindly coordinate closely with Representative Cyril. Please give her an update on the ambulances that she's requested.
Madam Chair, as far as the additional C ambulances, by next month may delivery na po. So yes, we'll be expecting by next month yung 3 ambulances.
Thank you so much, Director Baquilod. I would like to call our Representative Maria Lourdes Arroyo.
Madam Chair, last na talaga ito. Before I forget, may I please request you, Madam Chair, for our good secretary to provide my district, the 5th District of Negros Occidental, for ambulances and dental vans that we have been so patiently waiting for. I understand COVID took over, but sick people don't stop because there's COVID. I still have people with heart attacks. I still have people with cancer. I still have people that need ambulances to bring them to the city so they can be treated. I still need people. I still get requests for people with dialysis that they need. So I have to transport them. So far, we've been paying this on our own. God is good. I'm grateful. I cannot, but may I please ask our good secretary through you to remind him, my ambulances, please, Secretary Duque, and my dental vans, please.
Please take note, Secretary Duque and the regional directors. Tita, anong region ka po?
Director Convocar, 6 yun, sir.
Director of Region 6 to please pay attention to the request of Representative Arroyo.
Director Convocar, your attention is called to please facilitate, check on the status of the request and how many ambulances or dental vans have been provided, the good Congresswoman.
Thank you so much, Secretary. I'd like to call on Representative Hector Sanchez.
Thank you so much, Madam Chair, for being very accommodating chairman. And again, I would like to reiterate my request to the good secretary because I have just talked with the Director Rivera of Region 5. Sad to say that even single centavo were not allocated to my province. My province again is an island. Nakakaawa po ang mga tao doon. And also napabayaan ng mga previous politicians na maganda sana po we have these facilities like this barangay health station. However, they are all dilapidated. And I want to have this resolution to the good secretary. If not, I am manifesting being a member of Committee on Health and also Committee on Appropriation to please hold on the budget of this Department of Health because it's a very long time that medyo napabayaan ho kami. That's only my sentiment, Madam Chair.
Secretary Duque.
Yes, ma'am. And
Kong Hector Sanchez po yung nagsalita.
Yeah. Well, yes, thank you, Congressman Sanchez. We will look into this immediately. I will meet with Director Ernie Vera and ask for the provincial investment plan for health because that is the key to seeing where the gaps are in terms of providing healthcare services to your people and we will have to look into the details of this provincial investment plan for health so that we can come together to complement our limited resources and provide the best or the biggest possible impact upon the health outcomes of the people of Catanduanes. So we look into that right away, Mr. Congressman.
Yeah. Madam Chair.
Yes, Kong Hector.
Yes, Madam. Thank you again. The request that we have submitted to region were already forwarded to the, I think, office of the secretary, but there was no any action. That's why medyo masama po ang loob ng kinatawan ito, Madam Chair, dahil in even alam mo na bilang isang public servant, sarili kong bulsa ang nasusugatan ng araw-araw at I think the good secretary will look into this. Please, nakikiusap po ako, secretary, para ho naman magkaroon ng masaya po ang aming bayan. Salamat po.
Salamat din po. Salamat din po, Congressman Sanchez. At gaya po ng akin po nabanggit, kakausapin ko sa lalong madaling panahon. Una-una, tingnan ko yung status, yung sinasabi ninyo na may sulat, may request, pero bumukha hindi na-actionan. Hindi po dapat nangyayari yon. Alamin ko kung bakit hindi na-actionan at kung sino po ang may pananagutan. Maraming salamat po.
Thank you, Secretary.
Madam Chair, sorry.
Yes,
Madam
one
Chair.
last. Yes, go ahead.
Just a follow-up question, ma'am. We don't have budget. I mentioned that even single centavo for the year 2021. Kaya nga po yun ang medyo ikinasasama ng loob ko dahil why some district and provinces were allocated for a big amount of money. But for us, it's just only even one single centavo, my God. Nakikiusap po ako kay Secretary na sana po matugunan itong problema namin sa probinsya. Thank you so much, Madam Chair.
Thank you. Sec, please take a look on the request of Kong Hector Sanchez.
We'll certainly do, Chair.
Yes. Next to ask question is Representative Paul Daza.
Thank you, Madam Chair. I have weak signals, I have no video. Good afternoon, Secretary. I wanted to follow up. Yeah, nice to see you, Sec. I wanted to follow up along the same lines as Congresswoman Abueg. I know that in Bulacan, there's one hospital that was put up, but it's not operational. There's one in Bacoor. I think there's even one in Bataan. So Kong Abueg mentioned she had legislation, something that needed to be operated. So my question, Madam Chair, is, does DOH have an inventory of clinics or hospitals, buildings that have been put up but are waiting to be operational? Whether it will be by the LGU or national government, I'm wondering if DOH can provide the committee an inventory of this available buildings and a list of legislation that similar to what was mentioned by Congresswoman Abueg.
Thank you, Madam Chair, Kong Paul Daza. The HFEP is invited to please give your rejoinder to the question of Congressman Daza. HFEP, please, or HFDB.
Go ahead, you have the floor.
Director Tess Vera, please.
Director.
Good afternoon once again. Relative to the for the unimplemented laws, our office HFDB has an inventory of those laws So every time there's a opportunity to propose for budget, we do so. So just to provide you an update, it's our listing is based on laws passed during the 17th and 18th Congress.
Now, how about existing buildings that are not operational? I know of a few, like in Bulacan, in Bacoor, Bataan. You must have an inventory of existing facilities that are not being operated.
For the buildings, may I refer to Doktora Gorgolon on the if they have a database on this. Dr. Gorgolon.
Director Gorgolon.
I was I was still referring to our data. Yes, we have the inventory of the number of facilities under construction. At the same time, if it's operational, but the very detail of this will be at the regional offices po. And functionality.
Madam Chair,
Go ahead, sir.
Can we ask the committee secretariat to help DOH compile this, because I think it's very germane, especially today. I personally know of at least 3 hospitals that have been put up either by the LGU or funded by the DOH, but have yet to be operational. So I'm sure nationwide there's going to be a handful, and this could be a discussion at the committee level on how we can help the LGU or the national government get these hospitals operational, alongside with the list of legislation that they have already, Madam Chair.
Madam Chair, we will instruct the regional directors to provide the central office the inventory of hospitals or buildings that are not yet operational. And I think I recognize the importance of the point being raised by the good congressman, because I think it should also be of interest to the Office of the Secretary precisely to identify these facilities, especially in the face of our pandemic response, if they can still be converted into isolation or quarantine facilities. Thank you, Mr. Chairman, Madam Chair.
Thank you, Secretary.
Thank you very much, Mr. Secretary. Now, in the universal healthcare, Madam Chair, of which you are the main author, it mentioned there to help the poor, the indigents, there's a provision for no copay in government hospitals. My question is, what is DOH and or PhilHealth, what have you done or planning to do to be able to enforce that no copay principle embedded in the universal healthcare law?
Thank you. I'm just looking at the more accurate data. Maybe PhilHealth can give us the percentage of facilities that that comply with the no balance billing. I have it. It's 83% of all the facilities that comply with the no balance billing policy. This is 2019. I'm sure it's probably even more now.
Okay, thank you, Madam Chair. So my next question would be, is as we all know, the no balance billing really composes of 2 components. No copay, not charging the indigent patient, and no out-of-pocket. The latest data I got from no out-of-pocket it's still quite high. So I brought this up during our consultation with the House on the IRR of the universal healthcare. So my question is, what is PhilHealth and or DOH planning to do to address the problem of out-of-pocket of indigent patients?
May I please invite in, with the permission of the chair, the PhilHealth to respond to the question. SVP Neri.
SBP Neri. Neri?
Yes. Yes. Can you hear me, Madam Chair?
Yes.
Yes po. Opo, sa ngayon po, what is stated is low balance billing for the 90% of the government hospitals, 70% of the specialty hospitals, and 10% of the private. For next year, we are targeting the low balance billing will be strictly implemented in the government hospitals for all sector, for everybody. Before po kasi nung 2018-2019, indigents lang po ang low balance billing for government hospitals and ward accommodation. But now, for the UHC, for everybody na po na no balance billing. So, we will be strictly monitoring po yung compliance to the no balance billing for all sectors under the government hospital for 90% of its beds.
Madam Chair, can we request from PhilHealth and DOH the latest figures on that and documentation on how they are planning on implementing the monitoring of the no balance billing for next year?
Yes, Madam Chair. We have, number one, let me just add into the discussions that the DOH has actually drafted and is currently finalizing 3 policy instruments aimed to implementing zero and fixed co-payments for both basic and non-basic accommodation. We have the AO on guidelines for implementing basic, non-basic accommodation in all hospitals. This policy provides the standards for classification of hospital beds into basic and non-basic accommodation, including ward beds, semi-private beds, private beds, critical care unit, and the intensive care unit beds and isolation beds. This ensures that essential services provided in basic accommodation shall entail zero co-payment, while prices of services provided in non-basic accommodation, including amenities for the comfort or convenience of patients, shall be predictable through fixed co-payments. And then we have also the 2 other AOs on implementing guidelines for the required allotment for basic accommodation.
Secretary
In
Duque.
all hospitals and on implement. Yes.
Go ahead
Yes,
po. Nawala po yung audio
Yes.
nyo.
So ito we will submit. Yes. Can you hear me? We will submit to the committee secretariat for dissemination to the other members of your
Secretary,
committee.
how do you intend to implement that in the specialty hospitals like Heart Center, NKTI, PCMC, Lung Center, the 90-10? Under UHC, sir,
the law for
70-30.
It's 70-30 ang allocation. It's 70 service beds or for charity, and then 30% for pay. For our Apex corporate
Secretary, nawawalan po kayo ng audio.
medical center, heart, lung, kidney, and Philippine children. It is 90/10. Ayan po, narinig niyo po ba ako?
Yes po, medyo nag-fluctuate po siguro yung network. Anyway, so currently po, ini-implementa yung 70-30.
Ayun po ang alam ko, ini-implementa po yan.
Kasi kaya ko po naitanong, with due respect kay Kong Paul Daza, no? Napakahalaga at this time then, aside from all our general hospitals, provincial hospitals, and DOH hospitals, yung specialty hospitals ay malaki din ang problema ng access ng ating mga pasyente. Kasi yung NBB nila, yung no balance billing sa charity will take time before ma-provide sa ating mga nangangailangan. So pumipila sila kung charity sila. So I don't know the process. Although there was this pending meeting supposed to be with all of the directors and PhilHealth and DOH, supposed to be led by Dr. Ish Pargas ng PhilHealth on how are you going to operationalize the 70-30. Kasi nga ako very much concerned doon sa mga may sakit sa puso, transplant at ano-ano pang mga problema sa pedya, mga may hydrocephalus. Pumipila po kasi ang strategy ng mga mahihirap, bagaman mahirap sila, ang strategy nila, sasabihin nila sa admitting, semi-private sila. But in reality, they're poor. So pagdating ngayon ng na-admit na sila, that's when maghahanap sila ng tulong sa congressman, sa mayor, para ma-down payment po doon sa hinihingi na professional fee. I don't know, hindi ko din alam paano i-address yan, but I think yung bigyan natin pansin, the 70-30 ay may not be enough, but at least ma-accommodate lang sana yung mga emergency cases natin na mahihirap na NBB sila. Thank you, Secretary.
Meron naman po tayong sistema dyan, yung malasakit program na kung saan para siyang health maintenance or parang HMO. Kung medyo malaki yung billing at hindi kayang sagutin in its entirety by PhilHealth, ay
But the Malasakit Center is after yung paglalabas na. Ang karamihan po ng cases, aware po si Director Abanilla sa mga nahihingi kong tulong at nagpapasalamat ako doon sa mga surgeons natin, ang mga specialists natin na nag-a-accommodate ng ating mga pinapakiusap. Karamihan po ay hindi operahan ng walang down payment ng professional fees. So hindi pa rin po magagamit yung Malasakit Center. Ibig sabihin, hindi magpo-proceed po yung operation kung hindi po makabayad nung hinihingi ng doctors.
I think, alam ko, bawal yung down payment.
But we have Director Abanilla.
So we will have to more effectively enforce the pertinent laws. We look into how the compliance is by our healthcare facilities under the UHC law.
Director Abanilla, if you can share lang your problems in the heart center. Sir, naka-mute po kayo.
Okay now. Do you hear me?
Yes, sir.
Yeah. I know that concern so well, no? So we have heard already about that ratio of 70-30, with 70 being service and 30 pay. So it's baliktad of the usual. And we were too worried of how we can sustain, because most of our salaries and maintenance comes from our earnings coming from the pay, which was about almost like 2 billion. So we had already meetings with Ish sa PhilHealth. And the proposal from the three of us, and KTI, kay Rose Liquete and Balanag, is that we will do this in a staggered manner, slowly, that the ratio will not be immediately 70-30, but maybe 60-40, 50-50, and slowly, and that will take place for about a period of about 7 to 10 years. Okay, so right now, tama yung sabi ni Congresswoman Helen Tan that yung iba, nagpapanggap na sila as semi-private para na lang ma-expedite. No, kung semi-private sila, we have a ruling or private na kung emergency, no, it's against the law to have a down payment or deposit. Pero kung elective, that is still working. That they have to put down a down payment. So, ang problema nito na nag-accepted doon sa private or semi-private, we exhaust the fund sources, no? Good si Congresswoman Helen Tan, yung congressional initiative na mga GL siya. She is very generous of extending that. And so the other congressmen too. So we have also, we would refer also patients to the malasakit, pero limited din yan. And then also, we have the MAIP, or the medical assistance for indigent patients. And some of them comes from the DOH and from the undersecretaries and some of the directors themselves on request. We have also funding coming from the Office of the President as well as the Office from the Vice President. Okay, so right now with this pandemic, no, so we limit now our cases to emergency, those that needs immediate surgical intervention or any procedure. Mga elective namin ngayon lahat naka-hold or waiting, no, because this is to keep them safe. These are very high-risk patients, no? Chronic heart failure with multi-vessel disease, multi-valve with cardiomyopathies, and so on and so forth. Pag nagka-COVID ito, they are most likely will be included in statistics ng mortality. So we tell them that we will do your surgery at better and safer times. Pero yung those that need immediate, no? Halimbawa, valve problem, araw-araw na siya sa emergency room para i-decongest. So ayan, a little more time and they are lost. So it's difficult. No? We are also having a very hard time coping up with this pandemic. So you know how it is to operate on a COVID or a non-COVID suspect. These are very long surgery. Our surgeons and our staff are in their PPE for like 7 hours to 8 hours. O halos headache na yung iba sa init at saka sa tagal. No, and then of course the way we deal now, no, may meron kaming COVID na OR, may COVID na intensive care, may non-COVID. Also, we have already aired this. Now we had appealed na kung pwede wag i-refer sa amin ang mga COVIDs, no? Kasi heart center kami at saka maraming heart patients. Nadi-displace ito sila, no? Natatakot na sila dumating. So we are keeping the balance. But then, COVID man siya, kung may cardiovascular underlying, we cannot do what we have to admit them. And also, kung staff namin mismo. So this is how we are dealing right now with the transition period into that ratio. So hopefully you can also help us also and assist us. But please, now we appeal that do not make it abrupt. No, we cannot survive with that reversal of ratio.
Yeah, nauunawaan po namin yon, Director, no? That's the reason why we wanted to ask nga DOH since from 70-30 na 70 na paying and 30 na charity, and then
Service.
vice
Yeah.
versa ngayon, no? Paano ang strategy na pwede nating gawin na hindi mako-compromise yung services na ibinibigay sa mahihirap na pasyente? Kailangan bang magdagdag sa GAA, through GAA ng subsidy para dito, para
Yes.
yung operation ng specialty hospital natin ay hindi din naman mako-compromise yung
Yeah,
ating
of course.
subsidies and incentives of the healthcare workers. So yun, kay Secretary Duque, siguro isa yun sa kailangan bigyan po ng pansin, no?
Yes.
Secretary.
This is a unique problem only of the 3 specialty hospitals. And we were just too worried about this. So the GAA, the increase in the GAA will definitely help. Sayang kasi yung mga meetingan namin with PhilHealth kina-ish, naantala yun because of what happened, you know.
Anyway, we'll continue the meeting, Director. Kong Paul, you
Yeah,
have
Madam
for
Chair,
Sorry.
I'm glad you interjected your concerns, because that's part of my overall concern. But I must say that our DOH specialty hospitals are performing much better compared to our LGU hospitals. And that's where my appeal is to the committee and to PhilHealth and to DOH. When they crack the language, my concern, because I was a former governor and I've gone around doing some healthcare advocacy, is really the out-of-pocket. There's usually no supplies, the X-rays not working, the lab, the reagents not available, and patients have to go outside. So I'm hoping Secretary Duque, Chair Helen Tan, that we're able to draft some good languages, whatever that's going to come out soon, to address the out-of-pocket expenses of indigent patients, especially in the LGU areas. That's not the problem with the specialty hospitals. Now, would you care to comment regarding that, Madam Chair, for the Secretary, regarding the out-of-pocket problems more in the LGU side?
LGU hospitals.
Secretary.
Yes, the Universal Healthcare Law is very clear in that regard. That's why we have the 90-10 in the government hospitals, 90 service beds and 10 for the private. But even in the private, the reverse ratio is must be observed. No, 90 private and 10 service or charity beds, and the compliance with the no balance billing must be enforced. But the problem is that when the COVID-19 pandemic started in March, the expected funding infusion from PCSO and PAGCOR has been adversely affected. So hindi po na ilagay yung mga pondo na dapat maibigay sa PhilHealth para nang sa ganun mas madaling ma-enforce natin yung no balance billing. And then secondly, yung pong hinihingi namin budget na 138 billion for 2021, halos kalahati lang ang maibibigay. So 71.5 billion lamang. So ang daming mga funding shortfall or gaps. So we need to address this once the situation hopefully normalizes sooner rather than later. Because all of these are really very serious funding gaps that really prevents us from implementing fully the provisions of the Universal Healthcare Law a very, very nice law, but the funding gaps are just too serious. We need to address them, and we can do that. One very cogent reason for why this is really giving us very serious limitations, no, is yung mga businesses or industries na nagsara, for example, hindi makapag-contribute yung mga employers and employees on account of the closed businesses, no? We're still reeling from that, no? PhilHealth has really been disadvantaged by this situation. And that's why we're doing our level best to buoy up the economy so that the contributions can normalize, collection can be pursued to the health, and be able to close the funding gaps. But the reality today is that the funding gaps is a very serious.
Madam Chair, I appreciate the comments of the good secretary, and I agree with him. But I think the good secretary misses the point. Our problem in the provinces, the lack of supplies, medicines, it's, as we know, it's been devolved. We need to find a way to tap and improve the services at the LGU level. Second, Secretary, there's a golden opportunity for DOH and for the national government to start really pushing hard on increasing the service levels and reducing the out-of-pocket of especially indigent patients. Because as you know, the Mandanas case is supposed to take into effect 2022. We don't know what will happen, but one scenario will be is there will be additional funding to the LGUs. So maybe this is an opportunity as early as now to discuss how we can tie in, if we really prioritize healthcare, how we can tie in improved services in the LGU hospitals, especially when the additional funding, the additional era comes up because of the Supreme Court case. So my request is, it's complicated and we won't be able to settle that now, but I just want an assurance from PhilHealth and DOH to keep on really discussing and pushing in how to improve the service levels and minimize the out-of-pocket of poor patients in our LGU hospitals.
We'll do that, Congressman Paul. That is our mandate under the Universal Healthcare Law. We need to push it, and I agree with you 100%, Your Honor, that to the extent that we can enforce the no balance billing 100%, that is our goal. And I hope that funding will improve soon and be able to provide the support to the various facilities that are expected to provide a much improved quality of care, and at the same time being able to sustain the operations of these facilities by ensuring that the planned funding level can be restored. And I'm glad that there is the Mandanas jurisprudence or the Mandanas ruling, and this will certainly beef up the much needed capital investments, no, for the various local government unit facilities or hospitals, so that they will be more readily able to provide the expected quality of care, and thus providing the better health outcome objectives under the UHC law.
Thank you very much. 30 seconds, Madam Chair. In the 2021 HFEP, Northern Samar did not get any allocation, Secretary. So may I request your reconsideration, if you could talk to the director, because I was told that there were delayed implementation in 2019 or this year, and that's why they zeroed Northern Samar. I don't think that's fair because the implementation was done at the regional DOH level. I don't know what problems they had, but they should not penalize the healthcare system of Northern Samar. So can I get an assurance from you, Secretary, that you will take a look into reconsidering possible funding for 2021 for Northern Samar instead of us being zeroed?
Oh yes, certainly, because we all understand that Northern Samar has been greatly disadvantaged. And I think equity dictates that these are the local government units that need the most help. And so we will look into this expeditiously, Your Honor, Madam Chair. We will ask
Thank you, Madam
Director
Chair.
Minerva Molon to look into this and make her assessment and report to me directly. We would want to help all these LGUs which have been disadvantaged for the longest time and are unable to provide fundamental healthcare services to its people. We
Thank
need
you,
to address that.
Secretary. Thank you, Kong Paul Daza. Very important po yung na-raise na issue ni Kong Paul on the Mandanas rulings. Ang importante siguro yung coordination and I think communication ng DOH sa DBM kasi hindi naman po nakalagay doon na yung fund for health is dapat i-mandate mo ang LGU na sa health niya dapat gagamitin. So, yun yung isang concern natin yung assurance sana na yung makukuha o mababawas galing po sa Department of Health na ilalagay ngayon sa LGU ay ganun pa rin ang paggagamitan, no? So, mahalaga po yung direction siguro baka ang Department of Health through kay Secretary Duque ay makipag-ugnayan sa DBM for the implementation of this Supreme Court rulings. Thank you, Kong Paul.
Thank you, Madam Chair. Thank you,
Thank
Secretary.
you po. Next to ask question is our Deputy Minority Leader, Senior Minority Leader, Representative Janet Garin. Last three to interpolate po. Go ahead.
Thank you. Maraming salamat, Madam Chair. Kong Paul, may utang ka ako na kasi ko sa question. Magandang hapon po ulit, Secretary Pincoy.
Yes, good afternoon, Sec.
Yeah, earlier there was discussion of the 2.5 billion allocation for COVID vaccine. May we know as to the real status of the availability of COVID-19 vaccine?
The status right now, I understand there are 6 candidate vaccines currently on clinical trial phase 3. These are the Sinovac of China, the Sinopharma of Beijing, the Sinopharma of Wuhan City. Then we have the AstraZeneca with Oxford University. And then we have the Pfizer with BioNTech, and then the Sputnik 5 of the Russia, Gamaleya. Also, right now we have the Gavi vaccine procurement. May I, with the permission of the chair, may I just ask Yusek Kabutahe to give the honorable representatives the update on this. With your permission, Chair.
Yusek Nierna, you have the floor.
Thank you, Mr. Secretary. Thank you, Madam Chair. In terms of the Gavi COVAX facility, the Philippines as a low-middle income country has been qualified by Gavi to be assisted, but the level and extent of support is still pending and will be decided during the Gavi September board meeting. Participating in the Gavi, the potential candidates for this Gavi project under WHO landscape includes Oxford AstraZeneca, Gamaleya Research Institute, Sinovac, Sinopharm, Moderna, NIAID, BioNTech, Anhu, Saifi, Osaka University, Bharat Biotech, University of Queensland, and FDRI, SRC, BB sector. But it will, their projection, it will come by the middle of next year. So these are the, and we are talking with various possible suppliers with the possibility of either procuring from them directly, or if they'd like to do some clinical trials here in the Philippines. But in terms of clinical trials, it will be the sub-TWG of the IATF on vaccine development, chaired by DOST, that will look at the clinical trials. We have now agreed on some zoning concept if these clinical trials will come. For those who will not do any clinical trials in the Philippines, they can directly coordinate with FDA for the needed requirements so that they can sell in the country. But as of now, there is really no definite vaccine that has an advantage. Thank you, Madam Chair. But may I just add that in terms of the phase 4 that will be done, just in case there will be some studies here, there are 5 recommendations of the HTAC, that we will have a safety surveillance system with reported therapies aligned according to the regulatory authorities. There should be a database of recipients. There should be risk communication, informed consent, and the most important, before we even buy these vaccines, Madam Chair, there should be a conduct of pilot implementation and community engagement before mass rollout. But we will update you, and we are updating our sub-TWG. They are in contact with many other suppliers in terms of, and we have a vaccine expert panel that is still looking all around the world the advances that are being made in terms of vaccine production. But they all claim, it's all claimed that they are ahead, but there are no definite proofs yet, Madam Chair. Thank you.
Thank you, Yusek Marina.
Thank you very much, Mama Mirna. Thank you, Madam Chair. The reason I asked about this is that in the budget, it's quite specific. So the responses, so if you will allow me, Madam Chair, because this is a very important discussion, I would like to dwell on some of the answers of Yusek Kabotahe. But my comment here, Secretary Duque, is that in the allocation for the budget of 2.5 billion, it specifically mentions healthcare workers and senior citizens. I do agree that these two populations are our priority. But the reason that I asked for the vaccine update is that what if the vaccine that comes out is recommended for teenagers or school children? Because usually that's how a vaccine works. There's a specific niche of the population that it will be recommended, unless the initial studies have already shown that it is somehow recommended for those above 60 years old. Your comment on this, please. I'm not saying, allow me to categorically put it, I'm not saying we don't give our senior citizens, but what I'm saying is, what if the recommended age range for vaccination in terms of COVID-19 vaccine is a different age range? Matetenga tayo doon. So if we were going to have a line item budget for COVID vaccine and make it general depending on the recommendations of the World Health Organization, then that will be more flexible. Unless, again, that's why maybe ask Yusek Mirna, or Mama Mirns, meron po bang pag-aaral or nakita po ba dun sa initial results of phase 2B that it's geared towards vaccinating the seniors?
Yusek Mirna.
Thank you, Mr. Chair, Madam Chair. Thank you, Mr. Secretary. Sedgarin. The landscape of the WHO prioritization is based on vulnerability and risk of exposure. So that is the direction for which the different vaccine manufacturers are geared towards. because we will have to really provide some form of protection to those who are treating the patient. So that's far as we know, and the WHO has put these different prioritization. Number one are health workers. Number two are our senior citizens, even our younger males, because they are the most at risk population, those with comorbidities. But yes, we will have to look at the developments just in case they produce vaccines that may not be for the intended age group, but this will be outside of the WHO landscape. You know that outside of COVAX, there are other independent producers who do not go through the WHO direction. So we are also exploring those possibilities as we try to talk with all the different manufacturers. So far, Madam Chair, we have not been advised on if there are any deviations in the current priorities for health workers and senior citizens, because they are the most at risk for the serious and critical conditions. So they are the priority for the vaccination, Madam Chair.
Madam Chair, I don't have any problem with that as long as we are sure that those will be the two populations. The healthcare workers, I deem that as a proper. The senior citizen, yes, we really have to protect them. However, in terms of vaccine development, my little knowledge dictates that safety and efficacy, especially among giving this to seniors, will be established in stage 3A. So my fear is if we become very specific with the budget, and then all of a sudden, the vaccine that will be made available will be for the caretakers of the senior citizens, then we will be at a dilemma. Kasi baka hindi magamit ang pera. My point here, Secretary, is that the department should have some sort of flexibility. That's just my opinion. Anyway, if it's an open-ended population, prioritization will still be handled by the Department of Health. Precise for me to say that as long as the budget will be flexible, then you will have the leeway. Kasi pag nilagay na natin dyan na senior citizens and then phase 3A will suddenly show safety signals among the seniors because they have a lot of comorbidities, then we will be having a lot of problems. Kasi baka mamaya yan, yung approach ng bakuna will be to protect the seniors by vaccinating their source of infection, which is actually the young generation, the working population. Just my recommendation. Honorable Secretary, another thing for that is what if the vaccine will not be made available for next year? Yan lang po ang what if, no? Do we have already an indicative price for COVID-19 vaccine?
Secretary Duque.
Yes, thank you very much, Chair, Kong, Janet. Unang-una ho, there's a paucity or scarcity of information as regards the specifications of these different vaccine platforms. And in fact, we are being asked to sign a confidentiality disclosure agreement so that the discussions on these different vaccines can be a bit more open and more thorough. But we have referred the matter to the Office of the Executive Secretary. So we're now discussing about this CDA. I think from all indication, we're being allowed the DOH to enter into a confidentiality disclosure agreement, but not binding us to any particular vaccine nor its procurement. So it's really just yung data sharing. Gusto lang nila na we don't share it kung kani-kanino lamang. So that is being addressed right now. Number two, the indicative cost of the vaccines as per report to me by Yusek Kabutahe is about 305 pesos per dose. So the indicative target or what has been put in the GAA is simply the amount of 2.5 billion pesos. So if you divide this by 305, that will give you more or less the number of vaccinees. That's about 387,000
Doses.
doses.
Ito yung population.
The population would be about 7.7 million. But we are trying our best to get more funding at about 12.9 billion so that we can cover about 20 million vaccinees. And so that is the direction that the DOH is pursuing, and cognizant of the recommendation of the Health Technology Assessment Council, together with the several professional medical societies, to ensure the provisions in the Bayanihan 2.
FDA.
And also the FDA. I'm sorry, my apologies to FDA. Dapat syempre kasama sila dyan. And also the DOST.
Yes, Sec. Thank you very much for that information. Ang sa akin lang naman, while it is not yet there, I just don't want us to be tied that when the vaccine is already there and we have the budget, then we will have to worry about technical malversation because it's very specific for senior citizens. Yun lang. I mean, it's up to you. It's your choice. Because if we look at like tetanus, remember when tetanus vaccine was being developed, it was supposed to be for the working population. Kasi sila ang nagkaka-tetanus pag nagtatrabaho at nasusugatan. But then when the vaccine came out, its indication was for babies, no, 1.5, 2.5, and 3.5 months old. Same thing with dengue. When dengue vaccine was being developed, and I think in 2005, you were the secretary then who were really pushing for solutions to the problem on dengue, and you did a lot of good things. However, when the vaccine passed to stage 3A, it showed safety signals in the younger population, but it also showed that the source of the virus was from the teenagers from the school, from school-based children, school-age children. Kaya doon naman napunta yung recommendation ng WHO to protect the younger people in the family. My point is, if it's like dengue vaccine, you can always put with prioritization to healthcare workers and senior citizens, but depending on the recommendations of WHO, then you will have flexibility. Hindi ka matatali, and DOH will have flexibility to implement it commensurate to the outcome of stage 3A. Moving forward, Honorable Secretary, Madam Chair, since we still need more funds, no, for vaccine procurement, would you consider working on a possible package for COVID vaccination under PhilHealth? Because with risk pooling, kasama din po kasi doon yung prevention. So if PhilHealth will invest on vaccinating enrolled families, then of course that will reduce their cost. Magkano yung ginagastos nila doon sa mga sakit. Similar to our proposal that PhilHealth will cover cervical cancer vaccination kasi mas masakit sa PhilHealth kung maraming nagkakasakit sa cervical cancer. That's just a proposal, because if it will be in the work or in the pipeline, then when the vaccine comes and you can negotiate for a low price because we'll be having a bigger population, meron mapagkukunan because it's part of insurance, and even the private insurance companies will cover that.
2021 comprehensive.
Are you open to that?
Yes. Thank you, Kong, Janet, and Chair. The answer to the first query is that the DOH will actually have the flexibility because the NEP, the National Expenditure Plan, does not specify kung sino exactly yung bibigyan ng vaccine. So, siya, open-ended. So you're right, Kong Janet, no? That's a very sound advice. And then number two, for PhilHealth, that is something that PhilHealth has to look into expeditiously because I think that is also a mandate under the Universal Healthcare Law, that they should develop benefit packages and if this can be accessed, this COVID vaccine, even via private facilities, meron funding. So you're right, that is being looked into, Chair and Kong Janet. Thank you.
Janet,
Thank you
kindly
very
wrap
much,
up.
Secretary. Madam Chair, yung ano lang po, no, pasensya lang po. But then, Secretary, we just need to be careful. That's why I was opening up on the vaccine procurement aspect. Because if you remember, when dengue vaccine was funded and it was stopped, hindi po nahinto yung pera, no? And the reason we were pushing for that was to increase budget for vaccination. Unfortunately, when the allocation for dengue was spent on PCV vaccine, what I noticed is biglang naging mahal yung procurement price ng pneumococcal conjugate vaccine. So if you can look into this, Honorable Secretary, na nung binili with the same year, with the same parameters, everything kapareho, biglang dahil may pera, ginawang mahal yung unit cost. So it's unfair to the department who's actually doing everything to make vaccination available. Moving forward, the Honorable Chairman opened up the issue earlier of CLIA and ELISA, which are actually antibody tests. Honorable Secretary, Madam Chair, I hear the sentiments of the people on the ground, especially the health workers. Nagkakaroon kasi ng kalituhan na kunyari i-approve ng FDA, pagkatapos kailangan pala ng validation ng RITM, which I agree. My basic understanding before was that every time something, an intervention is approved from FDA, a validation from RITM is requested. Siyempre, tutulungan natin yung RITM or other equally capable laboratories like those in the University of the Philippines and NIH to validate this. Kasi ang nagiging problema, once it's FDA approved and not yet validated, and the LGUs and all the health workers and the doctors will have to face the anger of those advocating things, tapos hindi naman pala validated ng RITM. And if the validation results run counter, let's say for instance, the antigen testing, validation results of RITM showed a high false negativity rate at 40%. Ano pong ibig sabihin noon? Dapat agapan yung ating advocacy na kapag ikay negatibo sa antigen test, then you have to pursue PCR testing. Because whether we like it or not, people will capture the first 2 seconds of what we say. Ang nasa utak lang nila, negative ako. They don't really care if it's antigen because they know it's swab test. So there is already confidence. They keep on roaming around. They keep on going around. And this might erase the gains that you had, our country has, during the initial lockdown. So, tsaka nagiging kawawa minsan yung RITM kasi sila yung napuputakte. I mean, Dr. Celia Carlos and Dr. Badstandok is also full of a lot of things on their hand. Maybe there can be a platform where there can be coordination between the two agencies. And most importantly, communication is very important. So, in line with this, Honorable Secretary, what will really be the use of antigen testing so that everybody will be on the same equation?
Thank you, Kong Janet. I would like to request perhaps Yusek Kabutahe, if Yusek Bergere has asked that she be excused as to the latest with regard to the antigen test. Yusek Mirna.
Yusek Mirna.
Thank you, Mr. Secretary, Madam Chair. The omnibus guidelines for this testing are still being finalized, but the primary consideration for the antigen test are for specific priority populations, those that will need testing, but what we call the expanded testing subjects. No? For instance, because we want to open the economy, we have our tourists. Those who are coming in can have a antigen test, and then as rightly pointed out, if it is antigen positive, the possibility is that it is a true positive. If it is antigen negative, then they will need an RT-PCR. So that if they are positive, then appropriate actions are taken. If they are negative, then they do a serial test for this antigen. But this being discussed with various stakeholders on who the priority for this antigen. But it's basically even for our returning OFs, our OFW, so that they can readily go to their areas of destination or their areas of residence. It will be finalized soon what these antigen testing purposes are, Madam
So,
Chair.
it can be used for symptomatic and asymptomatic, or simply for symptomatic patients, people?
To my knowledge, is basically for the asymptomatic, because for
It's for the
symptomatic, yeah, asymptomatic, because we do not know. Because if they are symptomatic already, Madam Chair, then you use the RT-PCR.
Yeah, Madam Chair, with your indulgence, because this is a very critical thing, I think it's contrary to what came out in the RITM validation. Because the RITM validation showed a high specificity for the symptomatic, a 64% sensitivity for the symptomatic, but it mentioned there are no studies for asymptomatic. That's basically why I believe communication should be very important. Because like if we're talking about the province of Palawan and Bohol, konti yung cases. If we bring asymptomatics there, we'll turn out negative for the antigen tests. But then yun naman pala, they are moderate to weak positives. That's why they had false negative results. Then we will be infecting Palawan and Bohol. My point there is, yes, we use it, but then we should be clear. Is it for the symptomatic or the asymptomatic?
Yusek Mirna?
Let me check, Your Honor, but the Director Carlos, I think, is on the line while I check on the...
Is Director Celia Carlos still with us? Director Carlos?
Yes, ma'am. Good afternoon po.
Yes, can you respond to the query or question of Kong Janet?
The general guideline, ma'am, is the rapid antigen test based on the review of literature and the initial studies are most useful if the pre-test probability is high. What is the meaning of a high pre-test probability? These are patients where the positivity of the test is likely to be high. So these are those who are symptomatic and who have been exposed to a positive COVID case. So positive means confirmed COVID case. So we can use this for example, to do contact tracing for first generation contacts of an identified or confirmed case, especially those who are symptomatic, but can still be useful even for asymptomatics, but first generation contacts of a confirmed case. So in general, those are the findings from the literature review. And as the pretest probability decreases, the usefulness of the rapid antigen test also decreases. So if a patient or a person is just asymptomatic with no exposure history and so on, the rapid antigen test might not be useful. If it is used, then there must be a PCR test which should follow the implementation of the rapid antigen test, just to be sure that a negative result from the rapid antigen test is really negative.
Okay,
because
thank you, Director
the
Carlos.
sensitivity of the rapid antigen test is quite low.
Okay, thank you, Director. Kong Janet, that would be the last because we still have two more members to ask questions.
Last question, Madam. On the supply chain, there's an allocation of 490 million. So may I ask from the Honorable Secretary, Madam Chair, why do we have to allocate a huge amount for supply chain, where in fact usually this obligation is embedded in the procurement contract with the suppliers, like whoever supplies the vaccine, kasama po doon yung supply chain. Whoever supplies the equipments, kasama po doon yung delivery up to the end user, so that we will not have all the mess that I encountered during my time. So why is it that we are now shifting a budget of 490 million to supply chain?
Can I ask Yusek Mirna to please give a rejoinder to that, and also Yusek Carol for the Procurement Supply Chain Management Office.
Yusek Mirna, then Yusek Carol Tainio.
Madam Chair, can we have Yusek Carol first? I did not quite get the question.
Okay. Yusek Carol.
Yes, good afternoon, Madam Chair and all the members. We have allocated 490 million. It's not only for the COVID, but we have 6 warehouses that were rented by DOH, and that is for the storage of our regular commodities procured not only for the COVID commodities, ma'am. That for the rented warehouse, we have for Metro Park warehouse, with a capacity of 18,000 square meters, and then the rental cost for that is 12,384,000 per month. And we also have another warehouse from Cymex, and then 2 warehouses for non-parel, a temperature-controlled warehouse, and also an ambient warehouse. So, ma'am, it's not only for the COVID commodities, that amount. It is for our regular procurement where we store our
commodities, ma'am. Yeah, thank you for that very much, Madam Chair. Yeah.
Madam Chair?
Yusek Kabutahe. Okay.
There have been reports that the temperature required for this COVID vaccine might be different. So since many things are not yet known and these are evolving, we are looking at the possibility of using the regular storage system, the cold chain system for the vaccine. But should there be a different temperature needed for the COVID vaccine, then we have to be ready. Currently, we are talking with WHO for possible additional hubs in Visayas and Mindanao, and an additional hub in here in Metro Manila to house this vaccine. The other option is there might be other interested parties to provide services, third-party services where we can store this vaccine. So Yusek Carol is currently discussing with some of those who are interested. Her name has been given to discuss with these interested third-party organizations who can help us do the distribution of the COVID vaccine. Thank you, Madam Chair.
Janet, just the last question.
Yeah, basically that's it, Madam Chair. Though I'm still wondering because is it not that expenses on deliveries kasi ang laki eh. Baka hindi po ba na yung po gastusin ng supplier, it's supposed to be incorporated so that the risk will be that from the supplier. If you accept, like example, if you accept the vaccine, pagkatapos hindi pa prepared, I mean, it will be a big headache for the department and their other directors. Why not? I mean, Madam Chair, I'm really sorry. I don't have time anymore. I would have to respect the committee. Can just pursue that in a private discussion so that we can help the department.
Thank you, Janet. Thank you for bringing that up. Secretary, please take a look at that kasi supposed to be dapat nga kasama yung expenses na yon. Kung nag-create ka ng programs, yung storage and deliveries to make it more efficient, no?
Yes.
I think pag-usapan na natin yan before when we discuss pa yung sa budget nyo on warehouse kasi you asked for budget last year for the establishment or construction of warehouses, no? And you mentioned nga kasi yung pag-stock ninyo. But I don't know what's the status of that construction, Secretary?
The supply chain, USEC Carol has the information on this. But rest assured, we will look into the issues valid indeed raised by Kong Janet and review all the considerations. So may I just ask that the chair recognizes once again USEC Carol to give us, or we can always submit to you tomorrow a report on the status of the construction of the various warehouses and hubs.
Okay. Thank you, Secretary. Just submit us the report on that. I'd like to call on Representative XJ Romualdo.
Madam Chair.
Madam Chair.
In addendum.
Kong XJ, for a while lang ha. Kong Janet, yes, can't hear you.
Yeah, can you hear me now, Madam Chair?
Yes, yes.
Just an addendum to what Secretary Duque said. Of course, I salute the wisdom of USEC Mirna and USEC Carol. Ang worry ko lang doon, if we pass on to the department the responsibility. Kunyari, bakuna yan. Pagdating kulang pala ng mga syringes yan. So problema ngayon ng DOH. Just like what we did before, like for the equipments, we had it delivered direct to the recipient. If it's delivered to the regional office, kung kulang, bahala yung supplier pumuno. O kung
syringes, Kong Janet, yung syringes ba dapat included sa mga vaccines?
It depends. Some of the vaccines kasama siya. Some of the vaccines hindi. So it depends on this. Then I heard Yusek Carol saying that these 6 warehouses rented by DOH is for all other products. So it's too many. Yung warehouse kasi parang transit point lang eh. Like before, when we procured equipments, we don't allow delivery to our warehouses. Kasi pag may reklamo, wala kang makausap na supplier. I mean, that's a help to the department. So maybe that can be discussed in another forum, Madam Chair. But precise for me to say, aside na sayang yung malaking budget for supply chain, siguro yung mas importante yung risk. Because from the supplier, it should go to the end user. Para kung may problema or kung sira or may kulang or whatever, let the supplier handle the problem, not our doctors, not our regional offices.
Thank you, Kong Janet. Kong XJ, you have the floor.
Thank you, Madam Chair. Just a very quick query now to the DOH on one of the measures in Bayanihan 2 is the provision of COVID-19 testing centers in tourist destinations identified by the DOT, and the establishment would be in coordination with the DOT, the LGU, and the DOH. So I'd like to ask, we know that it was announced that the president will be signing Bayanihan 2 next week. I'd like to ask the DOH, what type of assist, or what were the specifics with regard to the establishment of COVID-19 centers in tourist destinations will be? I was just in a Zoom meeting with the DOT, and they did confirm to me that my province will be among those identified. So we'd like to ask lang, what can we expect with regard to that measure to support, from the DOH with regard to that measure to support tourism in the country, Madam Chair?
Secretary?
I think this is a health facility enhancement program concern, and I'd like to request Director Gorgolon or Yusek David to please respond to the question.
Director Gorgolon.
Hello, good afternoon po. Yeah, we just had a coordination call with the Undersecretary of Tourism 2 weeks ago, informing the HPEP that molecular laboratory establishment of RT-PCR Sir, establishment of RT-PCR molecular laboratory will be done in the tourist destination area. So what we do was we asked the Department of Tourism to submit to us the sites. But we will include that in our Bayanihan part 2, sir. Thank you for that.
Okay. So it's RT-PCR. So the testing facilities will be RT-PCR facilities.
Yes, sir. Yes, sir.
Oh,
Thank you.
okay. That's good. Kasi kanina, Secretary Berna mentioned antigen. Pero yeah, with the concerns raised by Kong Janet, we'd be more comfortable actually na RT-PCR. So with regard to that, we actually started coordinating already with RD Subaan. So we'll just continue to work with him on that for the establishment in our province. So that's actually what I wanted to ask, Madam Chair. Thank you. Thank you very much.
Thank you so much, Kong XJ.
Chair,
Yes,
can I
yes,
just add something?
Secretary. Yes. Go ahead,
Yeah.
Secretary.
We will have to recalibrate our strategies with regard to the testing labs in tourism areas. In the light of the fact that we have already developed the algorithm for the rapid antigen testing, so that might prove to be more cost effective than RT-PCR. But of course, if there is the capacity to do RT-PCR or the need to build the capacity right away, we will do that immediately. But again, I emphasize that we already developed the algorithm for use of the newly developed rapid antigen testing modality. So thank you, Madam Chair.
Secretary. Secretary.
Yes, Madam Chair.
Yeah. Few weeks ago, I've invited Yusek Rosette and the NTP, Dr. Celine, together with the Global Fund and Stop TB Partnership. They were mentioning it's like a gene expert that we're using right now, the Cepheid, but it's made in India, the Molbio TrueNut. They call it TrueNut. And same function lang din siya. Ang accuracy pareho ng gene expert natin, RT-PCR. And I don't know if this is available already in the Philippines, if it's FDA approved, but I asked Yusek Rosette to explore the possibility because ang magagamit mo siya hindi lang sa COVID. In the future, mawala ang COVID, we can use that for TB and HIV. And pwede siya com-based, community-based test. So, I think yung opportunity for testing instead of spending too much on RT-PCR, if you can explore lang this method of testing, Secretary.
We will do certainly, Madam Chair.
Yeah, this was endorsed by the WHO, sir. So hindi na magpapa-pre-qualify pa sa WHO. Yun yung kagandahan nito. Since nagkaka-problem po tayo ng supply ng cartridge from the Cepheid, if you have naman, you still have funds for procurement of the testing machines, baka lang pwedeng ma-explore ng Department of Health. Anyway, last to ask question is...
Madam Chair.
Okay, are you done? Sorry.
Yeah, no, Madam Chair, because just with another query lang with the input of the Secretary. Sir, kasi what Sec Berna mentioned earlier was antigen will be for pre-dep before they travel. And then the testing will be for like when they arrive in the destination. So just to clarify, sir, I just want to know lang what would be the mechanics.
Secretary, yung protocol daw po doon.
We're Madam Chair, we're finalizing the protocol. We'll submit it to the committee secretariat for dissemination to the members of the committee.
Okay. Kindly provide din po Kong XJ's office.
We will do that, Madam Chair.
Okay. Thank you so much, Kong XJ. Okay. We'll now call on Congresswoman, our Vice Chair, Ruth Hernandez.
Hi. Thank you very much, Madam
We're
Chair.
patiently waiting.
That's okay, Madam Chair. And we would like to thank you po. Very productive, fruitful po ang ating discussion today. Thank you, Madam Chair. And to each and everyone, good afternoon, especially to Secretary Duque. Madam Chair, I would like to ask lang po with regards to the fund utilization of HFEP, Madam Chair, may I know from the good Secretary that the basis in determining the priority projects under
Disbursement
HFEP,
and
Madam Chair,
utilization.
because way back 2015, I was told by our chief of hospital in Laguna Provincial Hospital, Bay District Hospital, ano po, in the province of Laguna, that way back 2015, meron na po silang sinubmit na project, ano po, yung sa expansion and renovation of the main hospital building of Laguna Provincial Hospital, Bay District Hospital. And napuntahan na po ito ng isang engineer from the regional office po ng ating pong DOH, ano po, ng regional office to evaluate the said proposed project. Pero po, since 2015 up to present, hindi po napondohan ito under HFEP. So, yun na po, I would like to ask the good secretary na sana po you can reconsider and look into this, ano po, itong project po, as proposed by our chief of hospital in my district, ano po, in the province of Laguna, para po mapondahan under HFEP, Secretary Duque.
Yeah, thank you, Kong, Ruth. We will look into this, but I would like to ask our HFEP Director, Gorgolon, if she has some initial feedback or report on the issue raised, HFEP or infra issue raised by Congresswoman Ruth Hernandez.
Yes,
Director
Secretary.
Gorgolon.
Opo, additional lang po, Secretary, kasi po we need talaga po to expand sana, ano po, at itong hospital na to na I'm tackling po mula po sa bayan ng Bae, because we want to decongest the number of patients that we have in Calamba, Laguna, in Calamba City. We have a hospital there, ano po, JP Hospital, napakarami pong patients doon. So once na ma-expand at ma-renovate at mas maraming serbisyo ang maibigay ano po sa provincial or district hospital in Bae, then we can decongest the number of patients in Calamba para dito na po papunta. Kaya po importante rin po sana na malagyan po ito ng pondo under each FEP at magkaroon ng renovation, expansion po of the present hospital that we have there right now para po to accommodate more patients. Ano po, lalo na po yung mga kaso po ng mga pagpapaanak, ano po, yun po ang medyo mataas ang number of patients that we are attending to doon po sa hospital na binabanggit ko po, Secretary Duque. Thank you.
Director Gorgolon.
Yes, ma'am. Yes, Sec. We will just submit po the report on what we had on the list for the 4.7 equipment po for the province of Laguna. We will submit the report tomorrow po. Thank you.
Okay po. Thank you very much po. Madam Chair, I hope they will furnish me a copy of that report so that I will know, Madam Chair. Kasi nga, sabi ko po kanina, this project po was requested since 2015. Ano po, Madam Chair, and until now po, hindi pa nai-implement ang project. Meron na rin po na program of work ito po, submitted na rin, and it was visited, evaluated by an engineer po from our regional office. So sana naman po by this time, ano po, and sana during my term, magkaroon na po ng realization or ma-implement na ang nasabi pong proyekto. Thank you very much, Madam Chair. God bless you. God bless everyone. Thank you.
Thank you, Kong Ruth. I think Director Hanairo is with us also. Please take note on the concern of Representative Ruth Hernandez. Kindly coordinate with her and submit the list of equipments or HTEP funding for her district. Kong XJ, do you have
Madam Chair.
any other concern?
Yeah, Madam Chair, just to, because I just like to clarify is the input given by the secretary on how it will actually work once those COVID testing centers for tourist destinations are established. Because earlier, the Secretary of Tourism mentioned a system where you have antigen testing before before departure from the airport, and then we'll have the testing centers in the provinces, in the destinations, when they arrive. And so we'd like to clarify lang with regard to what the Secretary Duque said, with regard to like the procedure or the criteria, the process, and how it will be done. Even if it's just broad strokes lang muna, Madam Chair.
Kong XJ, I think he mentioned earlier that they are still finalizing the
Mm.
protocols on that matter. Kasi
Oh, okay.
kahit ako, nagulat ako na antigen test sa point of entry, before,
Before departure.
yes,
Okay.
antigen, and then after, let's say you're going to Palawan, pagdating mo ng Palawan, that's when they're going to get the RT-PCR.
Yeah, that's what I wanted to clarify, Madam Chair, if
Okay.
that will actually be the case.
Sec Duque, is that your Secretary Duque or Sec Mirna? Is that the proposed policy or procedure? Anyone from DOH?
Yeah, we are preparing it. In fact, there's a technical working group today that's going to finalize the recommendation for IATF's approval tomorrow. So it's going to be soon, Chair.
Okay. All right. So we'll just wait for that, Madam Chair, because we'd like to.
We'll give you an update, Congressman Javier.
Yes. Okay. Thank you, sir. Thank you very much. Thank you,
Thank
Madam
you.
Chair. That's all. Thank you.
Thank you. Secretary Duque, I have few questions lang po, no? What's the status of PhilHealth board? Do you have na members?
Well, the newest member is the representative of the informal sector. I'm trying to get the exact representation.
But do you have
He is Attorney Geran, who is also appointed as president and CEO. So we have the other representations that have not been filled up, no? The expert on public health, wala pa po yan. Tapos
Sir, do you have na the quorum?
meron na. Meron na tayong quorum.
Okay, sige sir. Kasi ang dami pong concerns on the policies and procedures ng PhilHealth. Narinig nyo naman kanina during the discussion, and probably the board can address that na the soonest possible, especially yung implementation ng immediate eligibility, sir.
Yes, we will do that. We have taken stock of the issues, and we will make sure that this gets to the board at the soonest possible time, Madam Chair.
Okay. And another thing, sir, yung pending supposed to be meeting namin with Heart Center, NKTI, and Lung Center, with PhilHealth with regards to the implementation of the 70-30 or the staggered implementation. If you can check on who among the staff or senior vice president in the PhilHealth and DOH can continue the pending work of Dr. Ish Pargas.
Yes, we will. I know that there's already an OIC that has replaced Dr. Ish Pargas, and her name is Carissa Herrera.
Okay.
So she's on board. She's doing work on that now. So we will give the updates in the next meeting, Chair.
Thank you, Sec. Last question. Anyone from the Department of Health who can answer my question? From January to at least May, what's the top 10 mortality and morbidity?
The Epidemiology Bureau can give a complete answer, I believe. I have a patchwork of an answer to the mortality.
Who's heading the...
Yusek Mirna, please.
Yusek Mirna?
So ano bang...
Thank you, Madam Chair. We have different sources of information. In terms of the FHSIS, these are the reportable diseases. That's one source. The other source is our surveillance report, where we survey our different infectious diseases. And unfortunately, if it's the overall top causes of mortality, it's a very late data because we rely on the PSA, the Philippine Statistics Authority, where the registries are for the deaths. But offhand, they're still the same in terms of mortality. Number one is still the heart cardiovascular diseases. I don't have the figures now. And in terms of morbidity, I don't. In terms of the morbidity for overall, we know that some of our measles cases are increasing. Some of our dengue cases are increasing in certain areas, but we do not have a. I'm sorry, Madam Chair, I don't have the exact figure, but I can give you, unless there's somebody from EB who is here.
Yes, please. Is there anyone from EB who can answer my question? At least first 3 months of the year, can someone give me an idea what's the mortality and morbidity top 10? Anyway, kung wala pong sasagot,
Can I say something?
Yes, Dr. Abanilla.
This is not exact, but just to give you an idea, no? Before the COVID time, the number one mortality cause in the Philippines is cardiovascular, followed by cancer now. It used to be hypertension and related. In about 6 to 7, it's diabetes, mostly cardiovascular. But the figures are, in a year, there are about approximately 140,000 to 150,000 deaths due to cardiovascular, giving it a figure of about 12,500 a month. So now, if you look at the mortality ng COVID, 3,000 lang. So I don't think it is not going to change much the statistics. Cardiovascular talaga.
Thank you so much, Director Abanilla. You know why I'm
Chair.
that?
Chair.
Yes, Secretary.
Yeah, let me just give you a very quick rundown of the common causes of deaths in the Philippines. As of 2017, we have number 1, ischemic heart disease, number 2, cancer, number 3, cerebrovascular disease. Of course, number 4 is pneumonia, and then next is diabetes mellitus, and then hypertensive diseases, chronic lower respiratory infection, respiratory TB, other heart diseases, and remainder of the diseases of the genitourinary system. So these are the 10 leading causes of death in the Philippines for 2017. Thank you.
Thank you so much, Secretary. The reason why I'm asking po kasi, because of the overwhelming problem of COVID, yung mga non-COVID related natin, medyo nako-compromise na sila at nagsasakripisyo na sila. Secretary, every day, 24 hours a day, 7 days a week, I've been facilitating patients na hindi in-accommodate para sa follow-up check-up. Tinatanggihan ng Hospital A, pumunta sa Hospital B, hanggang nag-worsen, and eto na, naging emergency. These are all non-COVID related. And because of the COVID problem, parang eto naman, hindi na natin nakikita mga Pilipino na suffer, no? Sana lang din ang panawagan ko, balansehin natin ang pagtingin. Alam ko mahirap ang trabaho niyong lahat. Pero yung pagtugon hanggang sa baba po, up to the lowest level, the RHUs, the rural health units, sila din nakafocus na lang sa COVID. All other problems hindi na po nabibigyan ng pansin. And talagang napakabigat, no? Kung siguro ang isang individual ay katulad ko na hands-on sa pagtingin at pagtugon sa nangangailangan nating mga kababayan, mararamdaman nyo ang hirap. Kasi ako hirap na hirap. Sobrang ramdam ko ang bigat. Hindi ko na alam saan dadalhin, saan ko. And I'm thankful sa DOH hospitals, to our specialty hospitals na ina-accommodate. Alam ko they're trying their best to accommodate yung ating mga requests, especially East Avenue, Rizal Medical Center, ang Heart Center, ang NKTI, ang PCMC, ang Lung Center. Pero ito yung mga kababayan ko na nakaka-access sa akin. Paano yung mga tao na walang kakilala? Hindi alam saan pupunta. Kaya ko lang po nire-raise ito is that sa mga kasamahan po ninyo sa Department of Health, tingnan din po natin yung iba pang mga problema sa kalusugan ng ating mga kababayan. Napakadami ngayon na malubhang-malubha na po na nandun lamang sa bahay nila. So yun lang ang aking panawagan, Secretary. Naiintindihan ko po ang katatayuan nyo, nauunawaan ko po lahat yan. Pero mas madami po ang may sakit sa puso kaysa doon po sa COVID na nangangailangan po ng atensyon ngayon. Mas marami pong may tuberculosis na nagka-COVID ang namatay na po. Kung bilangin po siguro natin, kung himay-himayin natin yung namatay sa COVID at bilangin natin ala na may sakit sa puso, may TB, ang may nagda-dialysis, makikita po natin. So, yun yung panawagan ko, no, na makita din natin, bigyan ng pansin, Secretary. Bigyan nyo nga po ng mandato o task yung mga namamahala sa baba na ito ay bigyan ng pansin. Secretary.
Maraming salamat po sa inyong magandang paalala. Ngunit ibig ko lang din pong dagdagan na ang DOH, kinikilala po namin yung nagiging kakulangan ng mga serbisyo para sa atin mga non-COVID patients. Kaya naman ay madalian na binuo ng DOH at ang kanya pong mga partners, ito pong telemedicine. At ang statistics po natin ngayon, yung total consultations through telemedicine or telehealth has reached 60,324. Ang COVID-related consults ay 25,626 at ang non-COVID related consults, tama kayo, mas mataas pa nga kaysa sa COVID as 34,698. Pero ito, iba-ibang mga sakit na po ito, no? Ng atin pong nakalap mula po sa ating telemedicine data. So palalawigin pa rin ho natin ito. Hindi pa ho kasama rito yung aktual na mga non-COVID related emergencies or serious conditions na hindi po nagagamot sa mga ospital. So tinitignan po natin ito na wag baliwalain o isang tabi ito pong mga ibang mga sakit na sa totoo lang mas malubha pa nga sa maraming aspeto itong mga sakit na ito. Kung iisipin natin, ang bilang na namamatay sa TB, halimbawa, mas malaking di hamak kaysa sa namamatay dito sa atin na COVID severe critical COVID cases. No po? Ganun din sa mga NCDs. No? Marami po tayong mga problema rin ng mga sakit at ang mga bilang ng mga pumapanaw ay sadyang mas malaki. So ito ay lahat pinag-aaralan po natin kaya naghudyat naman ito sa atin na makapagtatag ng telemedicine. So far, successful naman yung telemedicine natin. Tapos yung sa atin naman One Hospital Command na tinutugunan both COVID and non-COVID concerns, 90% naman ang nagiging success rate in terms of closing out the issues with regard to the various health conditions for which they consult the One Hospital Command Center na kung saan meron po tayong maraming mga call center agents na nangangasiwa dito. Diyan po sa Guadalupe yung ating One Hospital Command Center.
Yes, Secretary, malaking tulong po yung nagkaroon kayo ng One Hospital Command Center at kami, naka-experience kami ng pagtawag dyan at sabay-sabay naghahanap ng hospital na pagdadalan. But Secretary, yung sa telemedicine, if you can strengthen lang, na sana yung patient navigation, no? Yung pagkakonsulta sana ay kung saan kailangan ang pasyente na pumunta at kinakailangan niya ng espesyalista na isasama po yung navigation. Kasi I have reported cases po na tumawag dyan po sa ating hotline sa telemedicine natin pero hindi na nila alam saan pupunta kasunod. So yun lang po yung suggestion natin doon whoever is in charge po doon sa telemedicine.
Yes, Chair, we will do that. We will continue to improve our existing capacities and our systems for better patient navigation and referral from all the way from our temporary treatment and monitoring facilities, isolation quarantine facilities, to the levels 1, 2, and 3 hospitals, up to the apex hospitals for appropriate care depending on the clinical manifestation of these COVID cases. So talaga na po, yung naka-network na po tayo at yung ating referral system ay patuloy na pinauunlad po natin para mas makatugon kaagaran sa mga pangailangan po ng mga COVID patients and non-COVID patients as well.
Okay, thank you so much, Secretary. That's all for today. Maraming Kong Jun, do you still have concerns?
I'm okay. Okay na ako, Madam Chair.
Okay, thank you so much, Secretary Duque, and to the whole family ng Department of Health for bearing with us. Napakahabang meeting but productive and fruitful po. So lahat po ng reports, data na hiningi po ng ating mga mambabatas, pakisubmit lang po sa Committee on Health. Maraming salamat po sa inyong lahat.
Muli, sa ngalan po ng Department of Health, kami ay nagpapasalamat po sa pagkakataon ibinibigay ninyo sa panahon po ng ating budget hearing at nauna na po ang Committee on Health para po talakayin itong mga health budget for 2021. Maraming salamat po.
Thank you so much, Secretary. Kong Jun, the favorite motion, please.
Madam Chair, if there are no other business to attend to, matters to attend to, I move the meeting to adjourn.
There's a motion to adjourn this meeting. Is there any objection? Hearing none, the motion is approved. Thank you so much. Alam ko nagutom kayo, but ako din.
Thank you.
Ayan. Thank you
Thank
so
you,
much.
Madam
po.
Chair.
Thank you,
Thank you.
Madam Chair. Thank you, Kong Helen.
Maraming salamat
Thank you,
po sa inyong
Yusek
lahat.
Mario Villiverde.
Thank you.